another Zoom class that was scheduled a long time ago. But I want to wish you a marvelous experience today. Another Zoom class that was scheduled a long time ago.
Yes, thank you for your.
Wish you a marvelous experience today. Another Zoom class that was scheduled a long time ago.
Yes, thank you for your.
Wish you a marvelous experience today. Sorry.
Thank you very much.
Yes, yes, you're welcome. And I look forward to perhaps presenting at the next event.
Yes, we are looking forward because this year we change more bigger. We have more people, and I hope we're doing a little better. But honestly, too much organizing the job, and always have something happen. But
I know.
But we try our best.
Yeah.
But today definitely it's an English one, so it's good.
Yeah, well, all these things require a lot of preparation, of course.
Yeah, it looks like we're already online. Everything looks fine, and we met a little bit problem with the new webinar because the webinar, because the webinar, we have to separate the group to the two groups. How can you first go in the webinar waiting for us? That's very special.
I used the link that you provided.
Yes, I do, but even I'm not beginning, you're already there, right? So have the link.
Well, you sent out two links, Jack, I think. One is called a panelist link, and the other one is called, I suppose you have a
attendance
link and also a participants link. But it's possible that you may have sent out, as the reminder, you may have sent the panelist link to everybody.
No, I don't. Because if I send that, because this year, especially first day, we have a lot of people join us. So that's a reason we cannot do that. If we do that, it's too much.
Yeah.
Too very annoyed. Somebody will forget to turn off the mic. Somebody forget this.
I know. But you know, as the host, you should have the capacity to have somebody keep track of anybody who turns on their microphone to turn it back off.
Yeah, we do that, but still have problem.
Yeah. Well, we've done a lot of these types of programs, and yes, there are many problems. Allow me to get out of your way so you can keep working on it.
Thank you.
Wish you well.
Thank you for your support, and thank you for your help.
Indeed.
And we will meet you next year.
Yeah.
For invite you. I'm happy to invite you.
Yeah, plan earlier, and then I can
understand
to promote.
Yes. Yes, we need to do that more earlier.
Okay, good day, sir.
You have a good day. Looks like good. Beginning work, everything. 哎，你好，欧老师，您上来了啊？你开一下视频，然后你试一下 share screen，如果可以，您就等一下就用这个开始了。
哎
嘿嘿，你好，你好，谢
哎，
谢你啊，
你好你好
这么早，
，Yeah，
我还想说可能会太早了，对你。哦，我想起来你有2个小时时差。
对我们比较要晚一点，要早，实际上我们比你们早，我们
对对对，就
有
是你其
3个小时
实是有2个小时时差。你试一下
3个小时，
share screen，你试一下 share screen 行不行？
嗯，来看一下啊，你现在是几点啊？你现在是几
我现
点？
在是7点48分，
哦，那是差2个小时，对，
你那儿几点啊？
我现在9点48分，
哦哦，真的就是。
是2个小时。等一下啊，这样可以看到啊。
看得到，可以，那你这个没问题了。
等一下，
那我们等一下就开始。
那我是第一个吗？
你是第一个，你不是
哦，
8点吗？我不是跟你说了，您准备好就你就是第一个。
行，没问题。现在看到啊。
对，看得到。
我就是要把因为我
对，
准备的是
陆老，
中文版。
你接受一下那个我拉你的邀请，设为嘉宾的邀请，你就进来了。哎，好了，
我应该已经
可以。
接受了。
对对对
嗯，我
对，
我我主要是
我们今天
要把那个
欧阳博士第一个，然后陆老第二个，杨官福老师第三个。哎，杨老师联络上了没有？陆老，我跟他一直联络不上，不
联系了，
知道为
他知道，他记得，他说他记得，没问题。
他进来吗？
他进来现在还没有，但是他知道时间我都会发给他了，他应该没有问题。
陆老师好，陆老师好。
哎，你好，你好。
Yeah，很荣幸，很荣幸看到。
哎呀，这老朋友见面还是很开心。
最近没有，最近见的比较少了。
见的少，大家都没有开会嘛，都是Zoom 上开会，但是
对，
没有
时间是半个小时是吧？
是，
我是要好，
半个小时。
我会提醒您一下。
好，没问题。
欧阳帅哥还好吧？以前
挺好，挺好。
帅哥永远好，我们欧阳老师越来越帅，
不敢，不敢，不敢。
真的，你是那个形象长得很好，这是天然优势。
是这样，是这样。
你的形象更好，还很健美。
你们都
是不是？
你们都是。哎，我这个背景上去，他这个头好像不正，光线可能是有点不太正常。
陆老，你可以把那个屏幕去掉就好了，就是
背景啊
你对背景，你把背景换一下。
好，哎，哦，这样就好。这样反而还好。
哎，杨老师他在群里边问我回答他，他也没看到吗？
我跟他说了，他说他记得，他不会忘。我说是，应该是不会有问题的。
还有几分钟就开始了，
他可能会。
我们会准时开始，反正。哎，你好，杨老师。欢迎杨老师，欢迎杨老师。 您试一下开视频呢？视频打开一下行不行？
我好，现在呢看到哈，
我看啊，哎，看到了，看到了，杨老师，完全看到。您试一下 share screen， 如果可以，就一切正常了。
好的，好的，好的，好，那也就应该可以了。
好的，您就留在线上，待会儿上来就好了。
OK，好。
太好了，太好了，现在基本正常了。好，谢谢。
第6届世界整合医学大会及新冠并发后遗症防治论坛，2022年12月16号到21号，美国国际医药大学现场和深圳及网上隆重举行。是中联、国会议员、工程院院士、国医大师、太极、气功大师等各方祝贺。在主办单位世界整合医学学会联合会主席、国际医药大学校长王英球博士团队精心组织下，参与此次论坛的包括工程院院士、国医大师石学敏。
第6届世界整合医学大会暨新冠并发症后遗症的治疗论坛将于2022年12月16号到19号在美国国际医药大学及中国深圳线上线下隆重的举行，我表示热烈的祝贺。
韦贵康，
尊敬的王元初主席，尊敬的傅学礼基金主席，尊敬的高金炼基金主席，我谨以我个人的名义，并代表世界手法医学联合会对这次大会的召开表示热烈的祝贺。
李殿贵，
大家好，我是李殿贵，支持第6届世界整合医学大会，我今向会议的隆重召开表示热烈的祝贺。
黄正明、王乔华、魏坤、张彩芳等18院士，也有抗疫英雄方邦江、张卫军、张海生、哈佛大学程晓明、张文丽、北大刘峰、川大格桑、朱勉生、焦顺发、江丹、陆彪、郑建华、林丹前、朱正高、田海河、陈叶梦、苏华昌、郭廷英、辛长山、陶艺清、王德凤、康淑兰、任丽萍、林玲、邢梅、唐铁军、王仲斌、杨长俊、卢志鹏等全球100多位中西医专家将在总论坛和18个专门的论坛做精彩报告，并由南方蜜雪芳家居科学有限公司、美国汉医疗公司和中国领卫生物等提供赞助。智慧医学查病因专委会李存才和运气能量针专委会李玉静，日本整合医学分会穆斯若男和加拿大整合医学分会黄国健等各分会主席积极参与大会并公益出席。所有参与医生组织者均义务参与。QH 系黄网提供技术支持并直播 ，YouTube 同步直播。大会亮点：1、阻止新冠、流感传染，防治新冠并发和后遗症；2、讨论治疗中风方法；3、太极气功医疗运动处方标准化研究。大会执行主席、国际医药大学继续教育及推广学院院长傅学礼教授表示，东南亚地区都知道中风后一定要做针灸，因为其效很多人快速恢复正常，但是西人并不知道针灸对中风的奇特疗效。本届大会将积极推动，让西人接受包括中医针灸、拔罐、太极内功在内的整合医学对中风健康的辅助疗效，让中风病人更快速恢复健康。大会特邀中风专家醒脑开窍针石学敏、醒脑开窍针、焦顺发头针发明人王英秋何宇、任月玲神经触及、张英结构、卢胜春针刀、李烨结构治疗、傅学礼气针灸、黄国健小刃针、石雅洁针刀、穆自若男手法、吴立峰干细胞、林胜勤放血、林永泰等针、曹世和盲针、陈平清头针、丁兆软组织、李荣刚天一针、杨长军综合、龚昌正文献、李云海中药、欧阳辉针灸、Steven C 上整合等共同做专题讨论。 加州通过针灸师交病人练习太极，气功15分钟，保险公司可支付60到80美金。但由于全世界没有标准，所以世界整合医学联合会准备成立太极气功医疗运动处方标准委员会，汇集大家共同来研究讨论制定标准并培训。参与者包括以下人士。等专家学者在中国深圳论坛定于北京时间12月17到18日，在深圳好日子皇冠假日酒店举办，众多学者参加。将启动国际新冠后遗症康复中心筹建仪式，与肇庆市人民政府、广东省及时雨公益基金会、中医光子生命科学院等启动脑瘫儿童康复专项基金。美国国际医药大学举办招生推介会等活动。在美国硅谷秘书长邓立峰组织下，2022年12月18日晚18点到19点30分，在国际医药大学和语厅举行全民大健康之夜暨圣诞元旦晚会，并举行临床医学院和语大医馆、健康管理学院、健康520电视栏目隆重剪彩。在新的一年到来之际，一个历史性序幕即将拉开，整合医学专家团、联合诊所、综合研究中心、中西医居家医院、高维康乐园将全面启动，并正式面向社会。大会共6天，提供48个加州和全美技教学分，并赠送8小时学分。特别欢迎全社会民众参加。大会为公益活动，请浏览我们的网站。
Okay, thank you everybody. So right now, it's today. Today the Congress will beginning. 那个 Rose 你到了吗？
好，我到了。
好，那么 Rose 你那边光线不行呢，看不到图像。
那是什么有问题？我这边光线很好。
你要把那个屏幕去掉，用背景调一下。
Okay, let's see.
对，背景调一下。我们的主持人 Rose。
好了，现在好了吗？
可以。那个 Rose， 你要关于每个人的简介哈，都在那个 D1 D2 那篇文章里。我等一下再发一次给您 ，in case 你没有那个文件。
好，发微信里。
是，谢谢。我们现在就要开始了。好，各位朋友，大家好，大家早上好。今天是我们大会进行的第3天，非常感谢前2天有许多全球的听众一直在关注我们的大会，也给我们一起度过了非常充实的2天。我们大会还会继续进行3天，每天早上8点都欢迎大家来到我们的。全天您可以开着您的手机或者电脑设备来参与我们全球没有界限的、没有极限的一个大会。谢谢大家，今天我们就开始今天的大会。下面邀请主持人 Rose 用英文讲一下。
Well, welcome to the 3rd day of the 6th World Integrative Medicine Conference and Forum on Prevention and Treatment of COVID-19 and its complications. The Congress has been held for 2 days, and we really want to thank all the participants, especially viewers around the world in the past 2 days, for your support. And we're very grateful to all the top healers around the world participating in this conference. And so far, we have presenters from over 50 countries. We'll be presenting the latest clinical experience and cases, and also research on COVID-19 treatment, prevention, and also its complications. We also have a forum focusing on stroke using integrated medicine. And so today we have our English program, and then we would like to invite you to watch from whatever channel you can, from YouTube or from the Chinese platform Huangqi, for free. This is a public event, and so you're all warmly welcome to participate in the conference. Thank you. Back to you, Dr. Pu.
好，下面我就介绍今天第一位讲者欧阳辉教授，他是来自于休斯顿针灸双执照医师。中医学院博士班导师，全美中医药学会秘书长。他今天的讲解的题目是针灸整脊诊疗颈肩病症。
And today we have our first presenter, and Dr. Xu Gui
No
Yan
problem.
from Boston, and his topic is on cervical scapular disorder.
Yeah.
好，下面时间交给那个欧阳医师，请您直接用英文了就好，谢谢。
Thank you very much. Thank you, Dr. Fu. Thank you, Rose. Very honored to be here. Present this topic is about the acute care therapy for the cervical scapular disorders. We're all gone through this pandemic and very stressful period of time in the history. And although I'm not the infectious expert, but we do cannot avoid any influence about from the pandemic. And during the pandemic, we have to prevent to get infected, and not just ourselves, but our patient. And now, after the pandemic getting subside, we also treat a lot of patients with the post-pandemic syndrome, physically and mentally. We can use the medication. Actually, not so much, so many specific treatment for the COVID-19, but we can use some herb, either direct treat or support our body to combat with COVID. And here we are as an acupuncturist. I'm also a chiropractor doctor, and we are now can use acupuncture, chiropractic manipulation, and other manual manipulations to help our patient. Now we're talking about the acute care therapy for cervical scapular disorder. That's one of the application of our own special skill for this kind of patient, not just for patient, but also by ourselves. That's all. My neck should certainly feel better. See? Yeah. Here we are. The neck and shoulder pain is still a big problem, even getting worse in the future, because the usage of electronics. And contemporarily in humans, neck and shoulder pain is extremely common and costly. In the medical term, it's called sprain and strain. It's defined as excessively stretch and twist cause neck and shoulder injury. And the sprain and strain, if it's repeatedly happen, it's also lead to the degenerative cervical spine disorder. And the pain cause injury. Actually, it's also put a lot of stress, not physically, but also mentally. So here in the acute care therapy, we call it cervical scapular disorders. And it will affect actually in your neck, there's autonomic nervous system, there's a switch exists between sympathetic and parasympathetic nerve system. It can adjust organ function and in turn to treat mental disorders. So acupuncture therapy for diagnosis and treatment for cervical scapular disorders, we combine acupuncture, chiropractic, stretch, and exercise, try to be more accurate, safe, concise, and efficient. Here's a picture show the distribution of the pain in the body. See, we always say in the neck and shoulder area. Yep, there's a lot of red. So we always say we carry the stress, all the stress of the shoulder. That is mean neck and shoulder very much relate to the stress, the pain. Yeah, there are different terms. Your pain, injury, disorder. Yeah. And disease. So by the study and practice acupuncture and chiropractic, I developed this disorder. This for this disorder is called acupuncture therapy. It is an integration of the Western medicine and TCM, traditional Chinese medicine theory. Mainly the syndrome differentiation from the TCM part combined with the disease differentiation from the Western medical part. So it's kind of a individual life structure function of the human body differentiation. That is the combination of modified anatomy plus the traditional meridian connection of the whole body. So with the syndrome differentiation, we put the whole body together and diagnose and treatment. They can like very closely and combine together. And at the same time, the disease differentiation help us update our new knowledge, can apply the most updated science and technology to our practice. Here's the part of your spine. Mainly, we can separate your body, two parts. The upper body is cervical spine and related upper body, and the lower body is a lumbar spine and related lower body. Here we can see in this graph, and cervical, this is from neck anatomy, the detail, we can detail to each vertebrae of the cervical spine. And then we can furtherly divide them to different segments. That is according the function unit of our body. We can see cervical, you can furtherly divide in the occipital, cervical, and cervical scapula. And the lumbar spine, you can further develop in the thoracic lumbar or lumbar dorsal, and the lower part of the spine we can define as the lumbar sacrum. And today we're talking about the cervical scapular disorder. Here, sacrum again. And the cause for cervical scapular disorder is there's a direct, indirect disorder. Direct disorder including the collision, fall, improper exercise, and bad posture. And the indirect disorder including what we call the emotional stress. Yeah. This is the experiment from the New York surgeon. He tested the stress on the head by the posture and the head position, and was evaluated with the tilt of the head. He found out the stress on the spine dramatically increased with the angle of your head and neck. So now we all know it's very popular, text neck. I introduced this to the Chinese community. Now it's everyone know it's 手机脖. Here's in the WeChat, we reported the first in 2014. Now we're talking about the pillar motor reflex. We probably don't really notice that, but when I say if you catch cold, you are easily from the head and neck, right? When your neck was cold, head and neck was cold, then you know you're getting the cold or flu, even pandemic, the COVID. And we all know you have goosebumps. That's a typical sympathetic excitement. You can do an experiment. You put an ice cube behind your neck. Actually, this is a 大椎穴, right? GV20, Galvez 20, and you can feel a chill, the goosebump goes up. And when you watch a movie, you listen to music, you can have the same feeling. This is all the phenomenon of sympathetic excitement. See, when you see in the cold, dark ocean, you watch the Titanic, you will feel cold now yourself. This is called the pillar motor reflex. So the stimulus, including the temperature, audiovisual, mechanic, will cause pillar motor reaction. It was, but it will change the structure or function of our body. We have to talk about the more detail on structure and neuroanatomy. Here we are. This figure shows the post-cervical triangle and the spinal accessory nerve. Yeah, we can see the spinal accessory nerve is supplied the trapezius and SEM. And these nerve actually have not just a spinal nerve, it actually also not just the cranial nerve. We know the accessory nerve is cranial nerve 11, and it's not just a spinal nerve, cranial nerve. It's also a spinal nerve because it's divided and it has two parts, cranial and spinal root, and the cranial nerve combination actually is later joined the vagus nerve. That's why it's closely related to the parasympathetic nerve. Then the spinal component actually supply the muscles, especially the trapezius muscle. And the trapezius muscle, that's why we said trapezius muscle very closely related to the parasympathetic nerve. At the same time, we can see, so that's why we use the vagus nerve stimulation to treat all kinds of problems, not just physically, but also mentally. Here's a vagus nerve stimulation, the history of that, and I don't have time to discuss all this, but it's very popularly used in pain management and other, invasive, transcutaneous, And another part is stellate ganglion block. That is actually, it's also, we can see the, we call star ganglion here, stellate ganglion. That actually is on the sympathetic ganglion chain, and also located around the neck and shoulder. We don't have much time to talk about this, but I put it here. What I want to deliver the information to you is that is the neck and shoulder is also closely related to the sympathetic system. That's why we said neck and shoulder is a switch of your sympathetic and parasympathetic system. Here's a suboccipital acupuncture, on the neck. This is the lateral view. All the acupuncture point. Very interesting. Posterior review and auto view. So the reason I'm talking about this is the modern anatomy actually very consistent with our Chinese medicine. In Chinese medicine, the stiff neck called 落枕, literally is a dropping pillow, and it's caused by the low pillow, but actually it's related to probably the sleeping posture, but not just that. And in Chinese theory, it's said very close to is caused by wind cold, very close to relate to the wind plus cold. Actually, it's not just this traditional view of Chinese medicine, but it's not just old customer or what. Now we are in, it's also applied to our modern society because we use so much of air conditioning, the artificial environment of inside the room house. Yeah, we also very easy to catch cold. Yeah, and it's start from your head and shoulder and neck. So in Chinese theory, we said there's an important point on the shoulder. It's called Jianjing, GB21. That is a intersection of hand and foot Shaoyang. And Shaoyang is a pyramid of yin and yang. The neck and the shoulder are the switch of the human body function. Yeah, and we have a very common manipulation in twin Na. Everybody who is trained with twin Na knows the Na Jianjing, grasp shoulder wheel. Actually, it can trigger the pillar motor reflex. Not just that, not just mechanic, but also reset autonomic nervous system, affect your body. This is the pillar motor reflex and its application. We can explain the common how you catch the common cold, and it can adjust the internal organ function, and in turn we can treat the mental disorder. But here we are. I mean, it's also that's how I got the inspiration. I wrote a little article called the shoulder, the wear in the shoulder. Yeah, why it's called a wear instead of window? It's not just a window in the surface, but actually it leading to your body cavity. Yeah, that is the article I wrote. The neck and shoulder are the period of the body structure, the switch of the body function. So based on the observation of the human body structure and the treatment of this by the Asian Chinese medical expert, and compare the findings of modern anatomy and the physiology, the author often have the sense of inspiration through this wear in the shoulder. So
5 minutes. 5.
Very good. All right. Here is the acupuncture accident, talking about acupuncture accident. And below the shoulder wear is the apex of the lung. So without the acupuncture, it's kind of like a little bit dangerous area for our treat with acupuncture. And even we do pain management, do the steroid block, we need guided by the X-ray or other things. But we use acupuncture, grab the shoulder wear. Actually, not just without acupuncture, we actually combine with the manipulation. grasp shoulder well. It's not only safe, but also very powerful. That's the things I would like to deliver the information to. Just optimize all different technique. Yeah, clinical technique. We can put them together. Yeah, for our acupuncturist, our TCM doctor, we not just do acupuncture. We can also use a lot of other things like other technique like Tuina or chiropractic or PT. We can use that. And here is a very good example, the grasping shoulder wear. It's not just induce perspiration or release exterior, but also let the pore open and mind wake up. But also it is intersection of the hand and foot shao yang and the yang link, yang wei. And it can adjust the internal oxygen through the sympathetic parasympathetic system. That's why we use this in our acute care therapy. We don't have time to go too deep, but if you are interested, you can we can discuss later, online or on site. Yeah, I do teach at the school, different school for the doctor degree program. Our students are very excited. Yeah, not just learning the acupuncture, but also different method manipulations, physical therapy. We just optimize everything together. Here we are. This is acute care therapy, including the examination and treatment. We don't have time to go detail, but here in the neck, cervical, scapular area, the examination is through the posture, range of motion, and the muscle testing. And here the range of motion is not just the whole cervical range of motion, but we can detail to the each segment level. And here is the muscle testing we specially used on neck shoulder area. Two muscle actually very important. The levator, upper trapezius, upper traps. Here's upper cross syndrome. A lot of this is the main range of motion. Yeah. Here we are. We detail to each segment, and we can see the flexion, extension, lateral flexion, and rotation. We can see flexion extension mainly is C4-5, and lateral flexion is mainly in 3-4. Here's the each segment, and that's another part. Yeah, it's the upper part of neck. It's different from the lower part of neck, lower cervical. Yeah, we can see this figure. These slides, yeah, summarize the examination. Here, yep. So this is a detailed testing, muscle testing. mainly two muscle. One is levator, one is and we even have the animation here. I'll show you. See, yeah, that's then this is upper trapezius, upper traps. You can see that. We have to differentiate. That will greatly improve our success rate. Here, the treatment including the acupuncture, chiropractor, or movement, acupressure, stretching, and exercise. This is a acuchiropractic needle. That's what I mainly use. Yeah, main point, local, proximal, distal, and it's based on the meridian differentiation. Yeah, we have acupuncture mat here. Dr. Lu, we know the acupuncture differentiation from acupuncture is mainly meridian differentiation.
1 minute.
All right, this is the levator, the local point. In Chinese medicine, we call the usher point. Actually, here we use the trigger point, mainly levator scapular trigger point and upper trapezius trigger point. That's a proximal acupuncture point. Of course, shoulder weight is the main one. Then the treatment, we can see the step by step. People come here, we do acupuncture first. You restart from the distal. Here, major point differentiate with Chinese meridian theory. We use Shaoyang, hand Shaoyang, and foot Shaoyang, depend on your condition. And acupressure mainly grasp shoulder wheel and other manipulation. Then the stretch and exercise also differentiate. I mean, we have the muscle testing already diagnosed as levator and upper trapezius, right? And when reach people already relaxed by stretch all this treatment, we can, I mean, just furtherly do very slight adjustment, you will achieve our goal. Then after all this treatment, people are already very familiar with all this movement. Then we let people bring back the exercise they can do themselves. Here, for especially for those cervical exercise, we call the very easily. It's look up, looking down, look left and right, rotate the shoulder clockwise and counterclockwise, and turn left and right. Yeah, when we have time, actually, we can do it now ourselves here. I have a lot of more things here to talk, but we have limited time. This is a exercise. Check if no. All right. My report is here, and thank you very much for your attention. If you are interested, go to our website or our Weixin or that site.
One.
Yeah.
Oh, thank you so much, Dr. Ouyang. And thank you so much for sharing your research and also clinical experience on this very important condition. And computer neck or testing neck, as we all know, this condition impacts nearly everyone. And Western medicine has very limited options. And thank you for combining different modalities, including chiropractic care and also acupuncture, exercising. And we hope you can develop a protocol so everyone can follow. And because, as you know, Western medicine use primarily pain medication to treat any kind of pain, including cervical pain and neck pain. And as a result, there's a wide abuse of opiate. And so using traditional medicine and integrated all these modalities, natural modalities, which have very little side effects, I think will benefit everyone. So thanks again for sharing your research and clinical studies. Thank you, Dr. Ouyang.
Thank you. Actually, we all
Thank you so
we
much.
do have the protocol for each segment, very detailed, not just for the therapy. The therapy is kind of optimized, all different technique together, and actually fit in our acupuncture practice. Not for the chiropractic, you don't have to do the chiropractic adjustment because that probably out of place, but out of scope, I mean, practice scope. But we can use some stretch, acupressure, even trainer manipulations. Yeah, that's we actually particularly designed for our acupuncturists to fit in our scope.
Well,
yeah.
Thank you so much, Dr. Ouyang, for sharing your expertise. Back to you, Dr. Fu. We have to move on to our next presenter.
谢谢欧阳医师，
Thank you
这
very
个
much.
这个针剂非常的棒，联合起来使用。好，下面我们邀请这个我们邀请我们世界整合医学学会联合会的终身共同主席，也是我们专家委员会的主任，也是我们全球都非常著名的医学权威、中医药和跳针的，特别是跳针的发明者、推广者。好，请大家聆听这个陆彪教授的演讲。
Well, next we have a very well-known doctor, and also he's a lifetime member and the chairman of the Congress, and Dr. Lu Biao. He's the chairman of the Northern America Traditional Chinese Medicine Alumni Association, and to share his research and the clinical studies on the traditional medicine acupuncture treatment for stroke. Welcome, Dr. Lu.
Thank you very much, Rose, and thank you for Jack Fu. And so far, we had such a successful conference the last couple of years. For last few years, this year, last 2 days, I learned a lot from all the experts around the world. So I feel that's really a big honor to be here to share my personal experience. So I just want to make sure can you see me okay?
Yes.
Yeah, you can see everything is okay, right?
Yes, everything great.
Okay, very good. Okay.
Share screen, everything good.
Okay, very good, very good. Just 1 second. Okay, yeah. Okay, so today I'm going to talk about the stroke because there's yesterday, a day before yesterday, so many experts share their experience for the stroke. I really feel it's a great topic, and I think that's what's going to help the people a lot. Because the point is, when you go to China, you ask people on the street, you say, how do you think what acupuncture can help the condition the most? Well, I didn't hear. Yeah. So if you ask the people on the street what kind of condition acupuncture can be helped, they will tell you stroke. But here to United States, if you go on the street, ask people, how do you feel acupuncture, what condition can be helped? They will tell you the pain management. Actually, in China, people who has pain, they don't go to acupuncture. I mean, sometimes they do, but it's not the first choice. What they are going to? They were going to the, the adjustment, like Ouyang, the doctor just presenting in Chinese vision of the chiropractic adjustment, manipulation. They will go to there instead of go to acupuncture. But patient who has a stroke or Bell's palsy, they go to acupuncture. So that's why to understand how acupuncture to help for the stroke, and it's important. And also the stroke, in our age, the parents and the dear friend, when they're getting older, because the stroke and heart condition, it's the #1 killer for health, for the human being. So that's why we should have some knowledge. We should understand how we can handle this. But I don't want to go through too much detail regarding for the thoracic parts. I just go for directly on the, into the clinical, or some we can use as whether you're practitioner or if you are just ordinary person like a TCM. So what you can do if your family member or dear friend had a stroke, what we can do to help the most. First of all, what we really want to, what we really want to focus on, when the patient has a stroke, if a minor case, their consciousness still remains, but the patient will have affected function of the motor function of the limbs. That's very easy to take care of. Normally, it's not dangerous. A lot of the time, patient had a first experience. They have a difficulty to speak or difficulty to move the arm, leg. Sooner or later, maybe 1 day, 2 days, they will recover totally. That's the first, first sign of the minor stroke. Sometimes could be just a minor clots or the artery in the brain to contracting temporarily. Patient mostly recover, but unfortunately, stroke tend to come back again and again. First time, most of the time it's very mild, you recover naturally. But second time, you could leave some residual condition. Third time, it could be much worse. So that's a lot of the time, patient had a stroke, they will not go to acupuncture clinic immediately. They will go to the ER, go to see the Western doctor. Western doctor will do something, and then once they are stabilized, but if they have a paralysis of the arm and the leg, patient come to the acupuncture for help. So first of all, as a family member or as a doctor, if you had this, onset, when the patient, particularly for the one it's more serious, patient lost consciousness, and then the patient had a stroke. And at that time, what you can do, first of all, you check the pulse. If the pulse feels floating and hollow, what we call the cold hollow and floating, and strong, big in the surface, and very weak, empty inside. When you apply a little pressure, pulse disappear, which means that most likely it's it's a hemorrhaging, it's a bleeding in the brain, and it's still bleeding. So at that time, you make sure you don't move the patient, you don't carry the patient, run away, or you don't move shaking. Sometimes we see the movie that, "Daddy, what's wrong with you?" The patient shake. That's you can't do it because that causes more bleeding. So what you can do, that the patient laying flat, and but of course not in the cold surface, laying flat, and then we can do the 12 Jingwell point or Shixuan point. Shixuan point is a little bit too painful, but 12 Jing point, it's very good. You just pressing and bleed a little bit. Once you bleed the 12 Jing point, Jingwell point, they will release the pressure in the brain, and the patient is going to they will come back, consciousness will come back very quickly. That's normally what we can do. Of course, you call the 911, but before the paramedic arrived, you can do this. And also, I would strongly suggest that people, serve and leave some 安宫牛黄丸 to your home. At that time, you can give it to the patient immediately. Sometimes the patient, halfway asleep or halfway unconscious, still sometimes get a little bit of response. But if you can get the 安宫牛黄丸 in, patient consciousness come back very quick. 安宫牛黄丸 it's very expensive. In China, it costs thousands of dollars because they have, 麝香牛黄. But fortunately, in Amazon, you can purchase 安宫牛黄丸 around $180, $200 ish. But it's good to have, a couple of them in the home, and when you use it, really save your life. If you give the patient in the first day or two, most likely the patient will not going to leave any residuals. They recover fully. That's more, it's really more effective than most of the decoction. So, but under this condition, if you're a doctor, you can use my teacher, Dr. Jia Sanyang, will use 三化汤. 三化汤, 3 herbs, 羌活, 石膏, 大黄. 大黄 is very good when the patient, because in the beginning, when the patient got some purgative herbs to help the elimination, and the 石膏 clear the heat, and the 羌活 clear the wind. Stroke, it's a wind related, it's a brain condition. Brain condition, it's a wind related. We call the, on the top of the part of the body, only the wind can reach. So there gotta be, it's a wind. And also the condition changes so quickly. It's a character of the wind. So that's my teacher use. And when the patient has a first stage to have a stroke, if we give the 三化汤 decoction, most of the patient recover fully very quickly without any residual condition. And the Huang Huang, the expert, very famous doctor Huang Huang, used 麻杏石甘汤 modification. For my personal experience, I think 麻杏石甘汤works works great. But of course, some people, when the patient has a stroke, the blood pressure also high. It's an issue. So a lot of time, people see the 麻黄 get scared because there's study 麻黄 can raise the blood pressure. But at that time, you have a 石膏, a large quantity of the 石膏, so it won't be the problem. The blood pressure is not going to go up because this decoction, both decoction, when the patient drink it, patient sweat right away. When the patient sweat, the pressure in the scalp, in the brain will reduce immediately. So if you don't have anything, or if you live in the countryside, there's no medical, you can't reach the medical help immediately. What you can do, just use a little bit of ginger with the 红糖, brown sugar, ginger, and make a soup, and the patient drink right away. Because what's the purpose to promoting the sweat? The patient will sweat the right way, and then the pressure in the brain will reduce, and then that also save the life. By Wang Yunyan, very famous Beijing University of the TCM, he's expert to treating all kind of stroke. He used 新露陈气汤, it's a 陈气汤, plus the gualo and the 胆南星. That's also very good. So the purpose is to, because lung and the large intestine, it's a partner organ. So you clear the phlegm, you get rid of the, the heat from the bowel movement, the patient responding also very good. So he had a very good experience, but he also has, used the 安宫牛黄丸 into the give the patient with IV, injection. That's also it's Qingkailin, also very famous. Most of the hospital are using, but it's from the Angunyuhuang. And of course, Tianjin they use the decoction Xumintang, big Xumintang, small Xumintang. But in my personal experience, all of those Angunyuhuang works really the best, especially the patient lost the consciousness. You give Angunyuhuang, immediately in a few hours, the patient started to be awake. So that's everyone should leave some for you, just for use. So if you are the person in China, and what you can do when this happened, the doctor, Western doctor also give you advice, because once the brain, has no blood circulate, the blood circulation in the brain has been stopped. It takes only 8 minutes the cells to be died. The brain cells. Once the brain cells dead, and we will never be able to bring it back. So what you can do, so first 15, 20 minutes, first 1 hour or 4 hours, that's critical. After first 4 hours, if we treat it immediately right away, patient recovers. But at that time, normally we are good to see, if the patient had a stroke, you experience the doctor will bring the patient to the rush to the hospital, do the CT, not the MRI. MRI take long time to know the results. Do the CT to see if the CT looks normal, means it's not a bleeding, it's not a hemorrhaging, it's a blood clots. And then ER, they use the blood thinner drugs immediately. They opens up. If in the 4 hours experience, the period of time, the patient will recover very quickly. But if because at that time, you do not, when a patient has a hemorrhage, bleeding, you don't want to use blood thinner drugs. But if the patient is a clots, you want to use immediately. But at the beginning, you don't know for sure. But when you go to do the MRI, you will know clearly. By the take hours, 1 day to know the results, you will lose the best time to treat. But CT takes immediately. You see, there's no hemorrhaging, no bleeding, means it's a clots use right away that really save the life. But that's the and also we don't know how early as an acupuncture should involve for the treatment. Of course, legally, when a condition like this, patient always go to ER. But if the TCM, acupuncture, and herbs, if sooner we involve, best results we will get. Personally, I went to Beijing in 1986, study under the Yang Jiasan, very famous acupuncturist. The topic, research topic, is acupuncture treatment for the stroke. My teacher, who has a very good experience, and we treat so many patients stroke. When the patient come the first day or two, most of the patient do not leave any residues for the paralysis. They recover fully, very quickly they recover fully. But unfortunately, even at the TCM, Beijing University TCM Healing Center, the TCM hospital, patients still do not go to acupuncture immediately. They go to, different department, and they use Western medical, like emergency department, use Western medical, the treatment method. And after months, 2 months, and the patient, come back to the acupuncture for help their residual, symptoms. But if the patient get the herbs, acupuncture early enough, the patient has a very good prognosis. That's what I want to share. Yeah, that's Angunyuhuang. It's I want to share just one experience. I treat a patient this year around June. The patient 73 years old, living in the urban, it's a far distance. She had a stroke. She had actually it's hemorrhaging, bleeding, and immediately the family bring her to the hospital. They had an open scalp. They had a brain surgery because the bleeding hemorrhage is too big. They cannot use without the open surgery. So they opens up, surgically clean up the mass. And but when the patient had a condition, a patient in coma, so they had a surgery. And the next day, the bleeding is so much that hospital advised to have a second surgery to clean up again. They, of course, it's dangerous. You just had a surgery, bleeding, become more seriously again. They need a second time for surgery, so they need a permission from the family. Family say whatever it takes, we want to, help her. So the doctor had a second surgery. And of course, the second surgery clean up everything. Everything is okay. Then the patient in coma. I told the family really wanted to come, to get an acupuncture from me. But she was in the hospital at that time. I cannot get involved. After 40-some days, the patient in coma. The patient totally in coma, and the doctor did everything they cannot help. So the patient become vegetable, but still alive, but just not responding at all. So the patient family asked me to do the house call. I go there almost every day to drive to the urban. It take me good, with all the traffic, it's 1 hour, 60 miles away. But with the traffic, sometimes 2.5 hours. I go there. I treat. I use the herbs. I use, I use the acupuncture by the patient. Take few days, almost 1 week, the patient started. No, actually, after second treatment, the patient started responding a little bit. I will follow you, follow you. Cannot speak by some responsibility, consciousness coming back, comes, goes, but most of the time it's not there. But occasionally come, they will focusing on you and look at you and respond. You ask, do you understand me? Blink your eye, patient responded. And then I use different herbs. At that time, every time I try, because I use different, sometimes I use some doctors say this condition you have to use foods, all kind of food, everything. We don't have mahou, we use qiaohuo, but some warm herbs that I use, the patient immediately get worse. And then some doctor suggests use tonic herbs, large quantity of the huangqi, dangshen, everything I use immediately get worse. So I finally use the the sanhua tang modification, lots of shigao, everything, heat clearing, shigao, huangqin, those kind of things. The patient, the condition more remains normal, much better results. Don't just listen to someone recommend a lot big dosage of the tonic herbs, renshen, huangqi. The patient immediately get worse. Even the patient stabilizer, you use this, immediately get worse. And some, the yang tonic to promoting sweat immediately get worse. I think the Wuju Tong, the Angongning Huangwan, it's a really, it's the best. You clearly, you use Bing Pian, you use all the heat clearing, or you can use warm herbs. And this, you see, we the Neijing we talk about 病机19条, 9 of them is heat and fire condition. So the 病机是half per, like more than 50%, around 50% of all kind of conditions is due to heat, not due to cold. Cold can cause a problem, maybe 1 or 2, by the heat, fire, half of them. So that's put in the mind. Don't just think you use warm herbs. It doesn't mean you will raise the yang qi. In fact, you the 壮火湿气, actually you damage the qi. So and then when the patient gets a little bit more consciousness, I use all kind of herbs to see. But I really find that the Angongning Huangwan is the best, even though it's extremely, expensive. But patient give the Angongning Huangwan 3 hours later. I mean, the family give it to the patient. Well, stay awake. hours after 5 or 6 of angunyuan one. I use half or not that full big pill, use half, sometimes 1/4 of the dose, sometimes half. The patient, after use 2, 3, 4 pieces of angunyuan, patient consciousness totally coming back. So that's my personal experience. All the herbs are good, but angunyuan at this condition, at this severe, we have to use regular grass. It's not enough. We have to use 麝香, we have to use 犀角, we have to use 冰片, 牛黄, those kind of ingredients that really save the life. When come down to save the life, hospital, how much they, of course they charge how much, but this expensive, but still only $200 per day, or 2 days if you use half of. So it's a really big, really helpful. So what we do, and also for in the beginning or during when the condition most stabilized, besides of the, the bloodletting technique on the 12 gene well point, of course, we can use the 226 for 5 degree that will bring the patient back. And also just like Dr. Ouyang mentioned, the changing GB21, that's also very good. GB20, like Dr. Shi Xuanming mentioned, the GB20, it's good. That's a really good because it cleared the wind. And the 216 also, 214, 216 also is very good. Those clear the wind. And one of my colleague, we went to school together. He's also expert to treat all kind of the stroke. He's very in China. He's promoted. He has a large number of the patient. What he does is for the stroke patient. Sometimes people use scalp acupuncture, but he's used the plum plaza 7-star needle. They knock on the clean up the on the top of the head around the 220 around the 220 the 四神聪 around this whole area UB7 通天 those point. He just tried to use the blood, use the plum plaza, cause a little bleeding, and then in the meantime you can use some herbs to put locally. That seems to help the patient very effective, very effective. Like yesterday, the doctor, Dr. Guo Tingying mentioned just, for scalp, even just use hand to massage also help. But he used the, 7-star needles and to cause bleeding. That helped the patient, recover very good. But for the paralysis for the patient who has a hard time to move the arm and the leg, of course, the sooner you treat, the better you are. My experience when I treated those conditions, I use 2 needles, 2 point in the arm or 2 point in the legs. Let's say I use large intestine 4, large intestine 11, or GB21. Only 2 of them. If I get the jumping qi and not lose the qi, connect to the electrical device. That seems to help paralysis. Works so much better. In the beginning, if less than 1 month, if the patient has a zero movement, not be able to move at all, you do this, most likely next day the patient start to move a little bit. The hands are zero movement. After you do 1 time, next time will move a little bit. And then second time you do and move more. Every time you see significant difference. It's in the past, if I do some other method, that helps, but not that fast. This is really, really, I treat many people so fast. So for the paralysis residues, it's not too difficult. Of course, you can, in conjunction with some exercise, physical therapy, movement, and like Dr. Ouyang mentioned some adjustment. They also, even you don't do adjustment, you do some massage or acupressure, that would help. By the acupuncture, get a good jumping qi, connect to the electrical device. Seems works very promising, very, very well. So of course, when the patient has this, we have to tell the patient There's some we don't want to go too detail, but I want to say a few things important for the patient. Number one, the patient has to make sure eat healthy. And the patient, patient cannot eat any spicy food or alcohol or some, the very rich oily food. The patient has to stay away from all this. Just eat healthy, bland soup and the food. So the diet is important, and also make sure the patient do not have a constipation. When the patient constipated, the heat will not going to go away. The patient will not going to recover quickly. So we always want the first things to make sure the patient has a bowel movement every day. If you don't, you can take any supplement to help promoting the elimination. So that's why Dr. Wang Yongyan and Dr. Jiasan Yang, we all help to use Da Huang and the Shigou, such things to help the patient, move the bowel. Because when the bowel moves, all the toxicity goes away, the patient recover much better. That's important. And the second one, you have to watch the patient's blood pressure. If the blood pressure is still very high, too high, too low, either way, it's not good. Too low, that will cause more clots. Too high, they will bleed, they will hemorrhaging. So make sure the patient on the medical care and on the blood pressure medicine to be more stabilized. And that's the second, third one. Fourth one, make sure the patient not get cold chill. We don't want to use ice pad. We don't want to, because a lot of the time when the patient in the hospital, they think the temperature lower will not going to get the infection because the germs will grow with the warm environment. That's one thing help, but it's not the truth because winter it's cold, but patient get sick much more than the summertime. So the winter, the germs, the virus, sometimes it's still more active. We are not in that cold to kill everything, and so to keep the patient warm, that's more important. We don't want to keep the patient very hot, but we should say stay away from cold. So cold draft, that's more important than anything. Then just to give and also make sure the patient do not get a stimulus, emotionally get too excited or to get too angry about something that's very dangerous. And make sure the family, it's just lesson to the patient to give, because the patient has a stroke, emotion go extreme. When they're laughing very hard. When they get very angry by nothing. So we have to make sure not emotion, not stimulus, and also make sure the patient, just stable and everything take good care. So when a patient recovers, if it's the particular blood clots, we suggest a patient take Yunnan Sanqi, Yunnan Wenshan, Sanqi Fen, Sanqi. Patient take 1 spoon every day. Of course, the patient always check with the blood pressure, and so if we take care of those, the patient should have a good prognosis. And also in our age, we should take care of ourselves and take care of the family, take care of the parents, take care of the dear friend. By those the knowledge we also want to give the patient. Another thing I want to help the patient, people drink warm water all the time, sip on, because when you drink lots of water, the blood gets not too thick. There's much less chance to produce the clots, also less chance to bleed. So particularly in the morning when you wake up, drink some water, warm water, not the cold or ice water, not the beverage. Just drink warm water. That really give you good preventive help for those such a serious condition. We have limited time. We can't cover everything, but just give most important the information. In the future, if anyone interested, we can discuss. So that's all I have to say. Thank you again. Give it back to the Jack Fu, and thank you for Jack, and thank you for the Rose. You both done such good job. I really appreciate. Thank you. Thank you.
Well, thank you so much for sharing your expertise. Did you know every 40 seconds, someone in the United States has a stroke. And every 3.5 minutes, someone dies of stroke. And every year in the US, there are over 795,000 in the US have a stroke. And Western medicine, as we know, have very limited options. So Dr. Lu, your clinical experience reviving a patient and nearly from the deathbed. And so that's a great clinical experience to share. So thanks again for sharing your expertise with our viewers around the world. Now back to Dr. Fu.
下面我们邀请非常重要的一位骨科医生，我们的好朋友，去年也来讲过的 Richard，他有非常丰富的经验，我们这个整合医学包含了我们会邀请脊柱神经科的，邀请正式的西医，也邀请各方面的医生，他是其中一位，谢谢。OK。
Well, at this conference, as you know, it's an integrative medicine. So we have invited top experts from around the world, both specialize in traditional Chinese medicine and also Western medicine. And next, it's our honor to present to you Dr. Richard Ruchesky, and his topic is diagnosis and treatment of diffuse disease. So welcome.
Thank you very much for inviting me. This is always a great conference to participate in. I learn a lot. And so far, the presenters that I've been listening to have been terrific. I'm going to diverge a little bit and talk about the diagnosis and treatment of Dupuytren's disease. Dupuytren's disease is I see commonly in my practice, and it commonly occurs in the palm of the hand, and what happens is it's a shortening and thickening of the palmar fascia. So the structure just under the skin is called the palmar fascia, and it gives the hand its stabilizing ability of the skin and its texture, and it has an important function. But when the palmar fascia becomes thickened and scarred, that's when it can cause problems and you get Dupuytren's disease. The disease initially presents with a firm nodule in the palm of the hand. So you'll see a small lesion, like a circle in the palm of the hand. And many people have this. They have a mild form. As the disease progresses, though, and we'll see pictures of that to make it clear, the nodule starts to extend in the scar tissue, and the disease process starts to extend towards the fingers. If that happens and the nodule and cord start forming a cord and it starts to contract, then it contracts the fingers and causes significant difficulty with function. People have difficulty washing their face and doing basic tasks, normal day tasks. Dupuytren's disease can be distinguished from other causes of contracture because it begins with that firm nodule and slowly progresses to a cord. Other causes of contracture, the fingers, are trauma, idiopathic, congenital causes of contracture. But Dupuytren's disease, you'll see a nodule that forms first, and then the disease will advance to a cord. And then the cords can extend to the fingers, resulting in those contractures that decrease function. You can initially do a Houston tabletop test where you put the patient's hand flat on the table, and if they don't have Dupuytren's, the fingers and hand will go flat. If they have Dupuytren's disease, due to the fact that the cord contracts and pulls the fingers into a flexed position, the patient won't be able to put their hand flat on the table. There are 3 grades of disease. Grade 1 is when just a thickened nodule, and that's an early stage of the disease. Then grade 2 is when the nodule extends to the fingers and forms a band, but there may not be a contracture yet, or maybe just be starting. And then grade 3 is when there's a significantly thickened cord or multiple cords that extend either one or multiple fingers. And as those cords contract, pull the fingers into flex position and again start to inhibit significant function. Involvement of both hands is fairly common. Clinically, when you see these patients, the most common fingers that are affected when the cords extend to the fingers are the fourth or ring finger. Then second finger that's most commonly infected is the small finger, fifth finger, and then the third or long finger, and then the index. You occasionally see the thumb affected, and then the thumb, when it is affected with a cord that extends to it, the thumb can't be brought out of the palm, and that definitely inhibits function significantly. An important point with Dupuytren's is there are other diagnoses that can be similar with a nodule in the hand, and you always, as a clinician, have to be cognizant of this, because in a rare case, epithelioid sarcoma is a soft tissue sarcoma that can present very early as like Dupuytren's, with a small mass or nodule in the palm. And there are many cases where it is just assumed that it's Dupuytren's, treated conservatively, and then it can later on be realized it was epithelioid sarcoma, but then it's too late. It metastasizes. And so you really have to be careful and watch for this rare condition tumor, because if you miss it, it could be caught late and really cause significant problem. The disease usually progresses with severity over time. And again, the stages from a nodule to a cord and then to hand contractures. Patients that are 50 years or older 50 years or younger tend to progress faster. Here's a cartoon of the different stages, and you can see on the left is stage 1, where you just have a nodule in the palm very early. Then you can see that the myofibroblasts, which are the cells that form the scarred cords, the cord progresses to the fingers, and in this case it's the ring finger, and then as the cord contracts, it pulls the finger into a flex position, inhibiting function. This can also extend to multiple fingers, causing increased loss of function. Dupuytren's disease characteristically is common in people from Scotland, Iceland, Norway, and Australia, in those areas, and that kind of ancestry. There's an autosomal dominant pattern of inheritance, and Dupuytren's most commonly presents in men over 40 years of age. There's a strong association with diabetes and Dupuytren's disease, and a 3 to 335% prevalence. So people with diabetes many times have Dupuytren's disease when you look at their hands. Also, other risk factors are excessive alcohol intake, epilepsy. I see patients that have had trauma that get Dupuytren's disease, and also smoking increases the prevalence of Dupuytren's disease. And I think the research shows that diabetes and smoking increase the chance of Dupuytren's disease due to the microvascular changes in the soft tissues of the hand. With regards to treatment, for mild forms of the disease, grade 1 conservative treatment is usually successful. I'll institute some physical therapy. You can also do a steroid injection into the nodule. 3 injections in the nodule can cause disease regression and shrinkage of the nodule. Complications of steroid injections are tenderness, depigmentation of the skin, and atrophy of the skin around the area. For more severe forms of the disease with finger contractures, treatments include needle aponeurotomy, Xiaflex injections, or surgery, and we'll talk about each treatment. Needle aponeurotomy is a form of treatment which you can do in the office. Use this for more advanced forms of Dupuytren's, where there's a cord contracture of one or multiple fingers. It's an outpatient procedure. What you do is you numb the hand with local anesthetic, and then you take a needle and you place it percutaneously through the skin And in a sweeping type motion, you cut the cord of the Dupuytren's cord. That releases the cord, and then you can bring the involved finger or fingers into an extension and straighten them because you've released the binding cord, and then the fingers can go straight. The risks of the procedure are infection. It is kind of a blind procedure, so you could injure a nerve or an artery. So you have to be careful and stay right in the area of the cord. And there's a higher recurrence rate because you're not taking the cord out. You are just releasing the cord. So the cord two ends are still in the hand, but you've released the tension. It's successful, but the recurrence rate is higher. The advantage is if it's it's a milder and less invasive procedure. Xiaflex injections, which I've been doing more, became popular in probably about 10 years ago, to give patients another avenue that they could release their Dupuytren's, have a good result, but not have to go through surgery and a much less invasive treatment. What Xiaflex is, it's a Clostridial collagenase enzyme that breaks down the collagen of the Dupuytren's cord. And what you do is the procedure is done in the office in 2 stages. Initially, the patients have the injection into the Dupuytren's cord sterilely through a small needle, and it's usually about 0.4 cc's of the enzyme that you inject directly into the cord. And then the patients come back approximately 2 to 3 days later, and when the cord is somewhat softened and broken down by the enzyme, then you give the patient local anesthetic, and then you extend the finger, and that ruptures the cord, and then that can the fingers will go straight. Then many times there's a skin tear in the location of the cord, so there's a small open wound, and what you do is you start the patient on wound care. You do home therapy and range of motion exercises. I'll see the patient back within about 7 to 10 days, and over time, the small tear, if they do get one, heals within a couple weeks, and the results are very good, and people usually get full range of motion or very close to it. And again, the advantage is it's a small outpatient or office procedure, so they don't have to go through extensive surgery. And the success rate is high. Complications include a reaction to the collagenase, swelling, and pain. I haven't seen very few complications. Usually people tolerate the collagenase well, and at the most they get some swelling, and which is all usually transient. The disadvantage of the Xiaflex is that there's a significantly high recurrence rate. Again, you're just breaking the cord and rupturing it. You're not taking out the Dupuytren's cord completely, like we would with surgery. So the recurrence rate at 5 years is approximately 50%. Same with needle aponeurotomy. But again, I guess you can always redo the Xiaflex injection in 5 years and re-rupture the cord if it recurs. But that is the downside to the collagenase and Xiaflex injection, is there is a significantly higher recurrence rate. And here's a patient that had Dupuytren's cord. You can see there's a flex position of the small finger and flex of the ring finger. The ring finger was not too bad, but the small finger would not go into extension. So what we did was, this is the Xiaflex. You mix the powder with the liquid to make a liquid that's injectable. And we injected the ring and small fingers, and I'm showing here with a pen because I couldn't do it with when I injected the needle. But you inject it right into the cord, about 0.4 cc's. And then what you do is, you can see on the left here, we manipulated the ring and small fingers on the next follow-up visit after the injection, and you can see we're able to rupture the cord in the ring and small fingers and get the fingers into extension under local anesthetic. And you can see that we developed a small skin tear and a wound on where the skin tore on the small finger. So we bandaged the hand, had the patient do wound care. And this is a different patient that we had done the Xiaflex injection approximately a month earlier. You could see at the base of her long and ring fingers, the wounds have closed. She had big open wounds there after we had extended the fingers after we ruptured these significantly large cords. And but then the wounds healed after about 3 weeks, and you can see her back at 4 weeks, and she's got full extension of her fingers and full flexion, and she's done well. When the disease becomes more severe, then usually the treatment option indication is for surgery. Usually indications for surgery when the contractures are more severe, when the metacarpal phalangeal joint, or when the finger meets the hand, when the contracture of that joint is approximately 30 degrees, or the proximal phalangeal joint is contracted, which is the joint in the finger itself, is 20 degrees, that's an indication for surgical intervention. The surgery is done through open incisions and through these open incisions, and it's either done at a hospital or a surgery center under anesthesia, you excise and take out the Dupuytren's fascia and cords so that the fingers can be fully extended. So this is different from the Xiaflex and the needle epineuridomy, and knows that you're just cutting the cord and straightening the fingers, which is less extensive. But in surgery, you're taking the cords out completely. Once the cords are removed, you can fully extend the fingers. There are different types of surgical procedures, and the different types are Z-plasty, or Scooge technique. And these are characteristically, when you make incisions in the hand and fingers, you do a Z-plasty to rearrange the tissue, because now these shortened skin from the long-standing Dupuytren's contracture has to be elongated to account for the straightening of the fingers and to allow them, because you've had changes not only in this palmar fascia, which you're taking out, but you've had shortening and changes of the skin. So when you do that, you have to lengthen them with a Z-plasty, and then you close the wounds. In the Scooge technique, you also make extensive incisions and fully take out the Dupuytren's cords, and then you close most of the incisions, but you leave some small incisions for drainage. But these techniques close the incisions, and then can lead to, while they do a very good job in taking out the Dupuytren's fascia, they have difficulty, patients, with postoperative range of motion therapy, and I'll explain why in a minute or two. And then the McCash technique, other techniques are also applying skin grafts when the contractures are extremely severe, and you have, when you straighten them out, you have large skin openings and wounds. Some patients need skin grafts to provide more skin to cover the vital structures of the hand that are now exposed because you straighten the fingers out, because you have loss of skin. I used to do Z-plasties and Scooge technique, and I found that the results were not very good. Patients had a difficult time doing their rehab because you're closing the incisions, and when you take out the scarred cords, this is all scar tissue, there's a significant amount of bleeding postoperatively, and then if you close the wounds, all the bleeding stays in the hand. The blood is very irritating. It makes it difficult for patients to do their postoperative rehab, and sometimes they just don't, or the rehab takes a long time for them to get a good result. The McCash technique is one that I've been doing for a while, and the advantages of the McCash technique are that you leave the incisions open, and this allows through transverse cross incisions, which I'll show you an example of from the operating room. And this allows postoperatively, you can still get all the Dupuytren's cords out through these tunnels and open wounds and incisions, but you leave the incisions open so all that blood drains out of the hand into the bandage postoperatively. And what that does is that allows the irritating blood to get out of the hand into the bandage, and then the blood is not held into the hand, irritating the structures. people are able to move much faster. And many of my patients don't even need therapy after. They can do their home therapy and get good range of motion much faster with this technique. And it's a older technique that I was fortunate to learn from my mentors, and not that many people do it, unfortunately, but the results are excellent. So here's a patient. This is a patient that had a severe contracture of the fingers. You can see how much the small finger is bent, and there's a cord. Sorry, it's a little blurry, but there's a cord extending, a thick cord extending from the palm to the finger, and she's got contractures of both the metacarpophalangeal joint region of the small finger, which is where the finger meets the hand, and the proximal interphalangeal joint and distal interphalangeal joints, which are the next joints in the middle and distal aspect of the finger. You can see this is a pretty significant contracture. And the other difficulty with these situations when the contractures are severe is not only does the skin shorten, but also the arteries and nerves shorten because they've been contracted over time. So when you try to extend these fingers after you've released taken out the Dupuytren's cord and fascia, and you straighten the fingers, not only are you pulling on the skin, but you're also pulling on these contracted nerves and arteries, and you have to be careful on these severe contractures because the arteries can go into spasm, and then you can lose blood flow to the fingers, and you can lose the finger. So you have to be careful on these severe contractures after you've taken the Dupuytren's cord out and you try to gain full extension of the fingers. Here's a patient that had severe contractures, even worse than this example I just showed you of both the ring and small fingers. And you can see that the leftover scars, transverse scars in the palm and the ring and small fingers that I used to take the Dupuytren's cords out. And you can see the patient, this is 4 weeks after surgery, the wounds are already closed, and you can see that the fingers go completely straight and she can make a full fist, and she's gotten a very good result. She also had a cord that went to the thumb that I excised, and she got improved extension of the thumb. But again, you have to be very careful with those, that you don't interrupt the blood flow to the finger that's involved. And you can see here's a case intraoperatively. The picture on the left, the patient has significant contractures. I'm trying to hold these fingers down as straight as I can, but that's as far as they go. And they flex actually more than that if you don't hold them. You can see the cords going to the ring and small fingers, pulling these ring and small fingers into a flex position that I'm trying to hold down just for the picture. You can see in the middle and right hand pictures, after I've taken the cords out, you can get the fingers all the way. This is right after taking the cords out intraoperatively. You can see the fingers go all the way straight. You can see I've done it through these small incisions in the palm and in the ring and in the fingers. And through these incisions, you take the cords out through these tunnels. The advantage of this, again, is that you can do it through smaller incisions, and you leave the incision. You can see here, we leave the incisions open and they'll close up within 3 to 4 weeks. So you can see here's the same patient. This is approximately 10 days after the surgery. You can see that the wounds are still open, but they're already starting to close. All that blood that was in the hand came out of the hand into the bandage, and you can see his hand isn't even very swollen at 7 to 10 days. If this was a different technique like the Scooge or Z-plasty, his hand would be swollen and he wouldn't have this kind of motion at 10 days. You can see he can bring his fingers all the way straight and he can get them pretty much to a fist. This is at 4 weeks. You can see that the wounds are pretty much closed. He just has scabs on his hand. And you can see at 4 weeks, he has full extension of his fingers and full flexion. And so already at 4 weeks, and he didn't do any therapy, and he just do wound care at home and a home therapy. And you can see he's gotten a very good result through this technique. And again, just to reiterate that there's a higher complication rate in hand stiffness and more difficulty with postoperative therapy when you close the incisions in surgery. But when you do the McCash technique that I just showed you, allowing the blood to drain out provides easier rehabilitation and much better results postoperatively. Complications with surgery include, with any surgery, infection, tendon, nerve, or artery injury, loss of motion. It's a more involved procedure. Patient have to get medical clearance, has to be done at a surgery center or hospital. They have to undergo anesthesia. So it's definitely more involved. But the advantage of surgery is that the recurrence rates are significantly lower. The recurrence rate at 5 years for needle epineuritis and Xiaflex is approximately 50%. The recurrence rate for surgery is 4% at 5 years. And again, it's because you haven't just broken the cord, you've actually taken the cords out. So there's less likelihood the disease is going to reoccur. So in conclusion, Dupuytren's disease is a thickening of the palmar fascia in the hand that forms nodules, and then as it becomes more severe, forms cords in the palm that result in contractures of fingers and cause significant loss of hand function. Milder forms of disease can be treated with therapy or steroid injections. More advanced forms of disease should be treated with whatever the surgeon feels comfortable, either needle epineuritis, Xiaflex injections, or surgical fasciectomy and removal of the diseased fascia. But whichever form of treatment you use, fortunately, the treatments for Dupuytren's disease have a high success rate. And patients are usually very happy and have a very good result. Thank you.
Okay. Well, Dr. Richard, I truly learned something from you. First of all, forgive me for not pronouncing your last name right. So I will call you Dr. Richard.
No problem.
For sharing your clinical experience with Dupuytren's. Dupuytren's actually in Chinese, there's no Chinese name that I know of. Actually, it's a direct translation of the English. And if the doctors here, the proper Chinese name, let me know. But according to what I researched in Chinese, Dupuytren's disease is called the 杜普伊特伦氏症. And I wish we have some time for Q&A. But thanks again for your presentation.
Thank you very much for having me. I appreciate it.
Yeah, have a wonderful holiday, and thank you again for your participation.
Thank you. And thank you.
Thank you very much, Richard. And also tonight, don't forget every presenters be invited tonight at the 4 to 5 have one firm. After that, the school in the University of East West Medicine online and the face-to-face have very small congratulations event tonight for the about 40 minutes like that. So that will be change our mind a little bit, and also welcome everybody join that too. Thank you.
Thank you, Dr. Fu, for inviting me. I appreciate it very much.
Thank you.
Thank you.
Very happy you always support us, and thank you.
Indeed.
好，下一个。
Dupuytren's in Chinese called 杜普氏挛缩。杜普氏挛缩。
挛缩，谢谢您分享。And actually, Dr. Richard shared his clinical experience in Western medicine, but I know there are TCM and herbal medicine remedies as well using traditional Chinese medicine. So thank you so much for sharing. Okay. Back to Dr. Fu.
下一位是我们非常重量级的嘉宾，是我们世界整合医学学会联合会的副主席、顾问，德高望重的杨官甫教授。杨官甫教授呢，学术水平非常高，他是在俄亥俄大学医学院临床教授，温州医科大学中美联合针灸康复研究所美方所长，市中联中医药消化委员会和内分泌委员会的副主席，同时也是我们世界整合医学学会联合会的副主席。我们这个杨官甫教授啊，他的知识非常渊博，经常在我们群里边发很多帮助大家的帖子。因为我们这次的题目主要是新冠、中风和太极这主3个方面。现在呢，我们杨官甫教授在线了，请那个Rose 择重点 英文翻译一下。
Well, next presenter is another heavyweight top expert in the TCM field, Dr. Yang Guanfu, and he's an expert in TCM. And today his topic is regarding the COVID side effects and regarding the as a dizziness, right? And using traditional Chinese medicine. So welcome, Dr. Yang.
Thank you, Lucy. Thank you, Dr. Fu. I'm very honored here to introduce the TCM treatment for post-COVID vertigo. And is viral respiratory infection disease pose a great threat to human life and health in 21st century. So you can see 2003 the SARS and 2009 the flu and 2012 is MERS and 2019 is COVID. So what is Chinese medicine do? We see, the TCM plays an important role in the prevention and the control of novel coronavirus epidemic. So we can see in the whole world have so many deaths, and the COVID-19 not only cause deaths, also cause many symptoms and cause many post-COVID long COVID syndromes. And so in China, how very famous, we talk is San Fang, San Yao, is 3 drugs and 3 prescriptions and fighting with the COVID. So number 1 is 莲花清瘟胶囊, number 2 is 金花清管胶囊, and雪比净, also the 清肺排毒汤 and 华氏败毒散 and 雪北清. So right now the 莲花清瘟 seems plays a very important role in the treatment in China or some country. And we know it about almost 4 years since the COVID-19 pandemic, as the number of infection and recovery the patients increased, the sequence of the COVID, we talk is the post-COVID-19 or long COVID syndrome as a clinical problem that cannot be ignored. So now some people say that COVID-19 have no long COVID syndrome. That is just is joking. But we in the clinic, we really see so many the long COVID syndromes. And some people say that how more than 80% patients have the dizziness or vertigo. So why cause vertigo after the COVID? I think a couple issues. Number 1 is inner ear problem. After the virus infection, inner ear causes some inflammation. Number 2 is anxiety disorder. After COVID, and people suffer more anxiety, and anxiety related with the vertigo or dizziness. And also is brain disorder. So we see a lot of brain foggy people. They also combined with some the vertigo. Also, some patient is cardiovascular system disorder, after COVID. So the heart get some damage, then cause vertigo, and also have other conditions. So we do not know why COVID virus could cause vertigo. So that is still not too clear. So maybe perhaps it's a factor on the vestibule is similar to the mechanism by which the coronavirus causes the losses of smell or taste, or virus causes the peripheral vascular lesions. So that's maybe similar issue. So what are the symptoms? Usually we'll see dizziness and vertigo, head spinning, and blurring vision. The symptoms can abate spontaneously once you close eyes in mild case. Some patients feel like sitting on the board, rotating and tumbling in more serious case. Even some patients experience nausea, vomiting, headache, ringing ear, and deafness. And patient could show paleness, sweating, and other symptoms in severe case. So what are the epidemiology and pathogenesis in TCM? We said including 5 words. One is wind, one is flame, one is fire, one is stasis, one is deficiency. So in Chinese medicine, we talk all wind with the vertigo, and shaking is the circulated to the liver. So in Chinese, the 珠风吊旋皆属于肝. Also is vertigo cannot occur without a flame. So that is famous Dr. Zhu Danxi. He thinks the vertigo associated with flames. Also is fire. Vertigo cannot occur without a flame, and the flame is activated by fire. So the fire also is a problem. Also is vertigo can also be formed by the block of the orifice made of the flame occur. Also is a deficiency. Vertigo cannot occur without a deficiency. So in vertigo, must have some wind, flame, fire, stasis, deficiency, but which factor more dominate it? So we need to see what are the patient symptoms. So based on the clinic, we can see have some different type. One is ascendant hyperactivity of liver yang and flame fire combination. So this vertigo will occur with mood swelling accompanied by tinnitus with the louder noise, possible diminished hearing, irritability, easy anger, distending headache, stuffy ear, red eye, bitter taste in the mouth, and dry throat, red tongue with yellow coating, wiry and rapid pulse. So this is a very common type. So we need a treat that is calm the liver and extinguish wind, nourish yin, and suppress yang. So for Chinese herbal, we often can use 天麻钩藤饮, 天麻钩藤饮. For the acupuncture, usually we pick GB34, liver 3, sanjiao 5, GB8, GB43, and 甘仁酥, 甘仁酥, 甘仁穴, 甘仁穴. We will talk this next slide. Also is stomach 36 and PC6. And some people will say this type of patient already have liver yang stagnation there. And why you still use stomach 36? That's dependent on your condition. Even like this case, stomach 36 still can inhibit the body inflammation. And in the animal research or clinical research, and the stomach 36 can use this type too. So here we want to introduce what is 甘仁穴, 甘仁穴. So 甘仁穴 really is the first acupoints located around 3 to 4 fen under the edge of right subcostal, every 1 inch from the points, respectively the second and the third acupoints. So this name is Anren, this name is Sugang, and this name is Jieyue. So under secondary points, about 1.5 cun from the belly line, there is the fourth acupoint, and the name is 胆降穴. So all of 4 points we talk is 甘仁. And of course, these 4 points not only used for the long COVID vertigo. We also you can use people after gallbladder surgery. The patient still feel right side pain. So that time you can try these 4 points. So it works very well. So second type is deficiency of both the blood and vital energy. So show is recurrent vertigo worsening with the standing and elevated by lying flat, triggered by exertion, accompanied by tinnitus with a low sound like a cicada chip, pale complexion, lassitude, shortness of breathing, sloth for speech, soreness and weakness in low back and knees, and forgetfulness and dream disturbed sleep, frequent urination at night, pale and puffy tongue with thin white and moist coating, deep, shreddy and weak pulse. So this type need 25 spleen qi, raise yang, warm the kidney, strengthen kidney qi and stop vertigo. So we often can use 石川大补汤 or 桂皮丸 石川大补汤 or 桂皮丸. So this type we can use acupoints is stomach 36, Run 6, Run 4, PC6, kidney 3, and bladder 24, bladder 20. So next type is vertigo or dizziness, fatigue or lassitude, memory loss, weakness of soreness of the loins and knees. For yin deficiency, accompanied by dry mouth and throat, night sweating, hot flush, red and shiny tongue with little or no coding, shreddy and rapid pulse. For yang deficiency, will show lethargy, aversion to cold, coldness of the extremity, pale tongue with deep or slow and weak pulse. So this type need tonified kidney and replenish its strength, benefit marrow. So 左归丸 or 右归丸 dependent is yin deficiency or yang deficiency. So you can yin deficiency, you can use 左归丸, yang deficiency, you can use 右归丸. And acupuncture points could pick kidney 3, bladder 24, ring 4, and liver 3, stomach 36 to 20, and bladder 18. Also, next type is flame turbidity, obstructing of the middle jaw. So vertigo with the heaviness as if bound by the clothes, worsening with movement, tinnitus with the low sound, hearing loss, shallow compression, chest compression, sluggish lethargy, profuse flame, nausea and vomiting, poor appetite, loose stool and diarrhea, white and glassy coating, wiry and slippery pulse. So this type we need to strengthen the sleep and harmonize the middle jaw, transform flame and settle the vertigo. So famous herbal is the 半夏白术天麻汤, 半夏白术天麻汤. So we can use stomach 36, stomach 40, PC 6, spleen 6, and liver 3, And last type is blood stasis. So the patient show chronic recurrent vertigo accompanied by tinnitus with the ache, stabbing headache, insomnia, palpitation, dark eyelids, dusky tongue with the eachmois and perceptia, and ingogate vein underneath, wiry and chopper pulse. So this type need to invigorate blood, remove stasis, and unblock channels to open the orifice. So 通窍活血汤, 通窍活血汤. So this is the famous herb. You can use for here for 通窍活血汤. Acupuncture points you can pick a spleen 10, bladder 17, and liver 3, and large intestine 4, and do 20 to 20. So from here, I want special talk about the clinical experience. Number one, we talk acupoints consistent of the Zhong. If we learn from China, we Zhong, including Zhong, these words. So like 中王, 韩中, 中服, these points closely and connected with balance. So we talk is 中 just is middle line. We talk is 中. So if you have 中 with the points, now so that points usually connected with the balance points. So acupoints, so that's number one we need to know. Also is if is acupoints the name consisting of the 分, we talk is 分符, 分词, 一分, 分 is wing, right? Wing. So that they are close connected with the liver and the gallbladder meridians. So in Chinese we talk 用含有分的穴位来自分. So if we the points and consisting of 分, so that means that points will close connected with liver or gallbladder. So number 2. So neck bladder and lymph circulation, palpitation along sternocleidomastoid muscle and feel the tenderness. So you touch around the neck muscle to if you find some tenderness. So untile nodules in like 天川 and 腹拓. Okay, so if is around the 天川腹拓 have tightness there, you need to use needle to tighten that, to release it, because this will affect the neck, the blood and the lymph circulation. And 3, so we talk keeping a smooth conception vessel and govern vessel by relaxing 大中, 膻中 and 中脘, 关元, 气海, which are located in conception vessel and 百会 on govern vessel to balance the longitudinal line. So we talk you have to release any congestion in Lun meridian and Du meridian. Lun meridian and Du meridian. So number 4 is also we have to maintain the 3 transverse line. Like we talk is 膻中 line through the both nipple and the 中脘 line and 神阙 line through the belly line. So these 3 the line also very important. You need to touch. If some congestion there, you need to release. So the body very interesting. You know how Lun and Du control the one direction. Also how this transverse line, how the 3 line very important for body. Special is 膻中 line, 中脘 line, and the 神阙 line. Also is we talk is elbow, and we need to calm the heart because people have vertigo, dizziness, they feel very scared. So use the acupuncture. Also you have to use 内关神门 is PC6 or Heart 7, or use some calming herbal to help a patient relax. Also, last one very important is maintaining the smooth flow of the large and the small intestine channel. The large intestine governs thin, clear body fluid, and the small intestine dominates thick body fluid. So that's from the 内经, and the special,精液 controlled by large intestine and the small intestine, because the vertigo. Sometimes the ear inside have 津液 problem, storage there. So we can use 颌骨 large intestine 4 and 后溪 and small intestine 3 to control the 津液 circulation. And the special the 后溪 also connect the governed vessel as well. So that is clinical we need to think about it. If patient coming, we do not get a good result, we have to think about change the treatment. And final, we talk about nursing. So during the attack, the patient should rest in bed and avoid the light and noise as much as possible. Also, the patient should switch to the low sodium and light diet. Sugar or sugar product and milk or milk product should be avoided. A daily intake of the salt should less than 1 gram. The water intake should be properly controlled. So sometimes some diseases we could take more water, but for this kind of patient, take water, the volume need to be controlled. And patient should avoid overwork and irregular sleep patterns. Please keep a good mood and enough sleep. Avoid negative emotions such as depression. So talk is easy, do it not too easy. So during intermission, it is recommended that the patient should take more exercise and strengthen physical. Also is cigarette, wine, strong tea, and coffee should be avoided. Patients should avoid contact with allergens, control systemic allergic disease, and actively treat systemic concomitant disease. So past this year, we have 2 books. One is Chinese book, one is the English book, and we'll publish it this year. Thank you very much.
Well, Dr. Yang, and on behalf of the Congress and also all the audience around the world, I want to thank you for sharing your clinical experience on the COVID side effects and of course, the conditions the Western medicine is still experiencing because those viruses are so new to us. And it's a new experience. Again, traditional Chinese medicine have ways to conquer them. And I really appreciate you combine the mood, food, exercise with treatment, the holistic approach. And this is the foundation of Chinese medicine. So thank you again, Dr. Yang, for your presentation.
Thank you.
Dr. Fu, back to you.
请杨老师把这个 PPT 退一下。谢谢，非常好。Thank you very much for the Dr. Yang. He always good, many years. 好，下一个呢，我们想要给大家介绍一位特别的来宾，因为我们这次大会呢，3个主题，第一个是整合抗疫、长新冠，第二个就是中风的讨论，第3个就是我们太极气功医疗运动处方标准化的研究，而且现在还是一个特别的日子，在12月18号，也就是今天，2年前2020年，我们大家一起庆祝这个太极申遗成功。因为太极拳已经很多年在中国非常流行，全世界很接受，但是在我们其中全欧洲中医药专家联合会朱冕神主席的帮助下，在2020年的时候，太极申遗成功了。所以今天是一个值得纪念的日子，也是我们当年大家一起倡导申请成功的日子。所以我们今天有特别邀请到世界太极日的创始者，也是我们老朋友 Bill Douglas 来给大家做一个演讲。 所以请 Rose 翻译一下，然后请 Bill 开始。Thank you.
Well, indeed, Dr. Fu, today, December the 18th, is a very special day for several reasons. And Tai Chi has successfully applied for the United Nations as part of the cultural heritage. Actually, it was being recognized. And today, we have a very special guest, and Mr. Bill Douglas, and he's indeed a friend and a supporter of our Congress for several sessions. And he is a founder of the World Tai Chi Day at the end of the April each year. So it's my privilege to introduce to you Mr. Bill Douglas, the founder of the World Tai Chi Day.
Thank you so much, Rose, and thank you, Dr. Fu. And before anything, I just want to invite everyone to get involved with the World Tai Chi and Qigong Day on the last Saturday of April at our website, worldtaichiday.org, and you can stay connected with us. But one thing I wanted to do today is just acknowledge what Dr. Fu and Rose and the whole team that is putting this together, and all the contributors that are bringing all their science and all their wisdom together. This is such an important thing to happen at this time on the planet. And, you know, we just went through this huge pandemic, and we know the science shows that Tai Chi and Qigong and mind-body practices boost the immune system, boost the T cell count, and that the T cell counts have a big effect on, you know, whether we contract, for example, COVID, and how severely it affects us. And so boosting T cell counts, we know this is such an important thing. And so all the science that all the people are bringing is so important. And what we do with World Tai Chi Day is we create these events all over the planet, or we help organize. It's all local events in every country. We don't organize the events, they organize in each country, but they're independent. But they give us a chance to get the world media to pay attention to the science like is being expressed and provided and offered by all these great presenters. And so we're very, very excited and very pleased to honor their work. And we hope everyone will spread the work of the World Congress on Integrative Medicine in any way that you can. So when all this work is put together by these people, and it's very hard work, we've organized some of these ourselves. And so if you can just spread this information and spread their website out just as in any way that you can, so that we can become a healing force on the planet by supporting the work of the World Conference on Integrative Medicine. And then I think we have a video, don't we, Jack? Dr. Fu or
Thank you, the Bill.
Yes. Dr. Fu, 麻烦你把那个你的话筒关掉。谢谢。
Thank you so much.
Sorry, Bill.
Oh no, that's fine.
Sorry about it.
No, that's great. Thank you.
This is your video, right?
Yes.
Thank you. 在这里，我们特别要提到一位我们的老朋友，叫做 Effie 曹的，他刚刚去世，所以在 Bill Douglas 的录像里也提到了这件事。他本来要参加我们这次大会，他被称为西方气功之母。然后呢，去年我们也合作了几次大会。今年我跟他打电话，在他去世的前一天，他还和我通了话，他还答应要来参加大会，还让我给他发 email， 还跟我通话，真的是一个了不起的这个老人家。
Well, indeed, yeah. We would like to take this opportunity to thank Bill Douglas for your participation, and also pay tribute to a very special pioneer in the traditional Chinese medicine, medical Qigong, Dr. Effie Chow, who just passed away this month, and it was her presence at this. Thank you.
Thank you.
好，傅医生，麻烦你mute my the mic。
各位在党员这里的老师们，请你们开视频好吗？听得到我说话吗？
可以。
听得到我说话吗？
傅医生可以，请讲。 可以，月亮可以听到。
可以听到哈。
嗯，
I think
那现在我是正常，现在期货网直播也正常，YouTube 直播
Well,
也
we
正
hear
常。
a lot about how Tai
应
Chi
该是
and
这
Qigong
都
and
在
meditation
正
can
常的
help
进
boost
行
the
当
immune
中。
function.
Jennifer 是你那边有个
There's
背景音
research
吗？
that I've covered
话筒
in my
关
book,
了，然后
Gospel
麻
of
烦
Science,
稍等
that
2分，
shows that
等一个。
research that Tai Chi can boost the helper T cell count by anywhere between 50% and 100% more helper T cells. And the helper T cells are critical because they consume virus and bacteria cells and other cells that the body needs to get rid of. But the question is how does that happen? How does the helper T cell count get boosted in meditation and Tai Chi and Qigong? And the answer to that lies with the pineal gland. The
Thank you,
pineal
everybody.
gland is in the center of the brain.
Welcome,
And the
everybody.
pineal gland is the place where we hold on to
Good
control
morning, everybody.
when we're thinking about things,
Jennifer 应该是你那边有一个什么背景哈，
things,
校长准备好了，
when
那
we're
那我们就开
intellectually
始。
engaged. The pineal gland in the center of the brain is
Please, everybody,
somewhat
turn on your
constricted.
video,
There's
turn
a
off
sense
your
of
audio.
control in there. When we
And
start
right
to
now,
practice these mind-body practices, whether it's sitting Qigong, Neigong, energy
Congress.
meditation, or whether it's
The
moving
Sixth
Qigong
World
or Tai Chi,
Conference on
what
Integrative
happens when we
Medicine
practice these things
第6届
in
世界整合医学大
in
会
that
暨
state of
新
mind,
冠并
we're
发
practicing
后遗
letting
症
go,
防治
letting go
论
of
坛
control,
现在
letting go
开始
of analytical thought or even word thought,
Welcome
and letting the mind
viewers around
drift
the
in
world
pure
and
consciousness,
all the
where it
attendees
just
and
drifts
presenters
into
around
places,
the
and then that
world.
changes the brain waves. And so the common brain waves that we have are beta brain waves, which is busy brain waves, alpha state, which is a meditative experience, a more relaxed experience that you get from mind-body practices. And then you've got delta and theta, which are sleep and deep sleep states. And so these techniques allow us to let that pineal gland just let go of control, let go of analysis. And when it lets go, everything lets go. Our whole being and our whole body and our whole field start to let go. So the brainwave changes is a reflection of something that is happening in a much larger way than just what's happening in the brain. It's a field experience. It's when we let go of being a separate thing and we allow ourselves to become part of the connection of the whole of the universe. And so how does this happen? How does that affect the helper T cell counts? Well, what research has shown, and again, I get into all this in the Gospel of Science with endnotes so that you can go to the original studies, the original articles or research. And what they've found is that these kind of meditative experiences have an impact on our DNA. You've all seen the helix of the DNA coil. And what happens when the normal stresses that we pick up in our daily lives, they cause tension, and they found that the DNA coils actually coil more tightly due to that stress. But when we practice these mind-body techniques and these mind-body experiences where we let that pineal gland let go and we let ourselves just drift in pure consciousness, then what happens, or one of the things that happens, is the DNA uncoils. It becomes less tightly coiled, and that changes the DNA expression. So it changes the way that every part of our being, every part of our mind and our body function when that DNA relaxes out of that tightly coiled state. And so one of the results that we see is the boost in helper T cell count. But there's many other benefits that we get from meditation, mentally, physically, emotionally, and on levels that we couldn't even really begin to describe.
as we breathe in each other, there is no garden.
The world spends over $8 trillion per year on healthcare. Several years ago, I read a multi-year study conducted by one of the world's largest health institutions, revealing that around 70% of the illness sending people to their doctors was caused by stress. Not aggravated by stress, but caused by stress. After seeing this study, I called Dr. David Sabel, a Kaiser Permanente physician familiar with the research, to make sure I read this amazing fact correctly. He excitedly explained that depending on how you looked at the data, that number could go even higher than 70% of illness being caused by stress. Dr. Herbert Benson of Harvard states that between 60 to 90% of illness can be most effectively treated with mind-body education, meditation, Tai Chi, yoga, Qigong, mindfulness. This realization that 60 to 90% of illness sending people to doctors is caused by stress and best treated by mind-body practices means that between 4.2 trillion to 6.3 trillion could be saved each and every year by expanding use of mind-body practices throughout society at all levels. If mind-body practices were taught worldwide in public schools as a core part of public education, taught in age-appropriate ways from kindergarten through 12th grade, in 12 years we would profoundly reduce global health costs. Even the most conservative estimate of potential savings would mean trillions of dollars of annual savings each year. What could the world do with trillions of extra dollars? Possibilities are profound. Estimates are that world hunger could be ended with just 30 billion per year. 3.4 million, mostly children, die annually from water-related diseases. According to the World Bank estimates, 150 billion each year would provide clean water worldwide. Wrapping our heads around this, that just a tiny fraction of the trillions in saved health costs could end world hunger and millions of water-related deaths, is huge. Global transformation on a gargantuan scale. This historic study on meditators affecting society, conducted from June to July in 1993, found that when a certain small percentage of the city's population included trained meditators, the HRA, homicides, rapes, and assaults crime rates decreased significantly by 23% at the highest point of infusion of meditators. What was interesting was that there was a correlation in line charts showing that as the number of meditators being brought into the city increased, the crime rates correspondingly dropped. Other meditation research entitled Transcendental Meditation Program and Crime Rate Change in a Sample of 48 Cities, cited at National Crime and Justice Reference Service from the Journal of Crime and Justice, stated that in cities where 1% of the population were instructed and trained in meditation programs, crime rates decreased the following year, in contrast to matched control cities, and the trend remained in the subsequent 5 years. A study by 2 Harvard University professors found that violence decreased between 40% and 80% during the 1980s Israel-Lebanon War, when they organized experienced meditators in the U.S., Yugoslavia, and Israel to focus on the conflict area during meditation. At Folsom State Prison in California, where they had had a Tai Chi Cha program for about 2 years, tracking prison statistics over those years found that not only had behavior rates improved for the meditation group, but for the entire prison. Apodaca Prison in Mexico, the site of one of Mexico's most violent prison events, which saw 0 events of extreme violence after implementing a meditation program for 700 inmates and prison guards and administrators, as reported by Mimi Yagob, writing for Insight Crime. What if bullies were disciplined with meditation? Alternative approaches to conflict resolution may hold a key. This is exactly what a handful of schools in the US and the UK have begun to do. CNN reports that in West Baltimore at Robert W. Coleman Elementary School, meditation interventions have become part of the school culture. The initial results have been overwhelmingly positive. Coleman has not issued a suspension in 2 years, the same amount of time they've been experimenting with teaching mindfulness and calming techniques to students. MNN.com reports that in England, beginning the first week of February, Children's Mental Health Week, up to 370 schools will participate in a 3-year trial involving mindfulness exercises, relaxation techniques, breathing exercises, and student sessions with mental health experts. Psychology Today, June 26, 2019. In 2021, the founders of the Global Transformation Project received amazing news when they were informed by the Princeton University-born Global Consciousness Project data analysts that the global mind-body event they organized, World Tai Chi and Qigong Day, as well as other mind-body events, had increased coherence in global consciousness. Excerpt, New Second Edition, The Gospel of Science, page 590. The Princeton University Paralab-born Global Consciousness Project data showed that this event we created together and other compassion healing-based events increase coherence in global consciousness. Global Consciousness Project data analyst Brian Williams identified 110 events in total. Collectively, these 110 events have a Stouffer's Z-score of 3.283. Z-scores can be confusing. Many people understand probabilities in terms of an odds ratio, and in this case, the p equals 0.00051. On previous pages, GCP Harmony Events Composite 1998-2012 means roughly 2,000 to 1 odds against a chance explanation of the result, indicating that the data is very solid that these global harmonizing events created coherence in the consciousness of the entire planet. And further larger analysis of 500 events leaves virtually no doubt at all. In the GCP's larger analysis of 500 global events, the Z-score was over 7, and in the case of this data, also a 7 sigma score as well. To put this in perspective, if you are a lay reader of research statistics like myself, who may have spent more time at a blackjack table than in a laboratory regarding this data, this 7 sigma deviation corresponds to only a 1 in 1 trillion odds of it happening only by pure chance. Again, keep in mind that only a 5 sigma result was able to give CERN the Nobel Prize for finding the Higgs particle. New Second Edition, The Gospel of Science, pages 375 to 376. Mind-body practices, Tai Chi, Yoga, Qigong, meditation, mindfulness, can take the brain into the alpha and alpha-theta brainwaves. These brainwave changes can increase the empathy and compassion parts of the brain, and when done en masse can increase coherence in global consciousness and reduce violence and chaos in society and the world. It is worth noting that virtually all the original founders of quantum physics, legends in the field, knew that consciousness affected the particle wave function. Physicists who argue against it are arguing with the giants of their field, as well as the data you see here. New second edition, The Gospel of Science, page 364. In physics' famed double-slit experiments, electrons are shot through slits, and as one would expect, leaving vertical columns on the detecting screen similar to the slits the particles pass through to get to the detective screen behind the barrier, marking where the electrons hit. This happens when the particles are observed going through the slits, but when not observed, the particles behave like waves. Dr. Dean Radin of the Institute of Noetic Sciences, author of Entangled Minds, Extrasensory Experiences in a Quantum Reality, The Noetic Universe, and the Conscious Universe, The Scientific Truth of Psychic Phenomena, conducted a very large multi-year experiment involving at first people sitting within 2 meters of the laser shooting particles through the slits, engaged in alternating periods of focusing and not focusing on a mental image of particles passing through the slits. In 4 pilot studies, the meditators did quite well. A follow-up study found a similar result, producing a 4.5 sigma result. The 4.5 sigma score effect was when people were observing, but when no one was observing, the result was almost exactly chance results. The researchers followed up these findings with 2 years of study to see if the results could be replicated, involving 2,985 sessions with 1,479 people. When all the results were combined in a meta-analysis, the result was between approximately 4 to 8 sigma effects. Again, 5 sigma got CERN the Nobel Prize for the Higgs particle. Upon my contacting Dr. Radin to make certain I understood the data correctly, he gave me links to updated articles, explaining that some of their best, even more conservative studies, later analysis achieved about a Z equals 4.5. Not quite a 5.0, however, Z equals 4.4 means in statistical odds terms that there was only a 1 in 180,000 chance that their scores could have been only pure random chance. We also look at things that are organized. Intentional worldwide meditations are an especially good example. The bottom line, what's the combined output from all this experimentation involving data from 500 such events worldwide over a period of years? And it's a really powerful indication that there is some effect of something like global consciousness. You can't be entirely sure what causes it, but there are good reasons to believe that it really is a gathering of consciousness from around the world, which changes the way our random number generators behave. The odds against chance are remarkably high, more than 1 trillion to 1. That's 3 trillion to 1. In scientific terminology, we see a deviation that is more than 7 sigma, meaning more than 7 standard deviations away from what's expected, way out there. My favorite finding in the whole process of looking at the data of the Global Consciousness Project is that compassion is the emotion that is most powerful. The Global Transformation Project has launched a global campaign to get a United Nations resolution advocating mind-body education as the core part of public education worldwide. It would not be mandatory for any nation, school, or student, but the science is far too overwhelming on how mind-body education in public education would improve students' behavior, focus, and test scores. Mind-body education, according to science, could increase IQs, creative thinking, reduce bullying and conflict, boost students' immunity, improve GRE reading scores, math proficiency skills, and verbal fluency, and boost students' test scores. But to get a United Nations resolution, how could that happen? There is a precedent for this. In 2015, the United Nations General Assembly voted in a UN resolution creating the International Day of Yoga, which the Global Consciousness Project data revealed has increased coherence in global consciousness. This resolution made history, being co-sponsored by more nations than any previous resolution had. 177 nations co-sponsored this global health education effort of a World Yoga Day. And the reasons for doing so align with the reasons for a resolution advocating mind-body education for public education worldwide. The Global Transformation Project's website has a draft of the United Nations resolution with a petition that mind-body practitioners and anyone can sign to encourage the United Nations missions to bring this mind-body education in public education to a vote. When you sign the petition, you will get updates from GTP on this historic movement for global transformation's progress. In signing this petition for a UN resolution advocating mind-body education worldwide, you will be joining with a distinguished growing number of renowned physicists, health, and education professionals supporting this effort. The petition for a UN resolution advocating mind-body education worldwide supporters include the founders of World Tai Chi and Qigong Day, William and Angela Wong Douglas, the founder of Heart Math, Dr. Roland McCratty, past director of the Princeton University Engineering and Anomalies Research Lab, Dr. Roger Nelson, Peter Wayne, PhD, Bernard Osher, Associate Professor of Medicine in the field of Complementary and Integrative Medical Therapies, Harvard Medical School, Dr. Xin Lin, University of California at Irvine, mind-body researcher, Dr. Roger Yanka, co-founder of the National Qigong Association and mind-body researcher published with the National Institutes of Health, Dr. Christine Rhodes, professor in the College of Business at Kutztown University, doctorate in educational technology, Sharon Rose, master's degree Fulbright senior research scholar to India in the fields of the arts and education, master's degree in education, Effie Poyu Chow, PhD, appointed by President Clinton to the White House Commission on Complementary and Alternative Medicine Policy, Clara Apollo, UK Health Radio Network host of Chi Time, Dr. Paul Lamb, teaches postgraduate family physicians and is a clinical lecturer in the University of New South Wales, Australia, for over 30 years.
Great. Thank you, Bill. You did
Yeah,
a wonderful job.
Thanks for all your work.
And that is amazing. That's amazing.
Well, indeed, Bill, thank you again for your participation and great work in research and sharing some astonishing numbers with us. Imagine that 8 trillion medical expenses and 60 to 80% of the diseases can be prevented by using Tai Chi and mind-body exercises. And we want to thank you for your work to extend Tai Chi in school, workplace, especially even in prison. So thanks again for sharing your research, your work, and astonishing statistics. All right, back to you, Dr. Fu.
Okay, so please everybody turn on your video and let us take the group picture. Then we will continue doing the more presentation. So please, everybody, turn on your video, and we will very happy take more picture together.
Yeah,
Sure.
so far we have about 67 presenters online. Dr. Fu, can you share with us how many people are watching on YouTube and also Qihua Wang based on our
Okay,
numbers?
we already online. Every year we almost have the 60 to 70,000 people online, the live watch our outside this meeting, and the YouTube channel and the other channel, the social media, we share it. So in here, we only have the few people, but we will have more and more people outside here. So right now, let us take one group people, a group picture, because of this, only some presenters in here. So that's why this year we use the special technique, the webinar, the Zoom. It's a little tough, but but that's necessary because too much people have the technique problem. So that is if we do this way, it looks like a little better. So
indeed. Yeah, we have over 60 presenters online in Zoom with us, and we have over 70,000 viewers, both from China, Qihua, and also YouTube channel. So thanks everyone for your participation, and thank you for all the volunteers to make it happen. Dr. Fu?
Yes, thank you. Also, don't forget that we invited a lot of the universities, the professor, especially this year, have the UCLA, the Dr. Chu, and he's a founder with the UCLA Integrative Medicine. The hospital have the 5 hospitals inside the the university. And UCLA University, you can see in Los Angeles have 5 places, and that is a very big. And also we have the Harvard, we have the Stanford, we have all the world, a lot of the very high level teachers coming to this event. Just sometimes they speak the Chinese, I'm sorry, but today it's an English one. We full booked with the whole day too. So thank you here, everybody. So let us next one. I will like the play a little bit with the Taiji 24. Everybody knows, and this is her father, the Li Deyin. He played the 24. And this is
hello,
daughter,
good morning,
very famous,
distinguished guests,
our vice
experts,
president,
professors of traditional Chinese medicine. First of all, I would like to say thank you and congratulations to the Pan-European Federation of Consultants in Traditional Chinese Medicine. Thank you for organizing and hosting such a wonderful online forum. My name is Fei Li, Chinese name Li Hui. It is my honor and delight to share my presentation with everyone. The topic of my presentation is Tai Chi for health and well-being. 太极是优化生命的最佳良药。As we all know, on December the 18th, 2020, Tai Chi, a century-old Chinese martial arts and an internationally popular form of exercise, has been added to the UNESCO's Cultural Heritage List. Why? In my view and my experience, I describe Tai Chi like this. If there is a medicine in the world that can give you long-lasting good health without any side effects and doesn't break your bank, would you like to know it? I would imagine most people's answer is yes, please. Well, Tai Chi and Qigong can be described just like that, a form of energy medicine. Here is why. The exercise of Tai Chi and Qigong can remove stagnations of Qi, 疏通经络 It also restores the balance between yin and yang energy. 调节阴阳. It revitalizes the vital energy in our body. 活血化瘀. It also replenishes the vibrant and vital energy in our body. 固本培元. A little later, I will take everyone through a few simple movements. But first of all, I would like to draw your attention to some of these key Tai Chi principles and character requirements that give and deliver the health benefits. Right from the beginning, when we practice Tai Chi, we want to keep these essential requirements. Enter a state of mind that is calm, tranquil, quiet, peaceful frame of mind that we describe mindfulness or meditation state of mind. With the physical requirements, we need to remember our crown will lift upwards and chin slightly tucked in, allowing the Bai Hui to be suspended from the ceiling. Tongue touch the roof of the mouth. And breathe smoothly. Knee soft and slight bent. Drop the tailbone down as if we are sitting on an imaginary stool. All of these is try to open the energy channels. And shoulder should be down, elbow should be dropped down. This will try to release any tensions and stiffness on the shoulders and neck. And the pattern when we do movement should be coordinated with inhale and exhale. Breathing should be nice and smooth with the rhythm of the movements. For example, rising is inhale, sinking movement is exhale. The second movement I will take you through is called repulse the monkey. Only on the arms, we just keep the feet still to experience the characteristics of Tai Chi. The requirement for all arms movement needs to be nice, relaxed,
Everybody
and
pay
soft.
attention. Everybody pay
Not
attention.
to
Because
have any
Dr. Lee,
rigid,
this
hard
video is
movement.
long, and we
This
will not play the
including
whole
the
video.
relaxation
We
from the
will
waist,
cut off,
from the
and
lumbar,
on
the
time we try
torso,
get back
as
the
well as
schedule.
the joints of the shoulders, elbows,
After
wrists,
this
fingers.
video, few
And not
minutes, I
to
will stop. And if you want to
move
watch
in
whole
a
video, we
rigid,
will play
locking
later.
any joints.
Okay. So and
However,
also,
this
I
softness
want
carries underneath
invited
the
everybody
underlying
turn on your
strength,
video,
not
then take the
soft
group
as
picture
noodles,
when we stop the
not
video.
soft as no strength,
Included
but the
our
strength is
webinar
underneath the
side, the
softness.
attenders. You can
The
turn on your video,
balance between
but you cannot
yin
right
and
now.
yang.
So what
We
I will do, I
shortly
will try
experience that.
invited you go in to the presenters, the group.
Other side,
Then you turn on
this
your
is the
video,
other
take the
side
picture.
of balance, the
Okay,
left side
if
of
you
the brain
online
and
with
right
the
side of
you
the
want picture,
brain.
then you can turn on your video.
As well as being soft
If
and
you want to do
relaxed.
that right now,
Also,
I
the
beginning
movement of
invite
Tai Chi
everyone go
needs
in.
to
But
follow the
please,
rules
when you
of
finish the
natural and
picture,
roundness,
please you
which means
by yourself
the
move back to the
circle we
attended
create,
the
the
group.
arms movement, the
This
waist
place
movement
just
is
still
all
keep
in a
for the
rotation.
the
Arms
presenters. That's
rotation,
much more
lumbus
easy for
rotation,
every
and
job.
torso
Thank you
rotation.
so much.
So follow
Okay, right
the
now I
pattern
beginning
of
invited
the
you
symbol
guys,
of
everybody.
yin and yang. And the third movement I'm going to take everybody through is called
Please
low
accept
Si
me,
Ao
invite
Hu,
you
brush
inside
knee twist step,
if you want to take group
including
picture.
the footwork. And here we can experience how the coordination
do
in
this
Tai Chi
again
is
and
unique,
this afternoon.
coordinating the upper and lower body. And we should always use the
Bill, you
waist
still
to
there?
lead the arm, and the strength, allowing the
Yes, I am,
field of
Jack.
power comes from the
I like
feet
you give a
and
part of it.
gathered, directed, and
Yes, this is an
centered in
excellent
the waist.
presentation. I just want
And
to say,
use the waist as
Yeah,
the
of course.
leading
yes,
energy
very clear.
into
Very
I
the
clear.
like to see too.
arms, the wrists and fingers. Only reflect it and show as an expression of the body
We have a
energy
lot of
in the
this,
arm.
not only
How
her.
these body movements and arms movements
And are these
foot
available at your
movements
website?
should all be
Yes,
moving
we will.
in the rotation of the energy. And this
That's why the
energy
bill, please
rotation
tell more
act
people
as a
today we are
massage
English
to all the
presentation,
energy
but
meridians.
our not reach too much the
Here
English
is the
person. That's
opposite
our the problem.
practice of the
Yes,
So
same
we
we'll-
need your
move.
help.
Left
Yes, we'll get
side
better as
and
we go
right
along.
side. Again,
Yeah, but we
it's
slowly
training and
change it.
practicing the
We have a
coordination
lot
of
of
left
Chinese,
brain and
everybody know,
right
because they
brain,
use the
as well
WeChat
as
connect.
upper and
Yes,
lower bodies.
well, I think it's, I
movements.
think this
If we
is
have
very
time,
exciting, this,
I
you know,
will be
multinational
sharing
connection,
and leading you
you
with
know, of a
is
global,
called 野马分
you know,
钟,
effort to get Tai Chi and
parting the
Qigong out there. It's
wild
very
horse's
important what you're
mane.
doing. I
This is
really
a
hope
representative
success
of
and
the
that
24-step
people
Tai
share,
Chi
share
and
your
many
work.
other Tai Chi routines. And here I would like to lead everybody experience the flow
Yeah, if
of
you want
Tai
go
Chi,
into group
连
picture,
绵不断.
so
The flow of Tai
attender,
Chi
please
without the
accept
break
my
can be
invitation.
described as the moving
Click on something, then
meditation.
you can go in.
So it is
It
like
takes
the
my long
passing
time.
cloud, the wandering
One by
cloud,
one invite
and
you.
the flow, the peaceful flow of the river. 行
So
云
after we
流
take
水.
group picture, then we
The transfer of
then
one
we
movement
then
to
please
another.
use a
It's
feedback.
like
Or if
the
you stay
end of
inside,
one,
please keep
beginning
quiet
of another.
for sure.
The new movement is born out of the previous movement. No apparent stop, no pause or jerky movement. And this is a very important movement. No stop and start. Just like the energy travels in the body, is constant, is regular, and is
One thing I found
continuous.
after 20
So
years of
if we
organizing
have
World Tai Chi
time,
Day
we
is
can
I learned
experience
something
the
valuable
fourth
from
movement too.
every Tai Chi teacher
Okay,
that I
this
meet.
is finished
It's,
the
each
end
Tai Chi
of
teacher
my
has a unique
short
way of explaining these
PPT
things that we can
presentation.
all benefit from.
Now I would like
Doesn't
to
matter how
take
long they've been
everyone
teaching.
Everybody inside,
through
turn
a
on
few
your video.
movements
Turn on your
just to
video.
digest and feel these few principles. As always, we spend
请每一位老师啊，都打开你们的视频，我们马上做一个集体的照相。请每一位老师都打开视频，我们来做一个。
please turn on all your camera so we can take a group photo.
Yeah, if you still the outside the group, then you just please accept my invitation. Then go in, then turn on your video. Turn on your video, please. Rose, turn on your video. Jennifer, turn on your video. Dr. O, turn on your video.
Dr. 欧阳
Yes.
把那个我们终于见到了，请把你那个摄像头打开。
好 everybody turn on your video. Now we take one group picture. Group picture. 1, 2, 3. 1, 2, 3. Yeah. 1, 2, 3. And hold on. This is a larger computer. We can take the picture. Okay. Okay. 把李辉老师的脑袋显出来，这样我们会更好。OK， 1, 2, 3. One, two, three. Okay, thank you. Thank you, everybody. Okay, so right now, I will stop the the video for right now. Then we go in the next one. The next presenter will be the Rose, you still there? Okay, it's fine.
我来吧。
你来。
The next presentation will be welcome. The three presenters is Marianne, Ola, and Boris. Both three of them from a different background, the midwifery, or dancing, or traditional medicine, and the physiotherapy. They're going to discuss the very important topic about the Chinese medicine 推拿 and the Yi Jingjing for the post-COVID dry eye condition. All three of them from Georgian College, Ontario, Canada, and is the only acupuncture program in Ontario. So let's welcome Marianne, Ola, and Boris for their presentation.
Great, please.
And you can ask some question after their video presentation. 傅博，您那有可以放好。During time, maybe Boris, you can give some talk, or Ola give some talk. This is on your word stage. So before the video, so go ahead, Boris, Marianne.
Yeah. Well, thank you very much for this invitation. I'm Boris. Also, as David said, I'm acupuncture student at Georgian College, and I'm physiotherapist from Chile. So nice to meet you, everyone.
Marianne or Ola?
Hi, my name is Mariam, and thank you so much for giving us this opportunity. I'm an acupuncturist in Georgian College in Ontario in Canada, and I'm so glad I'm here. In the past, my background history is midwifery, and I've had about 22 years as a midwife, manager, head nurse, supervisor, and now I'm an acupuncture student, and I love the acupuncture too. Thank you so much for giving me this opportunity. Thank you.
Ola, you're the last word, please.
Hi, my name is Ola.
Hi.
I'm an acupuncture student from the Georgian College in Ontario. I'm glad to be here. My background is the acupressure and trainer in Vietnam, from Vietnam for 4 years. Thank you for listening.
Yeah, I also want to introduce this hoster right now. He's our vice chairman from the school, from the university. His name is Dong Liu. He's Dong Liu, the professor.
Thank you. Thank you, Dr. Jack Fu.
Hi, everyone. My name is Mariam Soltani, and we are acupuncture student, and with Jose Boris Garrido and Ola Tak Nguyen from Georgian College Acupuncture. We wanna explain about the Qigong and Yi Jingjing and Tuina massage for eye. Yeah, Yi Jingjing, Qigong, and Tuina for post-COVID dry eyes. First of all, I explain about some fascinating facts about the eyes. 80% of all learning comes through the eyes, so we need eyes and we should protect our eyes. And the eye has the fastest contracting muscle in the body and contracting in the less than 1/100th of a second. The only organ more complex than the eye is the brain. And also eyes focus on 50 different objects every second and can distinguish approximately 10 million different colors. Also, the colored part of the eyes or iris has 256 unique characteristics, but just fingerprint has just 40. And also we can see just 1/6 of your eyeballs. And the average person blinks 20 times a minute. Also, the optic nerve contains more than 1 million nerve cells. And another interesting thing, it is impossible to sneeze with your eyes open. And about the post-COVID syndrome, there is one question. Are dry eyes a symptom of COVID-19? Based on many studies and research, yes, dry eyes can be a symptom of coronavirus disease 19 or COVID-19, as can other eye symptoms such as soreness and sensitivity to light. Also, eye dryness can stem from many other factors, including some related to the pandemic, such as wearing a mask and having more screen time.
The other symptom of the COVID is we can see the fatigue and affect to the lung. And the post-COVID syndrome involve variety of new and return or ongoing symptoms that people experience more than 4 weeks after getting COVID. So not only affect to the lung, the post-COVID symptom can be appear in the neurological symptom, joints, muscle pain. Some people might experience with the heart symptom, digestion, or some is a blood clotting.
Okay. In the following, there is another question. Does Qigong and Tuina massaging eyes improve vision and dry eyes? Yes. Based on Hayashi and Du research on 2021 regarding to effect of massage for ocular blood flow or OBF and vision, physical stimuli such as pressure and abrasion to preocular regions and short-term preocular massage with Chinese eye exercise can improve OBF, and any increase in OBF induced by massage may improve vision. So the massage is helpful. There are some important acupoint around the eyes that reduce the occurrence of eye fatigue, dry eyes, blurred vision, headaches, especially cluster headaches, or other symptoms of eye strain. There are some acupoints here, like bladder 1 and bladder 2, and gallbladder 1 and gallbladder 14, stomach 1 and stomach 2, Sanjiao 23, and some extra points like Taiyang, Yuyao, Shangming, Shangjingming, Jianguang 2, and Xingming 2. Also, another important point for calm the mind is Du 20. Another important acupoint for benefit the eyes is gallbladder 20, and the location is on the nape below the occiput at the level of Du 16 in the depression between the upper portion of muscle sternocleidomastoids and the muscle of trapezius. And in the clinic, we needle the GB20 in two different directions. One is toward the root of the nose, that you can imagine the blue color in the picture is in the circle is root of the nose, and the direction of the needle toward the root of the nose, and the other is orange color, is imagine two eyes and two different direction to the eyes, to opposite eyes. And to different sensation, the patient can feel two different sensation. Which one is toward the root of the nose? The patient feel warm sensation, and the other is toward the opposite eyes. The patient feels eye moisture sensation. Related to these two different direction and two different sensation, I searched and there is a possible hypothesis for two different sense, because the needle direction to the root of the nose is toward the hypothalamus. Hypothalamus is the level, at the level of the root of the nose, and one of the function is regulating body temperature. So the needle direction to the root, I assume the needle stimulates the hypothalamus, so the patient feels warm sensation. And the other possible hypothesis for these two different sensations is another needle direction is toward the opposite eyes, is toward the lacrimal gland, and the lacrimal gland is located within the orbit above the lateral end of the eye. It continually releases fluid or tears which cleans and protects the eye surface as it lubricates and moistens it. So the possible hypothesis is when needle is direction to the opposite eyes, it stimulates the lacrimal glands, and so patient feels moisture in the eyes. There are some techniques for tuina massage. One is pressing the eyes with a warm hand, and it smooths the chi, improves blood circulation, dispels wind, and helps eyesight and treat tired eyes. As you know, in the picture, we should cover the eyes, but rub the palms. The palm is much better for cover the eyes. So the first rub the palms together until they become warm, then close the eyes and put the warm hand on them like this, and press and iron out the eyes. But one important thing for every technique really related to the eyes is clean hand. Wash hand or rub hand is so important, because the eyes is one of the parts of entry for infection. So benefit of ironing the eyes is bring heat, blood, and oxygen to all the acupoints around the eyes, and also help bring vital nutrition to the eyes and refresh those tired, sore eyes. Yeah, another kneading the eyes is circular movement and very gentle knead all skin around the eyes, eyebrow into a little in the forehead. Can spend as much time as you like it. Stimulate lots of collagen production, so any of fine lines and wrinkles around the eyes. Another technique is rubbing the eyes. You can place the thumb in the temple and curl the index finger and use the first knuckle of the proximal pharyngeal point. Press from inside corner of the eyes and rub gently across the eyes. And there are 3 different levels of intensity. For example, above the eyes, press hard. Below the eyes is related to stomach 1 and 2. Press medium pressure. And on the eyes, because the eyes is so sensitive, press lightly is enough. And there are some points pressing. Press a little bit massage on the acupoint around the eyes using just use single fingers enough for the pressing. You can do and massage for 1 to 3 minutes, like bladder 1 and 2, Sanjiao 23, gallbladder 1, and also stomach 1 and 2. Well done, eye to inner massage. Let's discuss and practice Yi Jinjing Qigong for eyes. Sanjiao 23, gallbladder 1, and also
Yi Jinjing.
1 and 2.
Yi Jinjing. It's a series of 12 exercises coordinated with breathing.
可以说话，你来看，我就在想这个角度问题。
When we practice Yi Jinjing.
我正在设置这个镜头的
Chinese, Jin means change, and Jin means tendon sinews. So that is very important. The sinew channel.
那个校长跟我在一起，有什么事说 ，Jennifer。
Yi Jinjing is an intense practice. Help us to strengthen the muscle, the tendons, and also promote the flexibility of the body, improve the balance and coordination. Femoral nerve, it's related with gallbladder, sinew channel, and also gallbladder is related with the femoral and sciatic nerve. The femoral nerve supplies some of the muscle that are in the anterior part of the thigh, like the hip flexor or the knee extensor. For example, hip flexor, peroneus, iliacus, sartorius, and knee extensor like quadriceps. Sciatic nerve. Also the sciatic nerve passes through the gluteal region, but it does not innervate the muscle there. However, this nerve go directly innervate the muscle in the posterior compartment of the thigh, like the hamstrings, and the hamstring portion of the adductor magnus. Qigong, we're going to practice the form 11, Dagong Qi. It is good, for example, to treat some post-COVID symptoms like headaches and migraines. Also help to clear eyes and improve sleeping problems and anxiety. How to practice this form of Qigong or Yi Jinjing. We're going to start with hands in Dantian. One step to the left side, and we're going to put our hands behind your back, and the hands are going to going up from your hypochondral region, behind your ears, and then stretch your arms. Elevate your arms and lift your heels. Then you're going to cover your ears with your hands and press your ears 3 times. Then you're going to click 24 times with your index and middle finger on the back of your head. Then slowly sit downward, place elbows on your knees, stretch your legs, and click your teeth 36 times. After that, bend your knees and slowly lift up your upper body. Stretch your hands upward and lower your hands beside your body. Then you can repeat the routine to the other side. When your arms are stretched up, it's good that you think that you are receiving the energy from the universe. The chi goes from the corner of your eyes, like the gallbladder channel, circulates inside your head and goes along the side of your body to the tip of your 4 toes.
Next slide, we will talk about I Ching Ching exercise for liver channel. Like we know, liver is the biggest organ in our body with just 600 functions. So following TCM, traditional Chinese medicine, liver is the yin organ belong to lower jaw with paired with gallbladder, and with the main function is a free flow of the qi and store blood. In the slide, we can see the liver channel is originate at the lateral aspect of the dorsum. Big toe is, we call the liver one. Extend along the medial aspect of the lower leg, knee, thigh, and continue the pelvic region. It's encircle the genital and then ascend enter the lower abdomen. Internal, we can see internal pathway is cross the diaphragm, access along to the neck, posterior aspect of the throat, and link with the tissue in the around the eye. We can see the liver channel is connection with the gallbladder, lung, and stomach also. This is the exercise for the liver channel. We call is the swing the tail. For first of all, we need to breathe in and breathe out for the relaxed ulnar muscle. And next one, we need to bend our upper body forward to completely forward leg straight. Gentle bend your knee and bend your knee and press your hand onto the ground, fingertip facing inward. The third one, the eye will look the side of the head up while I sway the hip forward. Sway motion your body. We will do that 3 or 4 times each side. After do this movement, we will bend the knees slightly and slow bring the body back to the posture. This is anatomy. We can see the most muscle involved to the exercise. We can see the quadratus lumborum, iliacus, lower limb muscle. The liver sinew channel, most of muscle linked with that is the anterior adductor, such as the adductor longus, adductor brevis. In next slide, we can see more detail to the movement. We can see it's not only involved by the muscle, it can affect to the pelvic area also, lumbar and sacrum. That's why it's called swing the tail. By the slide, we can see the connect liver channel with the internal organ, and liver is open in the eye. So the liver channel exercise has good benefit for the dry eye, like we mentioned in the previous slide. And another post-COVID symptom, we can see another post-COVID symptom is fatigue, short of breath, is related with the lung. And the liver channel is a connect with the lung also. We know the liver is the function with free flow of qi that is affect to the emotion. That's why when we practice the liver channel, it will be make your liver is a strength, and that is can reduce some post-COVID symptom like anxiety or insomnia. So that is our slide talk about the Yi and Traina for dry eye as well as for the post-COVID symptom. So thank you for the eye trainer massage and Yi exercise for gallbladder and liver. We can alleviate some common symptoms in post-COVID patient like blurred vision, dry eye, headache, insomnia, anxiety, even the muscle pain or another one.
Hi, Dr. Liu. Your turn.
Hello. Oh, hello. Thank you very much for the presentation from Ola, Boris, and Marianne. There is an excellent presentation regarding the post-COVID symptoms like a dry eye or blurry vision by using the acupuncture for GB20. There is very important hypothesis about the sensation, the warming sensation of the GB20 or cooling sensation of the GB20 or moisture sensation of the GB20 in the eye area during the needling or Traina. So it's a real discovery, and we're looking forward, and they're looking forward for the more research on this topic about the to improve the eye vision, and especially after the COVID and during COVID or long COVID or post-COVID, people have several conditions and such a dry eye or blurry vision or poor vision. There are lots of factors to contribute to that, and in this presentation is wonderful. And I have a question for Boris or Marianne, Ola. How are you going to continue using the Yi or eye Traina or the GB20 sensation to the patient for future?
Thank you so much, David. As I learned in the clinic about the GB20, there are different techniques or different direction in the needling on GB20. And so based on the sign and symptoms of the patient, we can choose the direction or the technique to improve and increase the better effect for the patient based on the sign and symptoms. In the future, we can try another techniques or another differentiation direction to GB20, and we can search about the different sensation of the patient. We can try in the future. Thank you.
Thank you. Thank you, Marianne, and thank you, Boris, and thank you, Ola. The next presentation will be Fisher. I believe Fisher is ready. So let's welcome Fisher from Georgian College, Ontario, Canada. And Fisher, please turn on your camera and introduce yourself, please.
Hello, thank you, David. My name is Fisher Stubbs, as David said. I'm a student of his at Georgian College here in Barrie, Ontario, Canada. I want to thank everyone for this opportunity to speak in front of you all at this conference. I'm honored to be a part of the 6th World Conference on Integrated Medicine, and I hope you find my presentation informative and useful, and I hope that you please enjoy.
Fisher, I believe you're going to apply live.
I see whoever's sharing their screen, they have my file here.
Yeah, you can share the screen. Are you able to share the screen yourself?
I can try to. Okay, I will begin now. Let me know if there's any issues.
Go ahead. So let's welcome Fisher.
Greetings, medical professionals from around the world. My name is Fisher Stubbs, and I'll be presenting some Yijing Jing Qigong, as well as some Baoduan Jin Qigong. Thank you for allowing me this opportunity to present at the 6th World Conference on Integrated Medicine. I greatly treasure this opportunity. So a little bit about myself. As I've said, my name is Fisher Stubbs, and I'm a student of acupuncture at Georgian College in Barrie, Ontario, Canada. I've only been studying for a year, but I've already witnessed the benefits of TCM for many people's physical and mental health, both myself and my friends, as well as patients I've had in clinic. I believe that there's this undeniable power of the human body to heal itself, and I believe that exercise
Oh, well, Fisher, we cannot hear your voice. Maybe you're just like me, and during the video, you can turn on your microphone and talk until I believe the voice will come back. Please.
Okay, so if the audio is not working, I'll just present from the slides in my document.
You want me to play the video for you?
Yes, I would appreciate that very much. Thank you.
No problem.
Greetings, medical professionals from around the world. My name is Fisher Stubbs, and I'll be presenting some Yijing Jing Qigong, as well as some Baoduan Jin Qigong. Thank you for allowing me this opportunity to present at the 6th World Conference on Integrated Medicine. I greatly treasure this opportunity. So a little bit about myself. As I've said, my name is Fisher Stubbs, and I'm a student of acupuncture at Georgian College in Barrie, Ontario, Canada. I have only been studying for a year, but I've already witnessed the benefits of TCM for many people's physical and mental health, both myself and my friends, as well as patients I've had in clinic. I believe that there's this undeniable power of the human body to heal itself. And I believe that exercise is one of the strongest tools that everyone has to help them maintain their health. One of the best aspects of Qigong is that it can be performed anywhere, sitting or standing, so it's available for those with limited mobility as well. Qigong's a gentle movement, and it's beneficial for people of all ages, and I think that it's also beneficial for people at all levels of physical fitness. I hope to integrate many aspects of Qigong and patient participation in my future practice of TCM. So what is Yijing Jing and what is Qigong? For those of you who already know, this might seem a bit as a refresher for you, but for those of you who have never heard about these things before, where there might be a few of you, here's a little overview. So Yijing Jing, or as it translates to English, muscle and tendon changing classic, is a form of Qigong exercise. And Qigong is a group of gentle exercises that consists of moves performed by themselves or in combination in sorts of routines. While performing these moves or a specific routine, there's a meditative amount of focus placed upon one's body's posture, its balance, and the power throughout these movements. These actions help to work and stretch the body's muscles, tendons, and ligaments, which can result in improvements to one's range of motion, mobility, and resilience to injury. So not only does Qigong improve the tissues of the body, but it also, as these tissues move, it helps to circulate fluids of the body, such as blood, synovial fluid, and lymph. These gentle exercises also work to sharpen the practitioner's proprioception, which is that sense of your body's positioning, and it's also related to your mind-body connection. So having an improvement to these functions can have broad benefits for both patients and practitioners. Pretty much anyone can benefit from this. So these exercises are an important tool for daily health maintenance that can be performed anywhere at any time for no cost, which I think is important, as healthcare is needed by all, not just those who have the money and time to go and visit someone at their practice. So before performing any of these exercises in my presentation, I'd recommend first centering the mind and body by collecting or gathering qi. So this is a form of breathing exercise that you may recognize. You may have seen this before, but I find that it's a very personal experience. So what you're doing is you're raising your arms at the sides of your body with palms upwards as you breathe in. And as your arms reach the apex or the top, that's when you're going to hold your breath in, not by closing your mouth or your nose, but by holding your diaphragm so that the breath doesn't leave. As you lower your arms in front of your face, you're going to start breathing out. So when you're performing these exercises, a lot of people do them in classes, so you don't need to worry about how fast you're doing this. What you need to worry about is what matches your own breathing. You don't want to be doing this at speed, obviously, because then you'll result in hyperventilation. But whatever speed is most comfortable and natural to the performer. So improving one's mind-body connection starts here. You need to center the mind and the body. Find a good baseline to continue on with these exercises. So that's why it's so important to find a comfortable rhythm. As well as beginning exercises with gathering qi, I like to finish exercises by gathering qi. This sort of centers the mind and body once again and might make the effects of the exercise more noticeable as you return to this sort of baseline. So here's the first form. This is the Yi Jin Jing form that I'll be teaching you today. It's form 3. So it's called pulling 9 cows by their tails. And as you can see, later we'll discuss the channels involved here, but this is essentially a lengthening and shortening of 2 specific channels, the heart and pericardium channel. So to begin this exercise, you'll stand with your legs slightly more than shoulder width apart, and you'll pick a side. Let's say you start with the right side first. You'll extend your right arm forward and your left arm backward with palms open. When you've extended your arms, not overextending, but to the most comfortable length, you'll then bring your arms back to the midline. So you'll make a fist with your hands, and you'll bring your front arm, your right arm in front of your heart, and you'll bring your left arm to behind your back, making a fist. So it's important that you do these exercises in a way that feels most comfortable. So you're not going to be trying to hike your arm all the way up your back. So you continue this exercise from the point where you have a fist over your heart and a fist around your back. You'll then extend your arms back to that original position while opening your hands. The same thing can be said on the other side. So you'll extend your left hand forward with palms open, your right hand backward with palm open. You'll be facing the left direction, so your toes will be pointing towards the leading hand. And as you extend and then contract, you'll make a fist and bring your left arm now to your heart and your right arm to your back. So when you're extending your arms, your weight will be on your front foot most naturally, you might notice, but you do want to place your weight on your front foot while extending your arms. And when you contract, you bring your weight to the back leg. So a little look at the heart channel here. The TCM heart has a few functions. It governs the blood and blood vessels, and you can think about this as it relates to heart palpitations, circulation issues, and chest pain. It also houses the spirit or the Shen, and this is important for regulating mental and emotional issues. It also opens or manifests on the tongue. So you can think about this as the health of the tongue itself, or speech and throat issues. Another important function is governing the sweating. So if you think about how during exercise your heart rate increases, you can imagine your sweating will increase as well. But this is related as well to irregular sweating, copious sweating, or no sweating at all. It also manifests in the complexion. So just as you sweat more when you exercise, your face gets redder as well. So you can see how these things are connected. But it's related to overly red or expressionless faces as well. The expressionless face might relate more to the mental aspects of the heart's function. So as you can see, the heart channel emerges from the axilla and travels along the medial aspect of the arm until it terminates on the inner aspect of the pinky finger, or the fourth finger. It has 9 points, which is similar to the next channel we're going to talk about. So the pericardium channel has a few functions here. It protects the TCM heart, and this function is it's the first line of defense when pathogens are attacking the heart. Instead, it'll enter the pericardium first. As it protects the heart, it also protects the mind. So as the heart is the house of the Shen, or the mind, the pericardium helps to protect that function of the heart as well. It also provides blood circulation to the heart, making sure that there's plenty of blood so that the heart can perform its function. Emotionally, it's related to the state of relationships to others, and it's connected to the Mingmen fire, or the gate of vitality, or the gate of life, and its ability to help us feel refreshed and capable of making new connections with an open mind while avoiding feelings of agitation, restlessness, anxiety, and insomnia. So just like the heart channel, it travels along a similar path. It's on the medial aspect of the arm, emerging around the chest and extending to the middle finger. So when we're performing these exercises, you'll see that it's an extension and a shortening of these channels. So who can benefit from these exercises? Individuals with palpitations, whether it's sporadic or postural tachycardia, can benefit, as well as those with various heart diseases. People who have disturbed sleep, whether that's from insomnia or dream disturbed sleep or restlessness, those patients can still benefit from these exercises. People with heart conditions that are not too prohibitive for gentle to moderate exercise can also participate in these activities and find benefit. And anyone with a drive or an imperative to improve heart and body health, which I believe is everyone, can benefit from this exercise too. So here it is again. Now that we know the pericardium and heart channel emerge from the axilla, or the armpit, and extend along the medial aspect of the arm, terminating in the fourth finger and the second finger, you can see this exercise through the lens of the sinew channel, which follows along that same path, but it relates to the muscles on those paths, the muscles and ligaments, the sinews. So here we're extending to lengthen the heart and pericardium channel, and we're contracting it to shorten it. And by lengthening and shortening these channels, you're stimulating them and helping to improve their function, improving the function of the related organ as well. So moving on, there's some further readings here. So the first source here is about utilization of mind-body intervention for integrative healthcare of COVID-19 patients and survivors. So this is an important source to sort of understand the role that meditative exercises can play in the treatment of long-term COVID symptoms, as well as there's a source here that explores the effects of Tai Chi and Qigong in rehabilitation after COVID-19. And this is a meta-analysis, and I think it's a very interesting read. So next, we'll look at a Baduan Jin exercise. This one's titled Looking Backward to Prevent Sickness and Strain. So essentially, we'll first cover what exactly Baduan Jin is. Baduan Jin is a form of Qigong, much like Yi Jing Jing. However, this form of Qigong focuses on stimulating the 8 extraordinary channels. Just like the primary channels, these extraordinary channels have strong functions that can fall out of harmony and later present as signs and symptoms in a clinical setting. So as Baduan Jin is a form of Qigong, it's also a form of moving meditation, and it's a strong tool to help in one's mind and body relaxation. So just like Yi Jing Jing and all other Qigong exercises, it consists of gentle movements that can be performed sitting or standing with great attention placed upon the details of one's movements and breathing. So that's the power, the balance, the transition between these forms are something that you're paying attention to while performing these exercises, improving the interaction between your mind and body and strengthening the results. Baduan Jin is also on prescribed lists of activities for COVID-19 recovery. Also, Baduan Jin Qigong is a wonderful tool to promote mindfulness, which is important for, I think, all people on earth. Placing such strong attention to the body's posture and strength and movements strengthens proprioception. So just like the other exercise from Yi Jing Jing, strengthening this proprioception has effects for the general population as well as practitioners of medicine. This improved awareness grants greater control over the body as it relates to all activities, as well as it can help grant greater control and the ability to augment treatment skills in a healthcare setting. So here's a diagram showing the movement here. So you'll start with feet just as shoulder width apart, with your weight on the outsides of your feet, with your lateral malleolus, so on that edge of your foot. You'll start with your hands facing your lower abdomen with your elbows bent comfortably and face forward. You'll then abduct at the shoulders or unfurl your arms until they're about 45 degrees, and you'll supinate your forearms so that your pinky is on top. You'll try to have small intestine 3, which we'll see later in a slide is here on your hand at the base of your pinky finger, your fourth finger. You'll try to have that reach towards the sky, and you'll focus on this point, as well as a point right below your lateral malleolus, UB62, urinary bladder 62. So you have your arms extended to either side, abducted at the shoulder, roughly 45 degrees. You have your forearm supinated, and now you're going to you'll turn your neck rather to one direction, and you're only turning at the neck, and you're only going as far as is comfortable. So as you unfurl your arms, you'll turn your head, and as you close your arms, you'll return back to the center, to the resting position, eyes forward. And then with your arms right back where they were at the beginning, you'll begin to unfurl again and turn to the other direction. You'll perform this 3 times on either side for a total of 6 repetitions. Just like you would with the Yi Jing Jing Qigong we showed earlier for the heart and pericardium. Repeating 3 on either side for a total of 6. So the involved channel, one of the extraordinary channels for Baduan Jin, so the involved channel for this exercise is the Yang Chao motility channel. And it has functions as the following. It helps to govern the body's movements, such as the gait or walking, the way one walks, as well as the balance during the day. It also relates to a person's sleep patterns. And if it's not healthy, this can lead to insomnia. So we can view this as eyes not closing when they should or staying open when they should be closed. It also helps to circulate essence from the kidney. Further, it reinforces the back hips, and you might notice that it travels along a similar line that one might experience sciatic pain, or actually it follows a similar pathway of the sciatic nerve itself. So further, it helps to benefit the back, neck, and shoulders, as well as stimulating this channel can eliminate interior and exterior wind, which you can think of as headaches, muscle tension, shaking, or muscle spasms, as well as itchiness. So here we can see the channel travels from UB62, which is right at the bottom at the lateral malleolus. It travels all the way up the lateral of the leg, up around the shoulder to the face, and then wraps around and terminates here at the GB20. A very, very common point. So we'll look at some of these points in a little bit more detail. These are some of these are crossing points, and some of these are master and coupled points. So the master point for the young chow or the young motility vessel is UB62, like we've been talking about. Right below, right inferior to the lateral malleolus, as well as the coupled point is small intestine 3, proximal to the fourth metacarpal phalangeal joint. When you're standing, you're putting your weight on the edges of your feet to stimulate UB62, and when you supinate the forearm, you're trying to focus on this small intestine 3 point, as I've repeated. Some other points and functions for these points are small intestine 10, a crossing point of the young chow motility vessel. It activates the small intestine meridian. It alleviates pain and benefits the shoulder, as well as stomach 3, which can dispel wind, relieve swelling and pain, and the all-important gallbladder 20, which dispels exterior and interior wind. Like we've said, you can think about that as spasming, muscle rigidity, itchiness, shaking. It also clears the head, benefits the eyes, nose, and ears, subdues liver yang, activates the meridian, the gallbladder meridian, and relieves pain. Some of the functions for the master and coupled point for the young chow are the master point, UB62, dispels interior wind, benefits the eyes and head, relaxes the sinews, treats epilepsy, and calms the shen. So very much related to wind here. As well as small intestine 3, the coupled point, that benefits the neck and back, activates the meridian, expels exterior wind, regulates the du meridian, which travels up the spine and around the front of the face. As well as calming the shen or the mind and treating malaria. So here's a little bit more about the finer movements here. These are important aspects of the exercise, so it does bear repeating. So we're rotating the forearm, we're supinating the forearm to let small intestine 3 face upwards, and you're abducting laterally roughly 45 degrees with your shoulder. That's the resting position you'll find yourself in, at roughly 45 degrees of abduction. When you're standing, you're going to let the weight sit on the outside of one's feet, the lateral aspect of one's foot, by slightly inverting the ankle, thereby stimulating urinary bladder 62. When you're turning to look backwards, you're turning only at the neck. You're not involving the thoracic spine. It's only the cervical spine. And you're only going as far as is comfortable. And you may find that through repetition, you can go further. But it's not a main aspect of the exercise, despite the name, looking backward to prevent sickness. You're looking backwards as much as is comfortable. Just like with the chi collecting, you're finding this baseline, this speed that your body's comfortable at moving, along with your breath. So you're finding the most comfortable way to move with your breathing. So you're going to be doing these exercises at different paces than those around you if you're performing them in a group. I find that personally I've enjoyed this exercise, as well as the friends and family who I've shown it to, as well as patients have enjoyed this exercise. Occasionally with my patients, I'll give a few exercises for home care, and it's this one above all others that seems to stick with the patient. They benefit from it clearly, and they incorporate it into their daily routines. So as well as people who have rigid shoulders will really enjoy this exercise. Anyone who works at a computer or works with both of their arms in front of them, such as an acupuncturist or a factory worker, a typist, anyone who's doing work with both of their arms at the same time, a cook, anyone. So these people, and as well as anyone with stress, might carry their tension in the back of their neck. And this wind is able to be released by stimulating the yang chow motility vessel by performing this exercise. So this is a particularly useful exercise for students who are both stressed and working a lot of hours behind a computer or at a desk. This will help. This will give them a tool for relieving that strain on their neck and shoulders, as well as improving their sleep symptoms, because as everyone knows from their experience in school, is sometimes sleep is the last thing that's on the priority list. It's the thing that loses to, you know, the extra assignments. So it's an important, it sort of hits all these different symptoms related to the student lifestyle. So I think that this exercise could benefit specifically and especially students who are learning during the COVID-19 pandemic. So here's a few references, as well as some further reading. So here's a study about how Badoanjin can improve anxiety and insomnia in COVID-19 patients, as well as here's a study for the effects of Badoanjin exercise on COVID-19 related anxiety, as well as the psychological well-being and lower back pain of college students during the pandemic. So like I've said before, this is a topic that's very close to me. So I definitely see the need for young people to be exposed to these kinds of exercises and methods of daily health maintenance. So with this information that I provided in these slides, I hope that you've learned something and you've taken something that you can then later give to your patients, or something that might spark interest in researching these topics. Thank you very much for your time and attention, and I really appreciate this opportunity to speak in front of you all of you professionals from around the world. I really do treasure this opportunity.
Thank you very much for the Fisher Stubbs for the presentation. It's an excellent presentation, amazing. And my question is, during the post-COVID, lots of the people, including young or youth or college students, have sleep problems. And based on your presentation, how do you going to apply your Yi Jingjing or Badoanjin or Yang Qiao channels theory in the people who have a sleep or problem or sleep disorder during this pandemic or post-COVID, those conditions? Go ahead, please.
Thank you, David. So both of these exercises that I've shown today can help with insomnia symptoms. So the yin qiao and the yang qiao motility vessels, they work together to dictate the sleep schedule or the sleep cycle or the circadian rhythm of people. So I would direct patients to stimulating points, crossing points of the yin and yang qiao motility vessels, as well as performing these exercises. I'd recommend both to most patients. So with these exercises, you can take the sleep issue into your own hands, as well as when you're in for treatment, you can use some of these selected points to help stimulate that channel and arrive at improvements to those sleep symptoms. Thank you.
Thank you very much. It's excellent. Let's give time to Dr. Jack Fu, please.
So 现在呢，我们就非常感谢我刚才做的这个so very thankful, very wonderful the presentation, and right now we will very happy introduce Dr. Dong Liu, and he will doing some presentation about acupuncture qigong exercise for post-COVID recover. And Dong Liu, like I said, he is an excellent professor and doing a lot of job for the community, and also it's our the World Conference on Integrative Medicine, the vice chairman, and also he is our long time the friend and members, and we together organize a lot of the job. So right now, please, the Dong Liu, the professor.
Thank you, Dr. Jack Fu. You give me a lot of inspiration and the support. Thank you. And please go ahead for the video.
各位朋友，大家好。各位朋友，大家好。首先感谢傅博士给我这个机会，感谢王英秋院长提供这个平台。今天我讲的题目呢，对我来讲，对我个人来讲是非常重要的一个题目，就是新冠康复的针灸与气功的训练。针灸和气功是我的专业。
好，我想 I want to try the if I stand here, everybody can hear the voice very well or not.
刘东啊，这里听得到声音很清楚吗？还是不？
听得非常清楚，你的声音很大。
这里声音还是很大，是吗？
你声音还是很大，非常清楚。Your voice quite loud.
Very good, because this we will do in the form this afternoon in here. So, how about the picture look like it? It's great. Have your presentation here. Have everything here.
The picture.
Not so good.
Picture not so good, but the voice okay, right?
Yes.
Because this afternoon we will sit here to talk about some international, talk about some education and Chinese medicine. Since you think this is will work, the picture and the voice is okay.
The voice is okay.
Yeah, voice I use very special the mic, so it's okay. The picture it's fine. That's fine. Okay, let us try. Okay, so sorry about it, and please come back to the Dong Liu the presentation because he's our organizer, so I bother him. Sorry about it.
我个人在多伦多已经有22年的行医的历史了，主要是做针灸、推拿和气功的教学。新冠这3年以来，给很多人都有很大的震动，特别是作为一个家长，我对我自己的小孩、青少年的孩子们，昨天听到一个特别震撼的一个消息，一个研究报告，就是新冠的疫情和青少年大脑老化的关系。我们作为家长，都是 teenager 的，就是青少年的孩子，在这几年的新冠的流行期间，孩子们出现了各种各样的问题，特别是这些研究报告，美国青少年的大脑发生了生理性的变化，就在这个疫情期间，衰老的速度比正常要快得多。这是一个循证的研究，就是年轻的研究参与者在大脑的那个衰老的同时，出现了很多严重的焦虑、
the adolescent have a brain change.
这是
for the adolescents between the ages 13 and 19, not because of COVID. So what reason? About in the post-COVID, the aging adolescent and the children. So the most is isolation, anxiety, and the fear of the COVID. So those the fearness and isolation from the community is contribute the people of the aging brain.
数十项研究发现
There are more than 10, more than dozen of the research about the brain change in the post-COVID or during the pandemic.
学生们呢，这些年轻人
the student, another reason is we're talking to sleep with earlier meditation. So the sleep is real another contributor for brain change. So
冠状病毒带来的不确定性和恐惧。
So during the COVID pandemic, is the people the sleep pattern change.
数百万儿童因为新冠失去了父母。
So another thing is the sorrow of the loss of children, loss of parents, or loss of grandparents. So there's the sorrowness, the sadness, and the fearness that contribute the people have a brain change.
这是首批研究
this the first group of research regarding the anxiety or depression and the change people's brain.
那我们该怎么办呢？
So how, as an acupuncturist, how we can do? So then we're talking long-term
在
effects
北美，甚至在欧洲，在
for the
全世界
COVID.
越来越多的研究新冠的长期的影响是什么？根据美
So
国
as
疾
we're
病
talking
控制
earlier,
和预防中心
the
的数
long
据
term of COVID-19, including the sleep
大约
disorder,
1/5的成年人呢会受到
looks the
COVID-19
focus, attention problem, headache,
与
the
长
sleep
期
disorder,
新冠相
dizziness,
关的神经系统
anxiety,
症状
or even the sense
难以思考、
disorder,
注意力不集中、
or
痛、
the
视力
heart
问题、
condition, cardiopulmonary,
侦
or
测
other
感、
internal organs
嗅觉
changing.
或味觉的改变，
So as acupuncturist
以及
or
抑
alternative
郁或焦虑。
health practitioner, so
同时呢，
what our job, how we can do,
研究者发现呢，
is a world challenge.
新冠也可以与心脏、肺
As the
和其
acupuncturist
他
and the
脏器
TSM
官病
practitioner,
变外
or
观。
how we face this
这是美
rehabilitation.
国疾病控制和预防中心的数据。对于神经损伤，大脑的神经损伤，
They were talking the
目前有
nerve
很多的研
injuries
究。
or nerve deficits of
在
the
最新
COVID.
的一个研究报告，是2022年11月21号的一个研究，
There's a brand new research in
表
the
明呢，
November
感染了
2021.
冠状病毒的几个月以后，患者大脑的脑
They
干和
change
额叶
brainstem and the frontal
产
loops
生变化。
in the patient
这
months
些
after
这些
COVID-19.
大脑的区域呢，与
How
疲
to
劳、
recover?
失眠、焦虑、抑
So
郁、
people have
头痛和
insomnia,
认知问题有。
anxiety, panic
在
disorder,
这项研究呢，还指
fatigue,
出冠状病毒可以引
chronic
起
headache,
严重的长期
or
病
another
症，
cognitive disorder
即
post-COVID.
使这种病毒感染数月以后，也
How
会
we
引
can
起
do?
冠状病毒感染的后遗症。那我们
So
该
they
怎么
bring
办
a great challenge for the
作为一个临
whole
床
the
工作
world.
者，我们该怎么办？这是英国
This
这是
their
英国
British
冠状病毒幸存
Stanford
者
Hall
康复指南，
regarding the
在英国已
guideline
经
for the post-COVID recovery.
有
There
运
are
动医学、竞技
multidisciplinary,
体育医学、
so there's
预防
seven
医学康复
different
中心的
seven
医
different
生、
layers
精神病
for
学、
the
风湿病学、
post-COVID
全科病学、
rehab
心
or
理学
post-COVID
和疼痛
rehabilitation.
科的专家
So, for
制定
example,
了
the sport
7个
medicine,
维
the
度的
exercise medicine,
评估标准。
the rehabilitation
这个
department,
7个维度的包于
psychiatric or
运动
mental
控制、
health,
心脏
family
功能
disorder,
康复、
family medicine,
运动功能康复、
psychological, or the pain
心理学
medicine.
康复、肌肉
So they're real
骨质康复、
combined
神经康
the
复、
cardiopulmonary,
全科
sport
医学
exercise therapy,
在美
or
国
the
已经有
psychology, or the
也有
muscular,
了
skeletal, or rehab,
康复的
neuro
相对
rehab,
指南。
or the whole medicine
最新的
or
刚刚发表的
rehabilitation.
世界卫生组织关于 COVID 的指南
They're brand new, I believe, last week for
那
the
作为一个
WHO
中医业
guideline.
者，我们该怎么办呢？我们首先看看，除了这些工作，其他的非药物的治疗，
There's lots of
最新的
ways
一
to
个
the
研究
rehabilitation, and we
是
believe, and I believe, as a way
2022
our student,
年10月3号
our
的一个研究
TCM
报告刚
community,
刚发表的，
we have a
是高压
face.
氧舱
We
疗法
try to using
对
our
于新冠后
effort
遗症
to help people to in this
脑
rehabilitation
部的
process.
认知
And
情绪
this
的恢复，
is
这
about
是
what
非
about
常
in this
有
conference,
意义的一个
the
全
number
球研
6
究。
World Congress about
新冠以后呢，
integrative health and medicine.
能产生一系列的持续的
So they're talking
身
high
体、心理、神经认知
HBOT
和神经
is
心理的
oxygen therapy.
与
Oxygen
未感染
therapy
的对照组相比呢，
for the post-COVID
康复的患者的
brain
大脑
recovery or brain function.
它的结构
Actually,
连
our
接。
TCM acupuncture real is
这
invigorate
项研究用高压氧的疗法对
invigorate
于
blood
新
circulation
冠后遗症的大脑
and
结
to
构连接
change the brain structure,
它通
to
过
change the brain
核磁
function.
共振来研究高压氧疗法改善
And
了
this is one of the
我
research
们大
using
脑白质
MRI,
素的
using the
破坏，
oxygen therapy
有
for the
效恢复
post-COVID
改变我们的
condition.
神经通道。这种呢，通过高压氧来连接我们的神经功能。因为啊，那个新冠患者的认知情绪的康复，就是通过
The
神经认知通道的
the
再建。
post-COVID
所以呢，
mental health or
结
the
构与
cognitive
功能连通
rehabilitation,
性
they
大
they
脑
have
的
to
神经结
combine
构
the structure
和
and
功
the
能的研
functional
究的分析，
rehabilitation.
作为未来监
And
测
how the acupuncture or qigong or tai chi, what the role they can
COVID 的
play.
后遗症、认知功能、脑功能障碍的一个指标。
So we're going to face this challenge.
那作为一个中医针灸的业者，我们该怎么办？今年呢，2022年6月份发表了一篇关于针灸的一篇
This happened to the
取证研究。
June 2022.
这篇研究
Another
呢，
evidence research.
他认为中
This
医
evidence research the
从
long
中医
COVID
的
or
角
post
度
COVID
来诊断这后遗症
heart
呢，
qi
往往
deficiency,
是心
lung
气
qi
虚、
deficiency,
肺气虚、
spleen
脾气
qi
虚、
deficiency,
肾
and
气
the
虚。
kidney qi deficiency.
他用头针、耳针和
They're
指
using the
针
scalp acupuncture
治疗胸
Auricular
闷呐、
acupuncture
心悸的
and
症
the
状
body
能够全部
acupuncture
缓解，
to
而
treat
通过物理治疗，
chest,
它结合
chest
物理治
tightness,
疗，
palpitation,
新冠的后遗症呢
or
得到迅速的康复，
positioning
并
tachycardia,
恢
for
复了
example.
正常
They're
的身体
treating
的锻炼。
And their diagnosis is real just
这
heart
篇
qi
针灸治疗
deficiency,
新冠后遗症的循证研
lung
究
qi
呢，
deficiency,
它
spleen
的
qi
结论呢是
deficiency,
针灸似乎
or
有助于
kidney qi deficiency.
这个新冠肺炎长期症状的一个康复。
For those
同
based
时
on
呢，
this
他建议呢，
diagnosis and the treating for long COVID symptoms.
针灸作为一种非常有吸引力的潜在性的
This
治疗新冠后遗
from their
症的疗
research,
法，
acupuncture
可以
as a very
参
attractive
与到整体的
therapeutic
康复治疗方法中，
rehabilitation techniques
包
or
括
procedures
物理
to
治疗
treating
结合在一
long
起。
COVID.
给新冠肺炎后遗症的患者的康复指南，作为一定的参考。
So we need to develop our
那
own.
我个人一直在做临床的工
This is
作，
my
最近这
personal
2年呢，
formula
做了大量
and the
的
research
临
formula.
床的观察。我的个人的针灸和的选择
This is
的
my
穴位
treatment，plan.
我现在给列出来。
So there's a treatment plan for the post-COVID symptom. For example,
头针
with
呢
step acupuncture.
特别强
People
调
have a mental or sleep disorder.
胆经的
GB12,
软骨、脑空、
GB19,
风池。
GB20
百
for the
会
all the sleep
四神
disorder.
冲
The GB20,
在百会上，我们有同学，就我带的学生，有专门对百会的过眼热、过眼凉的
Or
研
you're
究。
talking earlier for the
这是后遗
heating,
症
the
演变，
warming
我
sensation,
们的
cooling sensation,
学生，
or
我带的
moisture
学生有做这
sensation
方
for
面
the
的报告。
GB20 and the
请大家
GB20 and the
关注
GB20.
这个是
How to combine
头
it
部的
together. It's a very
针
interesting
灸。
hypothesis.
耳部的针灸呢，我们特别
And
强
for
调对于
treating
很多
post-COVID
青少年
or
那
treating the
个
patient
学
of sleep
那
problem,
个大学生
treating
或
the,
者是
those
这
condition by
个
using GB20
年轻
and
人
GB20.
的焦虑、疲劳，这种事物
or treating the
模
fatigue,
糊，那个
anxious
这些的后遗症
condition,
神门、
the
下丘
shenmen,
脑
hypothalamus,
和
the
point
point zero.
这些的
So those in the auricular acupuncture.
耳针的穴位的选择。对于心气虚呢，心后背
We're
腧
talking
穴
the
的
heart qi
心
deficiency,
腧穴、
the formula for the heart qi deficiency.
心包腧的穴位、
So we're looking for back
心
shu
包的
point
募穴、心的募穴、
and the front mu point
神门、
and the orange
外关
point.
这些穴位呢，可以有效的帮助
神门
心气虚。
In the heart
对于
center,
一
for
个
example.
肺气虚的
For the lung qi
肺的背
deficiency,
腧
what the
穴、
formula?
大肠腧穴、
For the back shu point of the lung,
云门呐、列缺呀、足三里
or 天枢
这些的穴位
天枢 stomach 25.
可以帮助。对于脾气虚的
So we
肺
found
腧
that
穴的
lots of the
脾、
post-COVID,
胃、
the related constipation,
太冲、
irregular bowel
三阴
movement.
交、大包、
So 我们
足三里。
coordination between the lung and the large
对
intestine.
于
Or we're treating for the lung qi
肾气
deficiency.
虚的
We also the regular the bowel
背
movement.
后背背腧穴的肾腧、膀胱腧、 关元、命门、太溪，还有肾的募穴、经门，这些的穴位是我个人在
Talking
新
GB25,
冠疫情以来治
GB25
疗新
for
冠所
treating
产生的
the
恢
patient
复
who
期的
have
一些 相
kidney
关的临床
deficiency.
症状所总结的一套
This is my personal formula, my
治疗
personal
方法，
experience for
选择
treating
的穴位的手段。
post-COVID or long COVID symptom.
在我临床中呢，每个病人都和
As
我一起练
I
气功。
mentioned, the qigong is real important.
气功是几千年
qigong and the
来
Tai Chi is part of my
中国
life.
发展的传统医术，通
It's
过
over
锻炼
thousands years.
优化身心的能量能力，改善保持健康和幸福。气功呢，调节心身、呼吸、身体的运动和体质。这是美国卫生和人类资源服务部
This
的
is from the statement, U.S. Department of Health and Human Service.
定义。
The qigong, the concept.
气功呢和冥想，在我的临床工作里呢，经常
So I
叫
personally
站
already
桩，
using qigong and
以后会
meditation.
写就浑圆桩，呼吸
浑圆
缓慢
桩
长而深。呼吸模式呢，从腹式呼吸转为结合语音、声音的变化。
So
这个
the
在临床中我
Huyan
做
we'll
的不
talking
多，但我
later.
个人
So
六
we
自觉
practice
练
with student, with patient
但
always.
是因为在临床中呢，
弘圆桩
在诊
is
所就
easier
只
and
是浑
applicable
圆桩，
to the people. Or to the
动
people
作
have
呢
a
可以轻
slow,
柔流
long,
畅，
and deep
放
breathing
松心身，
and a deep breath
心灵的
to
调
make
整，
people relax.
可视化的正念冥想，这是我们气功的治疗。气功呢，包括动态气功
qigong have
和
a 动
冥
功
想的
dynamic
静态气功，
qigong and
也叫主动气功和被动气功。
or qigong meditation.
在我个人的临床里呢，
So dynamic qigong
更多的
and
教
the
课的
qigong
教的病
meditation
人呢是静
is
的。
active and passive. They're
我
on
自
the
己，包
slide.
括我们同学们，今天我有2组我的学生讲易筋经，
So
易
today
筋
I
经
have
里
a
的
two
心
group
脉
of a colleague
和
or student or friend
心
today
包脉对于
I will
新
present
冠后遗症、
易筋经
体位性
易筋经
心慌
and 八段锦
的一些
and
训练，
real great exercise
眼部的推拿，易筋经里的肝脉、胆脉的训练。
We're talking.
对于
They
干眼
are
症
focused on the gallbladder channels,
后遗就是
UV
新冠以后
channels,
干眼的
liver channels, and even
一
use
些的
8
常识性的
extraordinary theory.
训练经验，他们会介绍给大家。他们今天讲动功讲的多一点，而我呢，在这儿今天介绍静功，就是浑圆桩。正念就是我们气功和正念，我是结合在一起的。正念，气功的正念就是注意力集中，有目的的，就在这个
This is the
当下，
concept of mindfulness.
不带主观的一个判断。
In our school, we have a special topic for qigong and mindfulness.
很多新冠以后，大家都很焦虑，各种各样的事情。
After COVID, they're
我们怎
mindful.
么样做到从这种烦乱的世界里，这种烦乱的思维中，然后达到一个正念的一个情境？这是我们通过浑圆桩可以达到的。
We use 浑圆桩。
除了浑圆桩，我们看很多都是冥想、打坐、呼吸。它为什么出现的作用呢？其实很多的现代研究，很多的科学研究证明呢，正念冥想导致神经的可塑性再生，这是大脑啊根据环境输入在结构和功能上发生变化的一种能力。美国威斯康辛大学神经科学家理查德Davidson，
We're talking the
他的研究
neuroplasticity.
呢，就是经验丰富的冥想者表现出来的高水平的伽马波的脑拧电图的活动，它就让脑电波就证明呢神经的可塑性，而且这种在 这种正能量的大脑的波形的变化，在练功中呢可以持续。
And also the
另一
Qigong
项研究
meditation increase the gray matter.
长期的冥想可以增加大脑灰质的
讲得很好，今天
质地。就是这是很早以前2005年的一项针对每天冥想这个气功40分钟的美国男性和女性研究。这些人呢，长期的冥想练功，他的大脑皮质壁比不冥想的人更厚，这意味着他们的大脑的老化速度较慢。皮质的厚度也与人的决策、注意力和记忆力有关，就是回到我们最开始，新冠疫情造成青少年老化，也是造成青少年的大脑皮质的变薄，他们就是pandemic。
This a long period.
所以呢，我们要通过各种的手段，我们能做的是针灸和气功，希望帮助到青少年，帮助到我们社区的
and the pain relief, the
病
beat
人，
morphine.
帮助到社会
Real Qigong
需要
meditation. This is a typical character.
更重要的一点呢，冥想气功呢，它有独特的止痛特性，它的止痛特性跟吗啡类似，这是2014年的研究，也是美国维克森林浸会大学的一项研究。这种冥想啊，可以减少40%的疼痛强度和57%的疼痛不适感，而一般的止痛药和吗啡通常只能减轻25%的疼痛。所以我们作为一个中医业者，你想针灸和气功的冥想，就动功或者静功是多么重要。西方对于冥想的定义呢，包括头脑的冥想、身体的冥想和感官的冥想，这和我们中医气功的正念打坐是一致的。我经常教我的学生们，教中医的第一节课，我就教大家数鸡蛋。数鸡蛋呢，就要放松，就要通过呼吸来调节，需要安静，需要稳定，需要专注。很多的时候呢，经过一段训练呢，可以数起很多鸡蛋，而且数鸡蛋的事儿呢，真的是简单。气功浑圆桩也一样，非常简单。浑圆桩就是双脚分开，
This is Qigong.
略大于肩
Fisher in the prior presentation already
身体
talking
中正，
how to breathing in and
虚灵
out.
顶
There's a
进，
breathing exercise
内视
before
丹
and
田，
during or after the Tai Chi
开
or
化
Qigong
元当，
practice.
沉肩坠肘，捋尾放松轻提，脚尖稳稳踩在地上，脚的边缘和后跟儿贴着地
And
面，
then relax kidney
涌
one.
泉，
Relax kidney one.
空虚
Make a kidney one emptiness.
屈膝松胯，保持两脚间的重量平衡分布，头脑清醒，专注自在，全身放松，让气畅通无阻。这是我今天介绍给大家的，希望有更多的循证医学来证明我们的针
So this is
灸
my presentation. I wish there more evidence research
对于新冠后遗症
about to do the Qigong and acupuncture and for the
希望我
post-COVID
们的针灸
symptoms.
和
And
气
I
功
wish
能
this
帮助到我们
COVID
社
will
区，
finish the song
帮
and
助到
all the best
很
for
多
everyone. And
我们
thank
病
you.
人，特别是青少年，
And especially
因为我们
for the future
知
generation
道
health.
青少年是这个世界的未来。当然， 不单是青少年，我们希望
for everyone, not only the younger generation.
帮助到我
For
们
I wish
每一个
Qigong and Tai Chi going
帮
to
助到这个
help
社会。
going to give you the benefit
好了，
all
谢谢
the
大
age
家，
people. So let's practice Qigong.
谢谢各位，
And thank you
我们
very
说
much.
有
And
问
make
题
it true.
请联系我，我是
And
刘东，在多。
好的，非常感谢这个刘东老师啊，感谢我们刘东老师精彩的演讲。下面呢，想问一下杨国燕老师，你在线上了吗？还是说你在 waiting 里面？没关系，我们就这样，那个 Jennifer 你就先放她的录像，然后我把她请到我们这边来。杨国燕老师，请你在 waiting 的那边，听众那边呢举一下手哈，举一下手呢，我就好把你拉进来。因为我们这次为了保证大会的顺利进行呢，我们是把它分成了2个组，所以这个比较麻烦，但是也是有必要的。请你在上面举一下手。好 ，Jennifer 可以放她的录像了。还是说你那里还没 download 下来？我这里可以放也。
这边还在等哎。
好，那我先放。好的，我来放他的录像。非常感谢刘东教授刚才的精彩演讲。Very thanks, Dr. Professor Dong Liu, and you did great job. And right now we will invite another very famous, very young, the master, Tai Chi master, the youngster Tai Chi master. Let us see what he say, what she say. 没有声音是吗？
你要我这边放吗？我刚download完。
正在放了是吧？可以吗？
可以了。
声音听得到吗？
没有听到声音嘞。
那你那边放吧，我这边退出。
各位领导、专家、参会的各位朋友们，大家好，我是来自澳大利亚悉尼大学国家辅助医学研究院的博士后研究员杨国燕。非常感谢傅学礼执行主席的邀请，让我有机会在这里跟大家分享我近期和我的团队做的对太极拳临床证据的总结。那对于太极拳的身心健康有哪些益处？我们做了比较严格的一些总结、分析和评价。那首先我们来看一下锻炼身体的重要性。国际和国内的指南呢，都专门的就是特别的指出了锻炼身体的，特别是规律锻炼的重要性。那规律锻炼身体它的好处有哪些呢？包括有增强体能、改善身心健康、提高生活质量、降低患病的风险、降低超重和肥胖的风险、改善血压、血糖和血脂水平。可以看出，它可以大大的减少我们患很多慢性疾病的这些生活方式的风险因素。
刚刚在播了，
包括如上图所示的有世界卫生组织的指南，还有欧洲的一些指南、美国的一些指南和澳大利亚的一些指南。那我们以世界卫生组织的这个指南为例来看一下，成人和老年人呢是推荐每周至少有2个半小时到5个小时中等强度的运动，或者是每周有75分钟到2个半小时高强度的运动。另外每周还要有2天的肌肉锻炼的这个运动，也就是说至少每周要每天半个小时的活动，坚持这样子去做，才可以达到最低要求的这个指南的标准。65岁以上的老人呢，要求每周至少有3天以上 包括有功能、平衡和肌力训练的这种运动。
点那个链接。
那既然指南是这样推荐，那我们以澳大利亚为例来看一下这个大家参加这个规律运动的这个情况是什么呢？根据澳大利亚医疗和福利学会以及澳大利亚统计局的研究结果来显示呢，在澳大利亚超过半数以上的成年人都没有达到这个指南规定的规律运动的标准，而70%的儿童7到2岁到17岁的这个年龄段的孩子们呢，也没有达到规律运动这个指南的标准，而这些就是说不规律的去运动呢，可能会造成很多的疾病，包括像糖尿病啊、肠癌、子宫癌、失智症、老年痴呆、乳腺癌、冠心病和中风等等。那太极拳其实可能是为大家提供了一种非常好的选择。为什么？因为它不仅适合于各个年龄段，而且还是能够适应个体化的需求，也就是健康人可以练，身体有一些疾病或者是一些慢性病的也可以来练。它是动静结合，快慢相间，会很有意思，很有趣，练的时候充满愉悦感。而且它有多种的样式可以选择，比如说传统的陈式、杨式、孙式、吴式、武式，还有很多现代大家改编版这个竞赛版和这个精简版等等的。而且它有不同的样式，即使是同一个，像陈式，它有陈式83陈式新架、老架等等的很多样式可以来选择。另外，它习练的形式也可以多样化，它可以自己一个人练，也可以一个群体一起练。所以它的这个形式是非常多样的，而且它不需要任何的设备、特殊的装备比如说游泳，我们需要游泳池，我们需要游泳的这些设备。太极拳不用只要穿着宽松舒适的衣服就可以了，而且场地也没有特殊的要求有个1米见方的这样的地方也可以练习有很宽敞的地方也可以练习，室内也可以练习，室外也可以练习。而且所以它没有什么特别的场地的要求，而且它内涵非常的深厚，博大精深，它包含了中国传统文化、中国武术的这些精髓，还有我们阴阳的理论等等在里面。所以习练太极拳其实是打开了中国传统文化的一道大门，而且太极拳是3年一小成，10年一大成，终身不进。在练习的过程中，我们的技能是在不断的增长的，所以在这个过程中是非常的有趣，可以享受这种进步的愉悦，而且对身体的健康，我们练习的越多，它技能掌握的更好，获得的益处是更多的。从太极拳的起源来看呢，其实它就是对我们身心健康是非常有帮助的。我们来看一下，太极拳起源于明末清初中国河南温县陈家沟陈王庭先生，他退隐之后回到自己的老家，当时他留下了一个长短句：看当年披坚执锐，扫荡群分，几次颠遣，蒙恩赐，徒枉然。到而今年老残喘，只落得黄庭一卷随身伴。闲来时造拳，忙来时耕田，趁余闲，教下些弟子儿孙，成龙成虎任方便。从陈王庭先生的这首词，我们可以看出他当时创拳的这个心境当年是将军，然后披坚执锐，也蒙得皇帝的恩赐这些富贵名誉，到了老年来之后呢，其实是没有太多的帮助要如何去过一个身心健康的老年？陈王庭先生当时有阅《黄庭经》，我们道家的经典可以看出他融合了他自身是一个武术家，他有融合武术的精髓，融合中国传统文化的精髓然后之后是随缘，忙来时耕田，闲来时造拳，然后教下些弟子儿孙，成龙成虎任方便。由于太极拳它创始的时候就是为了身心健康，所以它流传下来，更多的武术家们发现了它的这些益处慢慢的再传到了陈家沟以外，传到北京，传到中国各地，传到世界各地。到现代的时候，武术家们在研究，那我们太极拳经过了几百年的发展， 它对我们现代人有什么好处呢？得出的结论是详推用意综合在益寿延年不老春，还是它身心健康的益处。那我和我的团队，包括北京中医药大学、哈佛大学和广安门医院等等的这些同事们，我们一起做了一项这个文献计量学的研究。我们把2013年以前发表的所有的临床研究都做了一个总结，我们一共纳入了207项临床研究，发现第一项临床研究是发表于1958年，也就是说那个时候已经引起了临床医生这些医疗工作人员的关注，太极拳的这个益处。当时这项研究呢是在中国进行的病例系列研究，也就是他们观察了一对人一组人，他们练习太极拳对于肺结核的好处。第一项太极拳随机对照实验发表于1988年。随机对照实验呢，被称为临床证据的金标准，也就是说，它的证据等级是最高的、最可靠的临床证据。这些研究是在中国进行的关于太极拳联合气功对于心脏康复的益处的研究。所以在非常早的时候，太极拳已经引起了医学界的关注。那我们来看临床研究发表的情况。从这幅图大家可以看出，从1958年以来逐渐的呈上升的趋势，特别是2000年以后，各个研究类型的这个发表的数量都呈增长的趋势。那在这些临床研究里面呢，我们发现太极拳的这个这些研究覆盖的疾病已经包括了我们的各个系统，包括最多的是这个循环系统然后其次是骨骼肌肉系统和这个结締组织等等这些系统，覆盖了各个系统。那我和我的团队呢，我们在2000年的时候又做了一个更新，对这些研究进行了更新，去总结和研究近10年的这个太极拳临床研究的进展。我们发现呢，自2010年以来，这个太极拳的发表的这个研究，也就是说大家对太极拳临床意义、临床益处的这个兴趣呢，是在呈持续增长的这个趋势。我们纳入了1018篇文章，这些文章呢共报告了987项研究，相比于这近10年，相比于之前的这个总数来看呢，是整个的增长了3倍。研究的人群主要是集中在成年人，50%以上都集中在成年人，以及老年人72%以上。所以从这里大家可以看出，其实太极拳的研究对于青少年对于青少年这个年龄段呢，其实还是呈一个比较空白的一个区域。希望未来有更多的研究在这个方面能够有一些发现。我们发现呢，太极拳的这些研究，这987项这个研究呢，发表在是由来自于37个国家的研究者所进行和发表的。最多的呢是中国发表的，其次是美国，然后是韩国、澳大利亚。太极拳的临床研究过去10年也是覆盖了各个系统的疾病。从右边这张图大家可以看到它覆盖了各个系统的疾病，主要包括呢就是循环系统、骨骼肌肉系统、神经系统、精神行为、精神发育类疾病、内分泌、营养和代谢系统、呼吸系统、癌症等等。大家可以看出，这些是跟我们中老年人的这个疾病是常见病是非常契合的。主要呢是包括高血压、慢性阻塞性肺病、糖尿病、膝骨关节炎、心衰、抑郁症、骨质疏松、乳腺癌、冠心病和失眠。这些临床研究中，太极拳的使用情况是怎样呢？从右边这张图大家可以看出从传统的陈氏、杨氏、武氏、孙氏或郝氏、孙氏太极拳这几项来看呢，最常见的是杨氏太极拳，其次是陈氏和孙氏太极拳。这些里面呢，包括有传统的套路，也包括有简化套路和改编套路。但是这些它的流行度呢，是与 太极拳的发展的历史原因相关的，并不代表说越流行它的效果越好啊。最常见的太极拳的干预措施是面对面的这种授课由太极老师授课的这种形式。其次呢，还包括有一些是通过网络的在线的这种课程。最常见的这个频次和时间呢是每次60分钟，每周3次，持续12周的时间。绝大多数90%以上的这个临床研究呢，都报告了太极拳对一个或多个健康指标的益处。这些健康指标包括体能的指标，如平衡功能、肌力以及血压、血脂、血糖、体重等生理指标。还包括心理健康指标，比如说抑郁、焦虑和压力的症状，比如说疼痛、乏力，还有生活质量，像疾病相关的这种生活质量的。此外，还包括一些健康相关的事件，比如说跌倒的次数、骨折的发生的情况、心绞痛发生的情况、中风住院的次数等等。有7.2%的研究报告了安全性。其实呢，我在这里想，想提醒就是，如果大家也做临床研究的话，希望未来的研究者能够更多的去报告、追踪、关注和报告太极拳的安全性。虽然我们就是从理论上来讲它是相对安全的，但是如果是临床研究纳入的是病人，像比如说有心衰、心脏病的这些病人，他们是会很关注他的健康，他的这个安全性的。所以希望未来的研究者能够去追踪和报告它的安全性的情况。另外还有2.5%呢，报告了它的依从性，也就是说，比如说12周有多少人能够坚持练习下来，有多少人能够脱落了。那还有一些研究呢，报告了认知功能习练太极拳的满意度以及对于睡眠质量的改善。我们又进一步的更细致的去分析了这些研究它的临床证据的情况。关于太极拳疗效和安全性的，我们分析了210篇比较高质量的这个系统综述，我们检索了9个主要的数据库。基于刚才我们提到的刚才近10年的这个发展，纳入这些系统综述研究里面，我们又更新检索了9个数据库然后纳入了210篇英文、中文和韩文的系统综述。系统综述呢，一般是对于刚才我们提到了随机对照实验是最高质量的，理论上来讲它是最高质量的系统，就是证据等级来讲它是最可靠、最高质量的证据。其次呢是非对照的非随机的临床对照实验也是相对高的。那我们纳入的这210篇系统综述里面呢，他们就是已经去分析总结了系统综述或包括这种非随机的临床对照实验。我们一共分析了114项效应值的估计，也就是刚才我们提到的这些结局指标。那么他们对结局指标有一个效应值的这个估计，发现它的疗效是怎么样。另外有37项我们认为是比较相对质量要高一些的这个系统综述，我们对它又进行了进一步的分析和总结。这些系统综述里面呢，一共包括了59306名临床试验的参与者。从这个大数据我们来看一下它的情况。
杨国燕老师，您进来了。
这项研究呢是近期刚刚发表在这个 Six-Month Review 上面，大家感兴趣可以读一下。
副院长，
刚才提到我们对于这114项效应值也就是如下的所显示，它每一项的这个效应值，比如说像它提到了对于疼痛的改善，那么对于疼痛这个指标，它一共纳入了多少项随机对照实验，它的效应值说明，比如说改善了多少。那么这个研究它的证据质量是怎样？我们做了非常严格的评价。简单总结的来说呢，
So this is an overview of Six-Month Review, and we use the great certainty to praise the certainty of all the effects of estimates. 副院长，你觉得效果怎么样？
这个评价呢是说明，
可以，
就是说它的证据的可靠性
We appraised 114 effects of estimates, and 8 were rated as high quality, and 43 were rated as moderate quality, and 36 were rated as no, and 27 were rated as extremely low. Because they were rated as this is because of concern in residual bias, inaccuracy, inconsistency, and publication bias.
所以很多研究，很多这个我们纳入的这个临床试验里面的嘛，很大程度上的这个研究都没有做盲法啊，这是其中一点，所以他们的偏移风险比较大。
The risk bias were rated 80% of the
不一致性以及发表偏移。
studies were rated as have high risk of biases because, as you know, Tai Chi clinical trials were challenging to do randomized double blinding. We also used the ARMSTAR the tool to raise the quality of the systematic reviews. We rated the 37 systematic reviews for their quality, and 2 were rated as high quality, 6 were rated as moderate, and 18 were rated as no quality, and 11 were rated as extremely low quality. The concerns, due to the concerns in their not comprehensive searching strategies and language bias, and not adequate consideration of the clinical methodology and the statistical heterogeneity, and their reporting quality were not high, and they didn't register their protocol previously before they do the systematic review. As you can see, shown in the right in the table, this is what we presented in detail as a supplementary file to the publication we showed previously. We suggest future researchers to register their protocol before they do systematic reviews, so that the results and the implementation of the systematic review will be transparent.
希望未来的研究者能够在这几项局限性方面能够做一些提高和改善。 那未来我们就会有更多高质量的系统综述。
We hope future researchers can pay attention to those points, so we can have higher quality to inform the clinical practice.
综述里面呢，我们发现最
In those systematic reviews, we found the most common disease and conditions were include the neurological system disease, risk false balance, and other 4 risks. This is an example of how we presented the effects, estimates of effects. For example, this is an adverse events, and we show what's the outcome measures and the effect of estimates. Generally speaking, compared to the control group, 114 effects of estimates shows that 66 showed that Tai Chi were much more effective than the control group and has clinical significance, and 53 shows that Tai Chi were had equivalent effects to the control group, and 6 effects of estimates shows that Tai Chi did not increase the adverse events, because there are not many studies reported adverse events, but among them, Tai Chi showed that didn't increase the risk of adverse events. That means relatively Tai Chi is safe in those populations.
最后呢，我们得出的结论就是
So in
太极拳的
conclusion,
益
we
处
say
其实是
that
多方面的，包括
the
提高身
benefits
体
of
健
Tai
康、
Chi
心理健
has
康和
multi
生活质量的
dimensions,
改善，
including
而且它
physical
覆盖的极度
health,
非常的广泛。
psychological health, and quality of
它
life.
的
And
这些证据呢，一致
now
显
the
示具有临
consistent
床重要
evidence
性
have
的
showed
疾病
that
包括
those
是
the
帕金森氏
disease
症、
and conditions
摔
which
倒风
shows
险、膝关
clinical
节炎、下腰
significance
痛、
include
脑血管疾病
Parkinson
和心
disease,
血管疾病，比
falls
如说
and
高血
risk
压。对于这些疾
the
病的
risk
这
of
个
falling
这些指
and
标来看，已经是
the
有临床重要意义，也就是说临
osteoarthritis,
床上
lower back
可以
pain,
使
and
用起来。
cardiovascular
但是
disease
呢，
such as
由于这些质
hypertension.
量还是
However,
刚才有跟
due
大家
to
提到
the
质量还
quality
是
of the
不是的
original
非常的
study
乐
and
观，
the six-month
所以
review
因此还
still
需要
has some concerns.
更
We
多的
still need
纳入
more
高质量原始研
high-quality
究的
six-month
高
reviews,
产的系
which
统综
included
述，来
original
为我们的
high-quality
就是说
randomized
得
control
出一些
trials
临
in the
床有
future
意义
to
的结
inform
论，做
our
出普遍。
future
希
health
望未来的研究
evidence-based
者能
health
够一起努
practice.
力，
And
为
in
我
this
们
way,
太
Tai
极
Chi
拳
may
能够
be
服务
help
更多的
more
患者，
people
提供
in
更高质量
clinical
的这种临
settings.
床证据。谢谢大家，这是我今天跟大家的分享。
Thank
也
you
祝
very
愿大
much.
家
This is what
这几
I'm
天参会能
sharing with you today, and wish you all enjoy the conference.
非常好，非常感谢杨老师的精彩演讲。但是刚才因为有大部分是讲的中文，请杨老师用英文简单的总结一下整个您的presentation. Please use your English, the simple, the introduce about the what your presentation. Thank you.
Thank you very much, President Dr. Fu. So generally speaking, Tai Chi, I introduced 3 studies, and the first study is a bibliometric review that we summarized all the clinical studies published all around the world, and we also summarized in the past what happens in the past 10 years. Generally speaking, in the past 10 years, the clinical trials has increased 3 times. Clinical studies, Tai Chi clinical study has increased 3 folds, and we found that already Tai Chi study has been conducted in 31 countries and covering variety of the disease, a big variety of the disease and conditions. The most popular one were cardiovascular disease and musculoskeletal disease, and some interesting disease and conditions were including such as neurocognitive disease and conditions. And majority were consistent with the common disease and conditions which older people will have, because majority of the studies were focused on people with adults or older adults. So we hope in the future we can see more studies were conducted or focused for young people. And now only very few studies were in this population, such as young people with stress, anxiety, and depression. There is still a big gap. We know Tai Chi has a potential in this area, and hopefully future studies can show more benefits in this area. And based on this bibliometric review, and we did update search and summarized 210 systematic reviews, which summarized the high quality studies at this moment. And we also did very critically appraise the quality of the systematic review itself, and included, we use a grade to appraise the included estimates of effects, like which outcome, each outcome, and the body of evidence. And we found that the clinically significant benefits were already showed in consistent evidence in like falls and the cardiovascular disease such as hypertension and neurocognitive disease. And so if you are interested in to know more details, please feel free to read the papers published, and it's already published and free, and it's available to all. And you can also download some of the supplementary files. We show many details there. Sorry, my presentation is in Chinese, and I just briefly summarized this presentation. If you have any questions, I'm happy to discuss with you. Thank you, and I hope you all enjoy the conference today.
Thank you, Dr. Yang. So right now thanks for your share. That is very important for everybody. The Taiji need more research than proved. Then that will help West people more understanding the Taiji, and also Taiji it is help the health. And right now we will invite the next presenter, and he already online. His name is Master Fang. And he's the UC Berkeley, the many years martial arts team, the leader, and also he's a very high level the Taiji Qigong, the master, and he doing many years the martial arts and including the Taiji, and he did a long time about the Taiji or Bagua or this part of research. So the Master Fang, are you there?
Yes, I'm here.
Great, Master Fang. Okay. Maybe you should try the take off the background because we cannot see you.
Okay, sorry, I'm not too sure how to do that.
It's simple. The left side have the camera. There have the small part. You click on it. This is change the match the background.
Okay. Can I just blur the background? Ah,
yes,
okay.
Perfect. Yes,
perfect.
That's much better. Yes, thank you. Now
okay, first of all,
thank you.
Okay. You bet. First of all, I want to bring the greetings from the University of California, Berkeley, UC Martial Arts Program. It is, of course, one of the unique programs in the United States. We have 6 different martial arts programs. We have Tai Chi and Wushu, but also we have Taekwondo, Karate, Judo, and Young Mudo. The department's mission is to help promote as well as to teach martial arts and its history, its philosophy, as well as its techniques to spread it in the West. And so that's one of our missions. It's also, of course, to study how to find the best ways to do what we're doing. And first of all, I've had the opportunity to train with some of China's greatest martial artists. I've been a martial arts athlete, competitor, coach, everything. I've taught also at the City College of San Francisco, and that's going to be important to this discussion because City College of San Francisco is the largest community college in the United States. We have 60,000 students. We also have 5 Tai Chi teachers. So we teach about 1,000 students a year. So that's a lot of people to run through the program. At UC Berkeley, I've been running mostly martial arts, Wushu for competition. With the pandemic, however, I've been asked to help develop a program for health and wellness for the community. And so part of my experience was through City College, because in City College, we had to evaluate the learning objectives of our classes. Now, so we had to create a rubric to evaluate what the students had to learn. So a couple of things I have to mention. What I'm presenting is about learning outcomes. In other words, what is the best way for students to learn something? And then you evaluate what it is that they learned. This type of, how should I say, is mostly about the teaching, but also to some extent also impacts on the question of health itself. And so, because when you create a rubric, you have to measure things that can be measurable. So our department is measuring what they learned. For instance, were they able to improve their balance? Were they able to improve their coordination? But also what we were teaching, whether it be Qigong, a Sun style Tai Chi routine, Yang style Tai Chi routine, or Chen style Tai Chi routine. What was the result of doing that? Okay. So each student is evaluated by me and my staff to see if they match the requirements that were necessary for them to have learned whatever skill they had. So one of them, like I said, basic skill is learning balance and coordination, and whether they felt relaxed. Now, one of the problems with Tai Chi is that a lot of these things are hard to measure because there are other factors that impact, such as your diet, your mental health, all these other things. And so to have a good study, you would have to rule out many of those other things and how they would affect. So we were not quite interested in that. We're interested in how did students learn. So a couple of things that we did, because we have 5 teachers in our department. So we taught the long 108 Yang style routine, the Chen Man Ching's 38 routine, Feng Ji Chang's 24 Chen routine, and also various different, and also Sun style Tai Chi, including the 24 routine and a much longer 98 routine. Okay, so one of the conclusions that's very important to this, to our evaluation, is that the longer the routine, the less the student can remember. Okay, so I think that people should kind of understand also culturally, it's a little bit different. In China, learning routines is part of health. You know, people are used to learning a long routine. In America, for instance, the time that you have to spend on something is not very long. So if you want someone to learn a 108 routine, it will take a very long time for them to master it. Other thing, people don't have time to practice on their own. You may not think that's important, but if you look at our statistics, when the routine is very long, only 10% of the students actually could perform the routine. So that was one of the things that we measured. Could you perform the routine at the end of the class by yourself? So many students could perform the form following somebody, but not by themselves. And you might ask, well, why is that important? Because if you can only follow, you're not going to practice on your own, number one. Number two, you're not getting the benefits that Tai Chi is supposed to give you. So we have to find different methods to do that. So the next step that we did in the process of evaluating students is you look at the data from students who learned Qigong, for instance. So we used Chen style, the spiraling, the Changshu Qigong. We introduced the Yang style stationary and Yang style coiling Qigong, and also Ba Duan Jian. We found that the success rate at that was much higher. For instance, 65 to 80% of the students could master the routine depending on which one it was. Some of them are harder, and that's also something to consider, that the higher the difficulty of the routine, also the more difficult it is. And also, again, you have to look at your audience. So for our program at City College and at UC, most of the students are in their 60s or above. And of course, the older they got, the more difficulty they had with even difficult Qigong. So in terms of teaching, the type of material you teach is also important. Okay. So our first conclusion was that routine practice is not the best way to promote Tai Chi or to improve health. And I kind of have to point out routine practice, right? 108 form, all these other forms were created for the martial artists. They're to help you remember the techniques in your form or your style, but it's not really a health necessarily practice. It can be centered on that, but then you have to modify what you teach a great deal. I've talked to many teachers who have said, well, Yang 24 is a health form. And I go, no, actually it's not. Those forms that China has created are all for the purpose of competition. And those were created in recent times. So if you look back at the history of Chinese martial arts, the original practice dealt with mainly what? A lot of individual movement practice. And that kind of corresponds to, if you look at the original Yellow Emperor's Classic, the Qigong practice goes back way before Tai Chi. And so if you're talking about finding things that are important to practice, the simpler is definitely the most important. And I think the other thing we found, which is pretty important, was that teaching the student to feel is much more important. So too often you're concentrating on a routine. A routine clogs your mind up. You don't have time to feel the qi. And I think in the practice of Tai Chi, people do not give enough credit to feeling the energy. Because when you can feel the energy, that means what? That your mind has stopped working. You are actually in the process of what? Actually, how should I say, adjusting to the feeling of the energy moving through your body. You can actually detect it, okay? So if your mind is consumed with trying to learn a routine, that gets in the way of trying to feel the energy. So actually, you don't get the benefit from practicing your Tai Chi form. And we found that, as I said, as the form got shorter, the students' abilities to remember things got much better. It also meant what? That you need to concentrate on movements, fewer movements, number one. Number two, we found that students improve their coordination through practicing single movement routine, a single movement form versus a long routine. And the main reason was, again, the routine itself was created for right-handed martial artists. They're not actually created for people who are left-handed, okay? Because historically, Chinese did not do that. So if you're practicing a form for health, it must emphasize both sides and both parts, all parts of the body. And so some parts of different styles of Tai Chi can be used. But if you think about it, for instance, in Yang style Tai Chi, I think the single whip is done 13 times in the form, but it's all on the right side. You never practice it on the left side. So in terms of exercise that is good for health, it doesn't quite meet the requirement. So single routine practice or single movement practice. So what we do is for the rubrics that we created to evaluate the students, we taught them one movement, but on both sides so that they could do it in both ways, so that we could check their coordination. And this was interesting for students who had already learned the routine. Supposedly they had studied Tai Chi before. We found that many of them could not do the movement on the other side. And so there's big benefit to what I call single movement routines. And if you think about a single movement routine, that's basically what Qigong is. Qigong is a repetition of one movement on both sides. And my teacher, Grandmaster Feng, used to call this this type of practice. He would say, we use the martial art movement in the form to train people's health. And he says, if you can optimize the movement by itself, that will improve your health overall. Whereas if you did, again, a long routine and you can only master one or two movements, you don't get the same benefit. So again, this is something to think about. So the other thing is feeling relaxation, feeling the energy moving. What you choose to practice is important. So earlier, one of the gentlemen talked about the practicing of Ba Duan Jin, the 8 brocades. 8 brocades is what we call Waidan Qigong. It uses the external muscles to dam up the qi. And then as you relax, the qi flows from the limbs back to the dantian. It is a good way to get students to what? Feel the energy movement. And so it is a very powerful technique. The problem oftentimes with Tai Chi, the movements are soft and relaxed, and you can't feel anything because the muscles are not doing anything. You cannot experience the energy movement. So the other thing to consider is that teaching Tai Chi is not enough to just have soft, slow movement. And actually, original Tai Chi is not, the soft and slow is used to teach you how to coordinate the movement, but at some point you need to develop a little speed. Now, so we don't teach a lot of speed, but to speed up the movement somewhat to get that kind of feeling. 8 brocades is quite excellent for this. The Chansu Qigong, or the spiraling Qigong, or silk reeling Qigong of Chen style Tai Chi, also excellent for that because, again, they utilize the muscle as well as relaxation at the same time to drive the movement of the qi. So the thing to conclude from part of this is that the type of Tai Chi you select is also important. Having said that, though, some forms of Tai Chi are better for health than others. And for this, I want to talk a little bit about Sun style Tai Chi. Sun style Tai Chi, a lot of the work has been done by Dr. Paul Lam in Australia. And you can look at his videos, they're on YouTube. You can also ask for his studies. His work is the only one that's been accepted by the CDC. Sun style Tai Chi is accepted by the Arthritis Association of both by United States as well as by Australia for the prevention and treating of arthritis. And the reason for that is the Sun style Tai Chi, the movements are generally standing up. You do not bend down at all. However, you have to do what? Learn how to utilize the body to pump the qi throughout the entire body. And because of that, it is able to slowly, how should I say, move the fluids from around the joints back into the joint itself through the, and fill the bursas. In doing that, it's able to calm down the inflammation in the joints. But the overall result of this is what? That you're able to improve the general health and the functionings of the tendons and ligaments and the joints of the body. And we found that in longer routines, as I said, even in a Chen style routine that we made shorter versus a Sun style Tai Chi routine, about 60% of the students could learn how to do the Chen or Yang routines. 85% were successful in learning a Sun routine. And again, as I said, the movements are all standing up, so there are no low stances. And it utilizes one important thing, which is when we're talking about the opening and closing techniques of Sun, which is what it is. It's an opening and closing Tai Chi. Opening and closing the chest helps to pump the qi through the central meridian, the Sanjiao, to improve your health, improves the flow of your blood. It helps your digestion, helps your elimination. All those things occur through that practice. And it should be mentioned that the routines were short, 6 to 12 moves. In the students that we surveyed, 75 to 80% of the students said they didn't have time to practice at home. And they wanted something that was simple and easy to do. And so again, Tai Chi needs to be, how should I say, introduced to the general public at a lower level than routine practice. And so it is important to note that while routine practice has the major way in which Tai Chi has been taught, there needs to be some thought to how to make it more available to the general public. And then when people are interested, we can introduce them to other things like a routine, sword routine, other things that make up the Tai Chi toolbox. And I think that's important. The Tai Chi toolbox, for instance, for Chen style Tai Chi, the form perhaps we will not teach. The silk reeling is excellent. We have Fang Song Gong. Fang Song Gong teaches a student most important thing, feel the qi and how to relax, how to focus the mind. And so too often people think that doing meditation is to empty the mind. Actually, it's not. You want to focus the mind so you can feel the energy. And it's a misnomer that I stand there and I empty my mind. That actually doesn't really work. And you might think about that when a martial artist is meditating, he is completely aware of everything. So my teacher used to tell me, if you can feel the relaxation in your hairs on your skin, he said, that's pretty good. But he says, can you hear the butterfly flapping its wings among the trees? Meaning that what? Your awareness, your relaxation, your focus is not just on yourself, but beyond yourself. Okay. The other thing we found that I think is important in teaching Tai Chi, you cannot just teach a routine or form. In our discussions with the students, we found that the students preferred that if I were to teach anything, they would want to know what is its benefit, how does it work, how is it related to health and medicine. And so you cannot teach Tai Chi again without ignoring the philosophical, its relationship to TCM. And through that, students begin to understand why practicing Tai Chi is important. And so I've told them, Tai Chi and Qigong are part of the toolboxes of TCM. And too often you consider them as just exercise. And Tai Chi Chuan is actually, how should I say, healthy medicine. So through its practice, you improve its health. Now, having said that, like I said, through the discussion that we've had and the construction and evaluation of the students, the type of techniques you teach, how you teach them, what you emphasize is very important. Otherwise, the people do not gain, one, the real benefits of Tai Chi, and people, how should I say, kind of look at it as being metaphysical, that you think so, but I don't think so. And I think that's really important. We have the tools in Tai Chi to improve the students' understanding of their health and also to help them improve their connection to Tai Chi. And I think it cannot be separate without using the proper tools. And so part of the proper tools, as I said here, is Tai Chi Qigong is quite excellent. 8 brocades is quite excellent. Shorter movements, but single movement practice, I think, is real key. And in original Tai Chi practice, if you go back, well, actually, martial arts practice, you go back in Chinese history, you will find that original martial arts practice in Chinese history, it's all one movement practice. For instance, if you're teaching a soldier, you can't teach them a whole routine. They can't remember it. They don't have time for that. So the original practice was taking several movements, 5 or 6, teaching them to do to do that over and over again until they perfect it. So that has become what we call the Gong practice of Tai Chi Chuan. And that's separate from the Chuan practice or the routine practice of Tai Chi Chuan. And I think those of us who are teaching need to begin to make that distinction, because it's the Gong part of Tai Chi Chuan we want to teach, not necessarily the Chuan part, or not to emphasize the Chuan part solely, because it will not, in the long run, how should I say, capture both the students' interest, number one, but number two, the practice of just the routine by itself actually muddles its use. And its use is, as I said, you want to get the student to what? Practice it over and over again. And so finding movements within the form is easy because we have like 108 moves, but selecting ones that will improve the students' health is very important. How do we do that? Movement should be large in the beginning. Movements large allow the qi to flow. The smaller the movement, the more difficult to feel the qi. And so if you look at Grandmaster Feng's Hunyan Tai Chi, for instance, the movements are very large, very circular, so that the students can experience the qi. They have a longer time to experience it so that they can feel its energy. Movements that are like Ba Duan Jin, meaning they're wide on, they utilize the muscle to move, to, how should I say, control the movement of the qi, because you have to tighten the muscle at the end of the routine and then you relax. During the relaxation, you can feel the energy return from the limb back to the dantian. Again, a good way to experience the energy. Ba Duan Jin, by the way, should not be practiced like Tai Chi. It's not soft and relaxed, at least in martial art practice. In martial art practice, we say that you tighten the muscles at the end of the movement, and then when you relax is when the energy returns. Just practicing soft, and I think that's important, will not actually impact your health as much as varying the speed, varying the intensity of what you practice. Some of you may have seen Dr. Weng at San Jose State University. He has his cardio Tai Chi, meaning that you up the intensity of the Tai Chi workout to get the cardio to help move the blood, and also you can feel the intensity of the practice and energy. So there needs to be new strategies developed in terms of both interesting students, but also getting people to feel the effects of Tai Chi. And you consider something like yoga. Why is yoga so popular? Because you can feel the energy moving. When the movement is all soft and relaxed, oftentimes those people who are in moderately good health will not find any benefit from Tai Chi. Ba Duan Jin, for instance, is very successful because you can feel the change in your body. And so, again, we need to reach into the Tai Chi Chuan toolbox to find things that will allow us to do that. The different types of techniques rely on 5 basic principles of Tai Chi, and you want to select movements that emphasize these things. First of all is open and close, fast and slow, hard and soft, internal and external, yin and yang. So for the martial artists, those are the 5 basic types of movements in Tai Chi. Opening and closing is one of the easiest to do. And the more you practice that, the more students can feel the energy. So in Sun style Tai Chi, you have the single whip, which allows you to feel the energy coming up. And then as you relax, you can feel the energy coming down. Those are the simplest movements and also the ones that are most powerful. Every style of Tai Chi has opening and closing movements. The other one that's important is the spiraling movements. Spiraling movements like the silk reeling and Chen style Tai Chi help to accelerate the flow of the Qi in the blood. And as you practice it again, you can feel the changes in your body. And I think that's quite important. It should also be noted, as I said earlier, and not all styles of Tai Chi can be practiced by everyone. So just to give you an idea, if you have scoliosis, it doesn't work. You have arthritis in your knees and your ankles, you cannot practice most styles of Tai Chi. Sun style Tai Chi, you can do that. So selecting the proper style of Tai Chi for both health and wellness is important. Okay, so health, wellness, and medicine. The last one, TCM, there needs to be, of course, more cooperation between martial artists and doctors to research more what are the effects of different types of movements that we have in Tai Chi Chuan. And every style of Tai Chi Chuan has different things to offer. And the other thing to consider, however, is that if you look at the history of Tai Chi Chuan, the beginning is Chen, Yang, Wu, and Sun. Sun style is the last of the 5 styles of Tai Chi. And I'm not saying it's better than any others, but its development, however, grew out of the other 4, and it concentrated on what? Qigong practice, health practice, because it was created in the beginning of the 20th century. Grandmaster Sun Lutang, who created it, already knew about modern health practices. He knew about Taoist and Buddhist Qigong practices. He tried to incorporate that into that particular style. So again, if you're creating a health and wellness program, please look into Sun style Tai Chi. It can be of great benefit to everyone. And again, I'm not saying that any one way is better, but through the evaluation of students, and it's a 5-year project that we did evaluating the students' learning outcomes. In terms of learning Tai Chi, our conclusion is that routines are not necessary, certainly not long ones. Short ones are important. The emphasis should be placed more on Qigong, less on forms. And the type of Qigong you select is also important. Ones that allow the student to both feel as well as to experience changes in the physical body are much more important. And you think of something like yoga, you can feel the changes in your body. Well, we have practices in our Tai Chi toolbox that we can use to simulate some of those things, or to incorporate those things into what we teach. All right, so anyway, that's basically what I wanted to present. Of course, if you have questions, happy to answer. The other thing, of course, is that I will be giving a lecture and demonstration on some of the techniques that we teach. And so these techniques that I'm teaching have been adopted both at City College of San Francisco and at UC Berkeley. And we've had great success, mainly by evaluating, as I said, what the students learn, not necessarily what the impact on their health is, but what is the best way to teach. And so I hope people found it interesting, and I'm always willing to talk about it. Keep in mind, I'm a martial artist. People will say, oh, you're watering down martial arts. It's not the point. The point is how to improve people's health. It doesn't preclude any of the other things that we've done or as currently being done. But what is currently being done, a lot of it, as I said, is mainly routine practice. Even in our department of 5 instructors, 4 of them taught mainly routines. And they found that, the routines are okay, but they're not the most effective way. And my part of the evaluation was on the practice of Qigong and short routines. And it tended to be through what we could look at from the data, that tended to be the most successful way to do it. And again, you have to keep in mind, things need to be modified and changed. Do not stick to the formula as it's always been. We need to be innovative as well as to incorporate modern scientific knowledge. All right. Thank you, Dr. Fu.
Thank you so much. This is a wonderful presentation that's coming from the UC Berkeley, and the Dr. Master Fang is a very high level master. He's many years in American, and thank you for promoting the Chinese martial arts and the Tai Chi Qigong for American people, and especially in the university. That's very important. Like yesterday, the Dr. Chu from UCLA, he educates a lot of doctors understand the traditional Chinese the medicine, and also he promotion with Tai Chi too. So that's very important, because if we want the more friendly, made the American people or West people understanding the Chinese arts and benefit for them the health, then we should do that. Thank you. So next one, we will very honored invited our organizer, co-organizer, the president of the University of Alabama University, the president. Her name is Mary Ju, and she is a very good doctor, very nice president, and she help a lot of people all the world. And they promotion with integrative medicine, even acupuncture, PhD oriental care program, everything in the Alabama. Thank you. This is our very friendly university as a friend. So thank you, Mary Ju. Right now you can share your screen, and from beginning we can see you very good. Thank you.
You're able to see the screen okay?
Yes, everything great.
Wonderful.
You look great too.
I'm very pleased to be here with you, and what an honor to follow.
Okay, 1 second. May I bother 1 second? It's please everybody ready after the Mary Jo the presentation, and we will take one group picture again. Okay, thank you. And also I want to notice everybody tonight. It's 5 p.m. to 6 p.m. have one forum about the education and about the Chinese medicine. We will very happy everybody online, and also after that we have the small event tonight. It's about a 40 minutes event where you will see the University of East West Medicine School. Okay, thank you everybody. Now it's your turn.
Okay, wonderful, thank you. And everyone can hear me okay?
Great.
What we're going to be exploring is in a little bit different direction, but totally complements everything that we have been hearing throughout this Congress. I'm going to be focusing on complementary integrative health innovations, where this came about, some of the significant research, instead of focusing on the movement aspects that we've heard quite a bit about, which are critical to health and well-being. I'm going to go in a little bit different direction, but it complements everything we've heard. So these innovations and complementary integrative health are uplifting both health, healing, and wellness, including practice, education, and research. Like I said, my university, I'm currently president of Akamai University, that's dedicated to improving human and planetary health. In this next slide, we're looking at the Global Healing Alliance, which is a resource that connects people worldwide, focusing on healing and ways on how to revolutionize healthcare. Dr. Effie Chow, colleague and friend who recently passed November the 19th, and who we celebrated her life yesterday, was the visionary behind the Global Healing Alliance. So I dedicate this presentation to
She's
her
amazing.
and the work
Amazing
that was
person.
done.
Thank you.
Finding and activating divine inspiration. How do we turn on the light within us? In this next slide, we're going to be focusing on soul-to-soul communication and why there's a shift in the delivery of healthcare to an empowerment model of engagement that is facilitated by soul-to-soul communication, including what is the science behind that. What you're seeing here are the energetic manifestations. And in the bottom picture that you see, the colleague sitting at the doctor show, the person who I'm pointing to right now is Dr. Mark Anthony. He and I have been collaborating together. We come from two different professional orientations, and he's written a book called The Afterlife Frequency, which is the scientific proof of spiritual contact and how that awareness can change your life. The foreword of the book is by Gary Schwartz, who's one of the leading experts in our profession. And Dr. Jeffrey Long, physician, author of the New York Times best seller Evidence of the Afterlife, says that this book, and what I'm going to be quoting and referring to the work, is a treasure trove of insightful insights and inspirations. This outstanding book is expertly written, remarkably easy to read, and enthusiastically recommended. And a lot of our colleagues in the profession of dealing with afterlife issues, near-death experience, which is a tremendous problem in many nurses and physicians throughout their professional career have run into it, as well as is a huge problem in also in the military with many of the things that have happened to them. So the agenda for today is to look at, and focus is going to be complementary integrative health, the electromagnetic frequency, which is the essence of communication, in the experience of multidimensional soul-to-soul communication. In this next slide, just a little bit about me. Energy Medicine Partnerships is the name of my business. And from there, I, throughout my entire career, have been a practicing practitioner of energy therapies, a range of them, including working with Qigong and Tai Chi. Also, I've been an educator all of my career and committed researcher, both to the training of those who are documenting their specialties. I am a family therapist and a clinical specialist in psychiatric mental health care. Currently, as of last year, 2021, I'm now president of Akamai University and dean of the College of Integrated Health in the Division of Continuing Education and director of the Institute of Camp Studies. So many of the things you're going to be hearing about today are an integral part of our university, which is a full-time online university with international accreditation. In this next slide, I'm going to be talking about how to transform your life through energy medicine. And we're going to be looking at the body energy dynamics, and this will be the focus today. And as we approach soul-to-soul communication and what that means. In this next slide, we're looking at, we now have mystical experience worldwide research that has processed the different dimensions of the energy system, which includes clinical stories that get at the documentation of what has happened. The International Association of Near-Death Studies is one of the foremost leading edge organizations that focuses on worldwide applications in studying this phenomena. But in particular, today I'm going to focus on soul-to-communication, some tools how to help connect with other realms or multidimensionality, and how to deal with the current problems that are impacting us today. This presentation, some of what you're seeing was from one that I did, the experiential soul-to-soul communication at the Association of Comprehensive Energy Psychology in May of this year. So this material has been presented worldwide at multiple conferences, including nursing in the Tai Chi Congress, and also what we're focusing on today. The mystical experience are processed through the energy system, the human energy system, and I adopted the words in nursing, energy field, rather than focusing on the word aura, energy tracks, which of course are meridians, and that Chinese medicine is an absolute expert in this field, energy centers or chakras, the central power current, Hara line, in divine radiance core star. Each one of these could be spent a lifetime just studying one of them, but when you look at all of them combined, they offer you a rich perspective of how to begin to change and improve your life. How is multidimensional care different than traditional health care? So as we look at this, in traditional clinical care, the practitioner's expertise is care focused. It may not be holistic. The goal is alleviating symptoms. They may not go back in time to look at early programming or trauma, and rarely includes multidimensional healing. There is no spiritual considerations, and that was more prominent before, but now a lot of hospitals and agencies are moving in this direction, but still they have trouble dealing with things when they use the word spirituality, because in their mind, spirituality has not been documented, but that simply is not true. The scientific research from many institutions throughout the world have established it. In an energy medicine session, the healing hands, as you see, you work with identifying the origin of the symptom, explore multisensory data, the beliefs holding the symptoms in place, childhood trauma, karma, multi-generational interrelationships, expanding intuitive data, and exploring other time frames. All of these are practiced continually. And I had a woman about 2 weeks ago who called me looking for someone else to help her in healing her issues. And I said, I gave her the name and address of who she was looking for. I said, can I be of help to you? So she described what her physical problem was, the inability to maintain her balance and to walk. And I said, and as she started speaking, I saw pictures, and I asked permission if she would like to hear what I was seeing, and she said yes. And when I shared what happened, and we went through a whole realm of things, and were able to identify that in 3 family generations, they had the same kind of problem, and she was following suit with that. And little did she realize that she needed to explore taking on the trauma that has been passed down. Now, in many instances, someone would say that's just genetic and we can't change it. And that is not true. We have demonstrated that. And I set up an appointment with her. And by the time we finished the next appointment we had, she was able to drop her pain spike from an 8 down to a 2. in just a short period of time. That's the power of multidimensional healing. Research has documented the emotions' impact on the body. As you can see, this picture illustrates various kinds of emotions and what the impact is. Now, you may not know the theory behind this, but we do know the experience behind it. You can tell the difference when you're with someone who's happy. You can tell the love. You can also feel the opposite, sadness or depression or anger, etc. This has been documented. The responses of what we're talking about is now looking at how do we achieve soul-to-soul communication in the support from the near help model of care and caring, and change your energy through intention. How do you do that? There are various methods that are used to pinpoint a specific issue. You can have the client do drawings. I learned this from Dr. Bernie Siegel, a colleague of mine. He wrote Love, Medicine, and Miracles in the 1970s. And he and I have co-taught called Bernie and Mary Jo Dialogues over the past year and have worked together. He's in his 90s now and is a well-renowned surgeon in his documented the work. And he said the best medicine around is love. The other thing is intuitive insights, a life analysis, meditation, interview, and energy connection. This next slide shows the patient before healing. You're seeing the energetic manifestations, and she was experiencing a throat problem. In this next slide, as you see the healer beginning to approach, and the hands also are energetically affected. And in the final slide, after 10 minutes after healing, what was in her throat begins to gather in the healer's hands. How can you withstand the pressure? And we're looking at resilient strategies that strengthen support networks, clarify the purpose, enhance self-care, build self-awareness, actualize strength, and broaden coping skills. This brings us resilience. I put together a Wellness for All plan, preventing illness and achieving wellness. There are 3 components. The wellness focuses on creating a wellness ritual to stay healthy and vibrant. Plan and follow a daily routine to uplift your well-being spiritually, emotionally, mentally, and physically. Establish a health community to thrive and heal any challenges, and design or designate a wellness mentor or a wellness team. So this is a new model that is put together in looking at the illness model that the healthcare system is primarily organized around and has been for many years in symptom problems. Health planning includes tracking your own health, wellness, and healing needs. Reach out to your health community, your wellness mentor, or wellness team for guidance. Eliminate obstacles to your well-being. Start today, stay focused, centered, and active. The illness reduction plan is focusing on reducing current illness, empowerment to take care of your plan of care, guided by your spiritual team, focusing on past, present, and future, include food, movement, music, animals, nature to build resistance. Enjoy life, maintain balance, body, emotion, mind, and spirit with your heart connection, speaking, and visioning. Play, rest, communicate, care, and serve. Speak and live your truth. Laugh often and follow your inspiration to guide your path. Spend time with those you love. and those who love you back. The Science of Global Coherence by my friend and colleague Lynn McTaggart has worked closely with HeartMath to document the frequencies of intention. Visit her website, see the tremendous resource she has. And her statement from her website that you see here, what if you had the power to heal every area of your life and the lives of everyone around you? Her statement is, you already do, but it has been hidden from you. That's what we're focusing on, how to bring forward your wellness plan for all within you. Today, I'm going to focus on the emotional meridian tune-up. Again, it goes back to finding and activating divine inspiration, turning on the light. How do you do that? The preparation, and I'm going to be going through this quickly, so at a later time, you can re-look at this and begin to help set the stage. The goal is, I live in the present. Affirmation, my brain is alert and clear. You're setting the intention. Hold the left side of the head, feelings, and the right side of the head. Focus on thoughts. The goal is using both thoughts and feelings. Affirmation. My thoughts and feelings are clear and balanced. I am rational and intuitive. In this next slide, you're connecting the lower lip, the goal, which is the central meridian. The goal is, I am successful. I am letting go of my feelings of overwhelm. I'm letting go of my thoughts of overwhelm. I'm also letting go of my feelings of lack of success and my thoughts of lack of success. In this one, the focus on the lower lip, the goal is, I am successful. I'm bringing feelings of success in my life. I'm bringing thoughts of success in my life. I am successful. When you switch your thoughts from the glass half empty into the thoughts and feelings of happiness and joy and success, you will begin to change your paradigm of being in the world. The upper lips, the goal is, I am supported, and I'm letting go of my feelings of lack of support. I'm letting go of my thoughts of lack of support. I am supported. The law of the 5 elements you have been dealing with throughout this time in the World Congress. And each one of them, and my colleague and dearest friend, as I mentioned, Effie Chow, always focus on laughing. And look at the 4 meridians that were balanced. The small intestine, the heart, the triple warmer, and the circulating sex meridian. It brings out the fire element, the laughing. Singing is the other thing she always did, dealing with spleen and stomach, worry and stress, and singing, changing. And in the energy tune-up, that I'm not going through all the rest of them now, we focus on dealing with each one of those 5 elements and how to balance them. In this next picture, there's some other data I want to cover. The Wellness for All deals with dynamic practice in education and complementary integrative health. And it's available to take either as a certificate program. Some people are doing their bachelor's, others have worked on their master's. In addition, we have quite a few in their doctoral program. You see underneath the logo down here, Transform Your Life Through Energy Medicine, Soul to Soul Communication, Restore Hope, Promote Healing, Nurses Take Two, which is a new model of care that has been sanctioned. It is approved for continuing education by the American Holistic Nurses Association. I'm also in the practice committee of that professional group. And then Spiritual Me, or Mystical Experiences. I've been hearing voices since a teenager. One of my colleagues Robin, who is a nurse practitioner, she joined me on some of my trips to multiple countries where I've been teaching this. I hadn't heard from her for a while. She got in touch with me and she had a near-death experience from brain surgery and had extreme out-of-body effects. She contacted me and I said, I'm going to be in Charlottesville, North Carolina, speaking at a conference. Why don't you come there? And I'll use you as a demonstration of how you help integrate and deal with the effects of the kinds of pain and suffering and problems she was having. She came, it was recorded, and it's available to look at. Also, at times, I became aware there's some others, and the one I'm going to speak about is Judy Offenthy. She's one of the foremost leaders at the Mayo Clinic. In May of 5th, 2020, when I was doing some work with her, both she and I saw spirits in the workshop. I was the one that brought it up, and she commented she had seen it as well. And she has been actively introducing in a very subtle way, dealing with multidimensional awareness at the very famous clinic. The kinds of spirit guides can come. You can deal with mentors, people who are alive, present time, colleagues, and or those who are on the other side. We have what are called soul records and how to access them, how to deal with our teachers in the current here and now, dealing with karma issues, protection, dealing with joy, spirit animals and plants. All of these things are resources and tools to connect with soul-to-soul guidance. You have to be aware, though, that our mission is to empower individuals, families, groups, and organizations in achieving health and promote spiritual growth. Do it from an ethical point of view. This is one of the key things that are done in all the work that is addressed in our training programs. We must respect integrity, ethics, and honesty. And we have a full program just on this related aspect. When I assumed the role as president of the university, one of the things that happened in a Congress that I presented with them in May of this year, I talked about our hybrid teaching model, heart-centered, integrative, multidimensional empowerment approach to learning offered at, this is our ASIC, which is based in Ukraine, and United Kingdom is our international accrediting body for Akamai University. As you can see, I'm not going to go into this aspect, but one of the things that our teachers said, that it's not what you feel for people, but how you make them feel that makes a huge difference. So we're looking at how do you build community, connect, how do you listen, how do you share, explore together. Virginia Satir, my colleague, renowned family therapist, she also frequently said planting seeds. And as I said before, Bernie Siegel said, love is the answer. My philosophy that I developed as a young nurse was, as you give, you receive. As you receive, you give. The other philosophy message is nursing is what nursing does. What nursing does is what you are. The third message, teachers are what teaching achieves. What teachers achieve is what you are and demonstrate and live. The model is generated from years of research into extraordinary practice education and research. It has been captured throughout university, Akamai University, and working with some of our doctoral students in particular. We're looking for out-of-the-box innovative strategies. This model builds on work throughout US and Canada. Australia is the first country besides Canada that I took it to, then New Zealand. I've been very active in Peru, South Africa, Chile, England, and Italy. And it includes engagement with 6 traditional healers. I worked at the Nelson Mandela School of Medicine. One of our professors who is from Nepal, and he recently presented December 3 and 4 at the annual Himalayan Policy Research Conference associated with the University of New Mexico. It's Dr. Man BK. He's one of our current faculty. He gave the evolution, this is up to date, of what and how we've been impacted by the coronavirus and the different stages. And as we were looking at that, he also illustrated where the distribution of cases are. And in the United States now, we have 100,156,325 cases. This data is from November the 19th, 2022. And again, how you would approach this in each country is very different, but you need to have a universal language and respect the culture and the community from where they are operating from. And this, when we practice and teach, is a key part of what we do. I'm going through this quickly, but there are some other things in looking at sustainable goals. We're looking at the connection between people, prosperity, peace, partnerships, and the planet. This integrative approach dealing with the self professionally and with organizations. The Greater Reality Living, Mark Paxton and Gregory Schwartz are 2 of my colleagues. They teach the lives formula, learn the collective evidence that you continue to live after bodily death, internalize this news, vitalize and holistically balance yourself, enjoy the benefits of greater reality living, and serve others to help them and yourself and make the world a better place. Gary Schwartz, who worked with Mark on this, was a colleague who wrote the foreword to Mark Anthony, an electromagnetic frequency that I talked about. Heart Math has been doing things to document the energetics. Here's Bernie Siegel, his key works. He's written about 30 books as a surgeon, like I said, for the last 2 years. He and I have had dialogues and talking about the many kinds of things that he learned from patients rather than being a top-down model. I'm the expert. We do an archway to the light, which is a bridge between 2 worlds, learning how to communicate through the circle of love. This is one of the things that is taught in part of what I have presented at the International Association of Near-Death Studies in Salt Lake City, September the 3rd of this year. I've shown you this before. These are some of the things that are available with different populations. Energy therapies to choose from, not one size fits all. Looking at interventions, moving, sending, and clearing energy. Specific, these are all from the courses, energy field drain and replenishment, inner core balance, infinity balance, learning to move away unwanted energies and recalling fragmented energies. Certificate trainings available. We have a wellness for all, clinician, practitioner, specialist, and also become an instructor, associate, and faculty. Certificate training, new courses starting January the 18th, contact me. Data and the implications for care. Research indicates approximately 10% of patients who experience cardiac arrest in a hospital setting report a near-death experience. So looking at this is not the new kid on the block. This is a model that I created, looking at expanded consciousness, relationship dynamics, personal recovery, and support for living on Earth. This is all defined. Come and join us. There's my email and way to stay connected. When you write, we'll show you some of the things connected to this, how to do spiritual communication. The Institute for CAM Studies, we have a doctorate in neuroscience acupuncture in Dr. Stephen Rosenblatt has the Oriental Medicine doctorate and also a PhD in complementary integrative health and complementary alternative medicine. There we go. That's it. These are some of the bibliography related to the materials, and you will get it as a PDF when you write in the references. So that's it for today. Thank you. And I've loved being with you, and many blessings to all, and we'll look forward to staying connected.
Thank you so much, Mary Jo. You did a wonderful job. You send the love, send the energy for everyone, and we will very happy follow you doing better. And
thank you.
And the Rose, please raise up your hands, then I can find you, let you in. Okay, so the Mary Jo, you did great, because you from the very young until now always try help a lot of people. So right now we will continue, go to the next one. The next one will be the Stephen, the Ronabit. Okay, so we will first play the video and then we will begin. So right now, the Jennifer, please play the Stephen Ronabit, the video. Because Stephen, he built up the UCLA, the integrative medicine.
Hi, I'm Dr. Stephen Rosenblatt. Thank you very much for having me at the 6th World Integrative Medicine Congress. I'm proud to be here and be able to present some of the ideas that we've developed on what we call the New World Medicine, an integration of East-West medicine. I'm Dr. Stephen Rosenblatt. I'm an MD. I'm a PhD from UCLA, as well as a Doctor of Oriental Medicine. So I'm happy to try and combine all of these principles and all of these factors together in what we're calling the New World Medicine. Thank you so much, and let's explore together. We find as medicine develops, it borrows from Eastern medicine the idea of energetic, the idea of flows of energy. It borrows from Western medicine, using biochemistry, using physiology. By combining these two factors, we arrive at what is called a new world medicine. It's this new world medicine that is going to push forward advances in the health, well-being, and especially the preventative health of all the citizens of the world. One of the things that we have as a protective mechanism, and I mentioned it before, is there are certain fields, there are certain energy fields around the body. And what I'm showing here is a type of polarity. And the body itself has the same type of polarity. The Earth has a polarity. We live on the Earth, and we're a part of the Earth's polarity, the Earth's magnetic field. The body too has its magnetic field. Just as the Earth has lines of biomagnetic energy, so does the body have its lines of energy. And in the acupuncture system, of course, they're called meridians. Then these meridians are flows of energy within and without. They extend outside the physical body, of course. They're within and without the body, and they extend to different distances from the physical tissue, depending on the strength of the organism, the strength of the body, the strength of the person, and how strong their immune system is. Now, we look at the fields around the body. This is a representation of some of the biomagnetic or bioelectrical fields that extend outside the physical tissue. And it's this extension of the physical tissue, from the physical tissue, that we find promotes the defense mechanism of the body. As I say, one of its immune factors is this energetic field. That is, of course, what we find so important in the acupuncture system. When we look at Chinese medicine, we're looking at flows of energy, flows of qi that flow through and in and around the body. They form this basic bulletproof, if you will, or shall I say, viral proof vest that protects us from invading organisms. Now, we find that some of these fields are affected by the brain. And the brain is a factor in controlling some of the activities of this bioelectric or biomagnetic field around the body. And the brain has its own activity. As we know, we can measure EKGs, which is the heart's activities. We can measure EEGs, which are the brain's electrical activities. So there's all this electrical activity going on in the body, and the sum composition of this electrical activity provides this flow of energy, this flow of qi that can be expanded and utilized. We'll talk about that in a few minutes. Now, one of the things that we have done at UCLA, I'm a PhD from UCLA, and we did a certain amount of work there. And one of the things that we developed was a system that's known as Kirlian photography. Kirlian photography is a high-frequency field photography that was developed by a husband and wife team, the Kirlians, in Russia in the late 1950s, and has become, for a time, popular as a way to actually photograph some of the electrical fields that are around the body. Here's one of the photographs that if we go back to that just a moment, one of the photographs around a finger that we had done a Kirlian photograph of. The Kirlian photograph is really a high-frequency field photography, so it acts like a biomagnetic strobe, if you will. A strobe is a flashing light that slows down a moving object. Well, this is a flashing electrical field, if you will, a frequency of electrical field that slows down the energy from the body and allows it to be photographed and register on a photographic plate. And we did many of these showing before and after treatment type photographs. I won't go too much into this, but it's an interesting aside. And we had some work. We worked with leaves, for instance. This is an interesting aspect to this Kirlian photography and the energy that we're talking about around the body. And what we did is we would photograph a leaf with Kirlian photography, and then you notice the arrow on the slide here. The arrow is where we cut the leaf, the top half of the leaf off. And so we then took another picture of it without that tip of the leaf, and it still retained its energetic field. And what we were able to demonstrate was that the energetic field exists even after the physical tissue is removed. Of course, it decays over a period of time, but initially we can still get the same type of electromagnetic or energetic field even without the top part of that leaf there. Now, we did the same thing on over and over again, other leaves, and would be able to cut them and remove part of it, and still the field would remain. So there's a permanence of this field over a period of time. As I say, it will decay over time, but it does exist past the existence of the physical substrate. So even after the physical part is gone, the energy remains. And those of you who work in medicine are familiar with, of course, the phenomena of phantom limb pain, where people that have had limbs amputated will often have the sensation that the limb is still extant, the limb is still there and functioning. And they'll even be able to describe positions of the amputated or missing limb. Again, we look at energetic fields as persisting even after the physical substrate has been removed. These were some of the things in Kirlian photography. So again, we're looking at a way of protecting the body. We're looking at a way of utilizing these fields in order to ward off organisms that might invade from the outside. Now, there are many different ways of building this electric field. Tai Chi is one of them. Qigong is another one. Acupuncture, of course, is a brilliant way of manipulating the qi in order to strengthen this protective mechanism, this specific immunity of the body. Now, the immunity of the body and the electrical fields also affect different parts of the brain. And the brain, of course, has many types of chemical receptors. And here's a diagram of certain receptors in the brain: dopamine, endorphins, opiate receptors, serotonin. These are all different types of brain chemistry and brain receptors. So we find that it's an important way of stimulating this system and also at the same time affecting the different hormones in the brain. Now, one of the things that we're trying to do in our researches is to bring together a synthesis of both East and West medicine. And it's going to be a new form of medicine. And that's what's happening. I was the first one licensed in acupuncture in the United States, the first Westerner licensed in acupuncture. And we set up many of the early programs at UCLA. We set up programs in different states, in Nevada, in Oregon. And we were able to develop a field of acupuncture, a profession of acupuncture. And we started from it being completely unknown in the United States to now being licensed in almost every state. 48 of the 50 states now license acupuncturists. But we're forming a new synthesis. It's a synthesis of East and West, what we call the New World medicine. And it has several different principles. It starts from the point of view that all living organisms are a composite of energetic forces that interpenetrate the physical tissue. So the energetic forces that we call qi, or biomagnetic fields, interpenetrate the physical tissue. They run over, around, through, and outside of, and deep inside all the physical tissue. And we exist as an interaction of these physical cells, these tissues, embedded in energy flows that act, the energy flows act to organize and control and literally animate the body itself. Now, Wilhelm Reich, who was a researcher in the 30s and 40s, even up to the 1950s, was able to show that by utilizing dissimilar materials, organic and inorganic placed together, that it was able to attract and collect and generate certain energies. And he called them orgone boxes. Much the same way that we as organisms have red blood cells that are protein on the outside, organic, and are composed of a metal inside, iron, right? An iron core with a protein coating. acting in a sense as an orgone accumulator, collecting not only oxygen from the atmosphere, but collecting certain intrinsic energies. This chi that is floating all around the world. We saw on a previous slide, the world being surrounded by energetic forces. Part of those forces are collected utilizing red blood cells and transmitted in and through the body in a physiological sense. Now, one without the other, one, either the physical without the energetic or the energetic without the physical, can't exist as a living organism as we know it. Energy is needed to organize tissue to provide structure and stable strength. Energy flows to create growth and repair. It literally fleshes out the organism. The actual cells and the physiological elements flow along these energy lines and are coordinated by them, so that as we repair tissue, we get it organized by the energy flow. If you cut yourself, generally the tissue will heal, but you don't grow liver cells on the skin, you grow skin cells. It organizes the appropriate type of cells in the appropriate area, organized again by these flows of energy. Energy flows first, and the tissue is organized from the elemental particles behind it. Energy interpenetrates the physical tissues and in turn causes the generation of more dense energies, chi converted to ATP in the cell. So the mitochondria of the cell absorbs certain energies and creates a biochemical, a physiological type of energy, which is then utilized by the body in the form of ATP. Now, energy moves from finer, from energetic to more dense. Prevention is most important, as we're talking about. The cause of any disease begins first on an energetic level, and then it progresses to a physical dimension. It moves from finer to denser. These are one of the principles, some of the principles of this new world, East-West energetic medicine. Both the energetic aspects as well as the physical tissue must be considered in the treatment of any disease. Western medicine was a physical type of medicine. It was developed on the battlefields of Europe and was always used to support the physical tissue, stop the bleeding, treat the acute infection, deal with ischemia, get the heart beating again. These are all the physical types of things that Western medicine has specialized in. Now, the energetic considerations are more important in dealing with chronic and degenerative diseases. The body is always in a state of dynamic, not static, but dynamic equilibrium in relationship to its environment. These are some of the keys of Eastern medicine, some of the great treasures. The body is always dealing with its environment and trying to make the best analysis and the best accommodation possible. Medicines range from pure energy, like homeopathics, to natural supplements, a little more dense, that replenish the body, to crude drugs, to herbs, and then to refined pharmaceuticals, all going from more fine to more dense. All of them have a place in the treatment, and all of them can be used appropriately as tools in order to prevent disease and treat diseases once they become entrenched. Now, medicines work on these different levels, from finer to denser, and they must be considered as to the effect on each level that they have. Treatments from the finer, acupuncture, stimulate body's own energy, to adding electrical stimulation, to manipulation, and to surgery as the most dense, each aimed at affecting different levels of the body. Each of the energy flows has specific vibrations, which have an affinity or a resonance for each type of cellular tissue. And the body is constantly adapting its environmental conditions at every moment. And the state of optimal health is often defined as making the best adaptation possible to the environmental factors. Now, 19th and 20th century medicine was involved with naming and categorizing and the curing of diseases in the large sense. The 21st century medicine, and that's what we're focused on in this World Congress, the 21st century medicine will be concerned with health optimization. That is, providing the best and strongest possible adaptation of the organism to its environmental influences and stressors in its environment. We're not talking only about psychological stress, we're talking about stressors in the larger sense of the word. We wrote a book a few years ago, I authored a book called The Birth of Acupuncture in America, The White Crane's Gift. It was a way of looking at how acupuncture originated in China, but was then brought to America. The white crane is the symbol of the doctor in China. The idea of the stork bringing the baby is an adaptation of that particular idea. But the white crane, the symbol of the doctor, bringing the gift of Oriental medicine, Chinese medicine to the West, and it flourishing in the United States, in the Western countries. So the book is the early days about how a group of us helped to found this acupuncture, this new medicine, helped to integrate this new medicine in the United States. And the work is still going on, of course. We're still integrating. We're still developing ways of bringing Eastern and Western medicine together, of bringing the energetic concepts together. Now, we feel that wellness clinics is going to be the next step. And the role of wellness clinics is going to be a major part of the healthcare delivery system. Preventative medicine as opposed to reactive medicine. And that's what we're talking about today, is ways of building up the dynamic of preventative medicine. Remember, disease prevention is the highest aspiration of the physician. And the line I'd like to leave with, and to leave you with, is a famous quote from the early teachers of teachers back centuries, one of the ancient Chinese physicians, who said, "Only the inferior physician treats the disease he was not proficient enough to prevent." And I think that's the keynote of where we're going with this new medicine. Thank you very much. It's been a pleasure to speak with you, and I look forward to all of us continuing this journey together. Thank you again.
Wow, thank you, the Stephen Roosevelt. And Stephen is always the support our Congress. And the Rose, you are not here, so please.
Yeah, indeed, Dr. Fu. On behalf of the Congress and the conference organizers, I would like to thank Dr. Rosenblatt for his contribution to traditional Chinese medicine. He is truly a pioneer in traditional Chinese medicine in the US. He was trained as a medical physician, as a family physician, for almost 3 decades. However, he's also duly licensed in traditional Chinese medicine. Actually, he was the first Caucasian American physicians to be licensed in California to practice Chinese medicine. So his insightful research on energy and cells truly It's a great contribution to TCEM studies and research in this country. So we would like to thank Dr. Rosenblatt for his contribution and for his dedication to traditional Chinese medicine. Back to you, Dr. Fu.
Okay, so please everybody turn on the video and turn off the audio, and we take one more group picture. Please turn on the video, turn off the audio, and that will help us take one very good picture again. And please turn on your video and turn off your audio, and we take one more picture. Xinling here, great. That's another very famous professor already here. Thank you, Xinling. Dr. Xinling, always the best. The support us and the help us. Okay, watch the camera. 1, 2, 3. Okay, watch the camera. 1, 2, 3. Hold on, let me adjust it. And also I want to tell everybody, this afternoon, when we arrive the 5 to 6, we have the form, talk about how amazing with the Tai Chi Qigong, including the acupuncture, help the people the health. And also after that, the school University East-West Medicine will have one small event, and we will, these few days we are so very nervous. One presentation, another presentation. So we have the half hour, we can a little relax. So we have the little bit event in there. So we'll very welcome everybody that moment. Join us online, and we will take a very big group picture. And also we have somebody in here, the school, the together. We will give 我们要给每一个人发一些奖，我们到场的都会领到奖，谢谢。
Yeah.
那个
do plan to participate. We have an award ceremony and also a gathering, and for half an hour, and right after the presentation. Thank you, Dr. Fu.
Okay, so right now, 现在我们介绍下一位非常著名也是非常资深的讲者，一直支持我们的，大力推动太极的，我们 UC Irvine 的教授，邢林大师。邢林大师呢，他是应该说是最早在科研领域能够帮助我们推广太极的人之一，而且他对太极做了非常详细的研究，是太极的科研工作者，在美国的整个太极界，他是最著名的一个推手。好 ，Rose。
Yeah. Well, next, it's our honor to introduce another very high-profile practitioner and researcher, Dr. Ling Xing, and he's a professor and director of the Laboratory for Mind-Body Signaling and Energy Research at the University of California in Irvine. So it's our pleasure to introduce to you Dr. Ling. Dr. Ling, please take it away.
Thank you. Yeah, you can start the video.
Jennifer 可以开始放。
Hello, everybody. I'm very pleased to participate in this 6th World Conference on Integrative Medicine 2022. My name is Lin Xin. I'm a professor in the School of Biological Sciences, director of the Laboratory for Mind-Body Signaling and Energy Research, and a member of the Susan Samueli Integrative Health Institute here at the University of California at Irvine. Today, I'll talk to you about the physiological basis of some of the health benefits of Tai Chi on the mind and the body. On the Harvard Medical School website, it says, Tai Chi is often described as meditation in motion, but it might as well be called medication in motion because of growing evidence it has value in treating or preventing many health problems. First of all, we all know that Tai Chi and many types of Qigong involves the integrated integration of the three regulations. Regulate the body, the mind, and the breath. So I will talk to you about how regulation of the body and then the mind and the breath could affect mind and body structure and function. First, let's talk about regulation of the body with respect to muscles. Sarcopenia is a disorder describing the decline in skeletal muscle, particularly in old people, because they don't exercise enough, and this will contribute to loss of mobility and independence. Serious problem. In particular, elderly people are subject to falling, and falling is the #1 cause of accidental death of the elderly, directly or indirectly. There are many studies such as this one that shows that Tai Chi can reduce the falling incidence in the subjects being tested. Here in black, the bars in black shows the group that did Tai Chi has a decreasing rate of falling within the 6 months trial period compared to the group that did stretching. Small decrease, but not nearly as much. So you can see that Tai Chi can prevent falls in the elderly. In our laboratory, we use the technique of electromyography. We put electrodes on different parts of the legs to measure the activity of muscle groups, like on the top, on the sides, and at the back of the leg muscles on the upper leg and the lower leg. When a muscle contracts, we can see a signal recorded here that goes like that. And we can measure the intensity of these signals to see which muscle group is used a lot or a little bit or not at all. What we found was that during normal walking, these 6 muscle groups are used to this extent. But doing Tai Chi forward twist steps, the standard twist steps of Tai Chi, 拗步, moving forward, moving backwards, moving sideways, certain muscles are used a lot more than when you just walk or jog or even go upstairs. Which are these muscles? First, the hip flexors. These are the muscles on the side, okay, of the leg, upper leg. They're used a lot, and also the muscle on top. These are called the quadriceps, on top of the leg. These 2 muscle groups are used a lot more during Tai Chi exercises, going forward, backwards, and sideways, than walking or jogging. This is very important in this context of fall prevention, because the side muscles are your stabilizers. It keeps your body stable. And the top ones are your brakes. So when you fall, it'll prevent you from falling all the way to the ground. So doing Tai Chi could strengthen the muscles that have to do with stabilizing and stopping you from falling, compared to running, jogging, or just walking. During those exercises, these muscles are actually not used much. Of course, doing Tai Chi is not just to prevent falling. Here we show that Tai Chi is excellent for exercising all major muscles of the body. So we measure using, again, electromyography, the use of muscles at the shoulder, the deltoids, the chest, pectorals, okay, the side of the body, oblique, deltoids again at the back, traps, the shoulder muscles, latissimus dorsi, these are the muscles running down the back, okay? So these are major muscle groups. And we looked at what happens when a subject does like, one of like 20 some different Tai Chi movements. If a muscle group is used a lot, excellent exercise, we label it red. If it's very good, orange. Fair, which means still pretty good, yellow. And you can see across the board, red, orange, yellow. So all these Tai Chi exercises could benefit, all the major muscle groups in the body, not just on the legs to prevent falling. Next, let's look at connective tissues. Now, we all know that low back pain is a major problem for many people. 80% of Americans have some form of back pain during their lifetime. The American College of Physicians recommend Tai Chi for treatment of back pain. How come? This is a pathway that's been worked out at Harvard Medical School, and they found that when a body is stretched, the underlying connective tissues are also stretched. And within the connective tissues are all sorts of cells bound to the connective tissues, and the cells are indirectly stretched. Stretching of some of these cells, like a fibroblast, when they get deformed because of the stretching, they start to secrete a signaling molecule called ATP, the same molecule that's used for energy, but in this case it's for signaling. So a stretched cell would send out ATP outside the cell, and the ATP could be converted to adenosine, and the adenosine could then bind to the so-called A1 pirinergic receptors locally to relieve pain and inflammation. So we now know at the molecular and cellular level how stretching could then eventually lead to relief of pain and inflammation. In our laboratory, we analyze stretching movements by using a computer method called the Kinect system by Microsoft, and we can convert the image of a subject into a digital skeletal diagram. Then we could objectively measure the angle, of the back and the legs and the arms, and the distance, from one part of the body to another part of the body to the ground. So we could objectively evaluate to what extent a person is doing these exercises correctly. We then measure, again, using electromyography by using electrodes to measure the extent a muscle group is used in a particular exercise, in this case, the lower back. In addition, we also put a probe in that area to use laser Doppler flowmetry to measure blood circulation at that point. In other words, if we exercise the low back effectively, we could see the low back muscles, they exercise, and then increase in blood circulation. So using this combination of methods, we show that like these 6 exercises from Tai Chi and Qigong are quite effective in exercising the low back muscles and increasing blood circulation in the low back area. So in Tai Chi, you can see this is so-called twisted body fist stance, 铁身锤, here, okay. This is through back dodge, okay. This is 闪通背. Both exercises can improve the low back muscles of the latissimus dorsi by exercising them, strengthening them, stretching them, and also improve blood circulation in that site. We also found that in this particular type of Qigong called the 5 animals frolicking, 五禽戏, like the bear, the deer, and the tiger, they too can actually exercise the low back muscles a lot and improve circulation there. So what we can do is to advise people with low back pain and say, well, instead of spending half an hour doing 108 different movements, many of which got nothing to do with the lower back, why don't you spend that half hour doing these exercises, which will greatly strengthen and stretch your low back muscles, and that will help prevent or reduce back pain. So this is kind of like personalized medicine or precision medicine. Not saying that, doing 108 different movements is not a good thing, but as a treatment, you can now do these exercises. Next, how about bones and joints? Reduction of bone density is a big problem, particularly as we age, and particularly for women. And there are many studies, such as this one, that show that Tai Chi could enhance bone health. Here, in a randomized controlled trial, Tai Chi group exhibited reduced rates of postmenopausal decline in bone density, bone mineral density. How come? Well, we all have heard many times, I'm sure, that exercise physiologists have advised us to do weight-bearing exercises to strengthen bones. So Tai Chi is not lifting weights, but you are lifting your body. Your body has significant weight. So doing Tai Chi, is a weight-bearing exercise. So it's not surprising that doing Tai Chi could actually improve bone density. In newer research, scientists have found that not just weight-bearing exercises are good for bone density, but bone vibration is important. So in this particular study, they found that when the subjects do jumps, jumping as high as you can, 10 to 20 times, 2 times a day, in that particular study, the subjects that did that resulted in significant gain in hip bone mineral density. So weight-bearing and bone jarring, vibrating exercises are good. And we can see here that particularly in the Chen style Tai Chi, there are a lot of bone vibrating jumping and stomping movements, as you can see here, jumping or stomping. And these exercises could strengthen bones in addition to the weight-bearing aspects of Tai Chi. How about knees and joints? Well, Tai Chi has been shown to be effective in treating knee osteoarthritis. In this particular randomized controlled trial, after 3 months, compared to stretching, the elderly subjects practicing Tai Chi had a substantial drop in knee pain and more improvement in function. As a matter of fact, the Sun style of Tai Chi, as modified by Dr. Paul Lam from Australia, who's also a Tai Chi expert, the Sun style is endorsed by the American Arthritis Foundation of America for people suffering from arthritis. Again, how come? Well, in this study done at Fujian University and Harvard University, first, they confirmed that Tai Chi and the Ba Duan Jin, Qigong, both could produce similar pain relief of knee arthritic pain compared to cycling, like cycling in a stationary bicycle at home or in the gym, which is a standard physical therapy treatment. So Tai Chi, Ba Duan Jin, and cycling are equally effective in reducing pain of the knee due to arthritis. But they went one step further. The latest research that they did showed that using functional brain imaging methods, they found that all three, Tai Chi, Ba Duan Jin, and cycling, affects the same part of the brain. Okay, all three activate same parts of the brain to pretty much the same extent. So that, interestingly, Tai Chi, Ba Duan Jin, and cycling they work pretty much the same way in terms of affecting the brain, in addition to the joints themselves, in reducing pain, that is. Okay, next, let's talk about regulation of the mind. In our laboratory, we use electroencephalography, putting 108 different electrodes on the head to study brainwave patterns during a meditative state. So here is just sitting there, doing nothing, or staying there, just resting. But when a subject gets into a meditative state, there's a tremendous increase in theta waves, indicating that the person is deeply relaxing. Also an increase in alpha waves, indicating the person is very, very calm. But there's also an increase in beta waves. So these are slow waves, okay, like 10 times per second, okay? And this is fast waves, like 20 sometimes a second, 20, 30 times. This indicates that the person is very much awake and thinking. Now, if a person is to fall asleep and sleeping deeply, you would get an elevation of theta waves and alpha waves, but not the beta waves, because obviously you're not awake when you're asleep. But when a person goes into a meditative state, such as a standing meditation, okay, or even moving meditation during Tai Chi, you get into a due state of relaxed concentration, a very unique state. And relaxed, of course, when you relax, you're not stressed. So it would be a way to decrease stress when you meditate. We confirm the resting stage of meditation by using photon migration spectroscopy to measure oxygen consumption in the forebrain. And you can see, starting from the beginning of the meditation, there's a very steady decrease in the consumption of oxygen in the brain, indicating, again, confirming, again, that during meditation, the brain is less and less active and resting, and burning less oxygen, as we can see. Okay, so what are the benefits of meditation? Our colleagues at UCLA found that in a clinical trial, the subjects who did meditation compared to not doing meditation, the meditation group had a steady decrease in sleep problems. Like they could sleep a lot better, not waking up or getting to sleep very quickly, okay, doing, in this case, like a 2-month trial. Also, okay, a decrease in fatigue syndrome, okay, if you can sleep better, of course, you feel less tired. And also a decrease in depression. So people feel happier, okay, when they meditate. So these are measurable benefits of meditation. Just as important, the same group at UCLA found that if a person is less stressed, stress is an inhibitor of your immune system. So they found that the Tai Chi group, the group that started doing Tai Chi, had an increase in immune marker. In this immune marker that they measured the level of antibodies to shingle virus. And you can see a steady increase in this immune marker. Particularly important in the elderly because they suffer shingles, right? And the control group, no change within the first 16 weeks. And at this mark, they got vaccinated to the shingle virus, and the antibody level went up to here. And you can see that the Tai Chi group, before they got vaccinated, they're already at this level or even higher. So you can say that, oh, wow, doing Tai Chi is as good or, even better than getting vaccinated. But of course, they got vaccinated. They went all the way up to here. Now, you wonder, what is this dotted line? The dotted line is the level of antibodies in 30-year-olds. These are 60-year-olds. So you say, wow, okay, if you do Tai Chi and get vaccinated, you're back to like a strong immune response like 30-year-olds instead of a 60-year-old. Now, the group at Fujian and the University and Harvard, they also found that the group that did Tai Chi and Qigong, Ba Duan Jin, had another change in brain function using brain imaging, functional brain imaging, so-called functional MRI, okay? And they think, okay, functional MRI. And they found that the group that did Tai Chi and the group that did Ba Duan Jin showed better connection between this part of the brain called the hippocampus and the prefrontal cortex, the front of the brain, okay? Why is this important? Better connection. You see, this is the part of the brain involved in storage of memory. This is the part of the brain that does the thinking. So this is analogous to like the hard drive of your computer, and this is equivalent to the RAM, okay? So better connection means that when you think, you can like make use of the memory, the facts and data in the memory, and you can use that for your thinking. So of course, better connection makes you function a lot better in terms of cognitive and memory tasks. I mean, what good is it if you have all sorts of data and facts, stored, but you can't use it? So in Tai Chi and Qigong, because you have to memorize so many things and make use of so many things, like, one movement after another, okay? This like, okay, first, you do parting wild horse's mane, brush knee, push hand, then you have to do wide crane opening wings. And then each movement has all sorts of, like intricate movements. You have to remember all these in one after another. So that will improve your memory and making use of the memory and controlling your body in a certain way. Now, we just talked about how, vibrating the bones and weight-bearing exercises could improve bone density. Of course, that's very important because, you don't break your bones. That's obviously very important if you fall. Now, there's one thing that's also very important. Stronger bones will secrete more of a hormone called osteocalcin. The osteocalcin can get into the brain, into the hippocampus, I just talked about, like the memory center, and induce the brain cells there to divide to create more brain cells in the hippocampus. In other words, when you exercise, you vibrate the bones, okay? You put load on the bones, the bone structure, is maintained or becomes better, and the bones secrete more osteocalcin. They could get to the hippocampus and induce cell division to make more brain cells. And these brain cells are involved in, as I just said, memory, but also improve tolerance to stress. When you exercise, you also contract the muscles, and you also have another pathway to lead to this type of results. So doing exercise in general, not just Tai Chi, but certainly Tai Chi, and particularly Chan style Tai Chi, could benefit in terms of not just stronger bones, but better memory and better ability to tolerate stress. So here, they show that the new brain cells are not just more, they are super brain cells. They're larger in size compared to the ones that are already there. They put out more and longer nerves, dendrites that connect to areas of the brain that are involved in memory. So this has been shown that you create not just more cells, but better cells when you exercise. And you can show that in a clinical trial, those people who exercise do better in executive function, in a test of executive function, control function, spatial memory, speed of calculation and thinking and memory recall across the board. You really benefit from exercise. Finally, let's talk about regulation of the breath. In Tai Chi, Qigong, we breathe slow and deep, okay? Slow down to 6 times, 4 times a minute, okay? Deep, instead of regularly using only 25% of the capacity of your lungs, go to 80% capacity of your lungs. Why is that a good thing? In addition to just, improving the amount of oxygen coming into the body? Well, the latest research showed that in our breathing pacemaker, okay, here in this diagram, here's the whole brain, here's the brain stem, and within the brain stem is the breathing pacemaker. So diagrammatically, you can see the brain stem, and then the breathing pacemaker. The latest research showed that there are at least 3 different types of brain cells in the pacemaker. So one type of brain cells have to do with nervous sniffing. When you're stressed, you go like that, okay? Another type of brain cells are associated with sighing, okay? Like when you're nervous, you say, oh yeah, oh, wanna, oh, OMG, oh, okay? And then a third type of brain cell has to do with slow, deep breathing, like what you do during Tai Chi and Qigong. These cells are very special. They're connected directly by nerves to another part of the brain called the lucus coeruleus. This is the part of the brain that has to do with stress response. When you're under stress, this part of the brain will send out adrenaline, okay, to make you respond, to run faster, but your heart will pump faster, blood pressure will go up, and so forth. But if you breathe slowly and deeply, this response could be turned down, okay? In our laboratory, we could show that we make people get stressed by playing a video game called the Slenderman. This is a very stressful video game. And when the subjects start doing this, their heart rate would go up. But when we tell them to continue to play the game, but now with slow and deep, the heart rate would come down. Blood pressure would go up when during the game, but continue the game, but deep blood pressure would come down. So we can show that indeed slow, deep breathing just by itself could really relieve some of the symptoms of stress in almost instantaneously. So in conclusion, modern research can dissect out the physiological basis of many of the healthful effects of Tai Chi in terms of the 3 regulations, regulating the body, the mind, and the breath, and how these regulations affect body structures and functions, leading to all these beneficial effects. So thank you very much for your attention. If you want further information or any questions, you can email me. My name's Shin Lin at uci.edu, and we also have a website that you can look at. Thank you very much, and bye-bye.
Well, Dr. Lin, thank you so much for sharing with us your insightful research. Now, Western medicine is focusing on evidence. What is evidence? Evidence basically is using scientific method to validate the results. And for hundreds of years and thousands of years, Chinese medicine, we have been practicing, but some Western medicine scientists will argue that we're TCM is not evidence-based. So through Dr. Ling's pioneer research, we can validate not only just TCM and also Tai Chi and Qigong and its impact on the mind, memory, and the whole body. So for that, Dr. Ling, we would like to thank you for your contribution to traditional Chinese medicine and also to the health, general health of this country. So back to you, Dr. Fu.
Thanks so much for the Dr. Lin. Have one simple question. How about you think about right now, the California already proved the doctors, acupuncture doctor can use the 15 minutes teaching the Tai Chi and Qigong, and they can get the paid from the insurance company about the $80. And what's your suggest for this program?
That's very important because as a number of speakers have said before, we should not just look at Tai Chi or acupuncture or herbal medicine separately. They're all part of the same system. So having, reimbursement for acupuncture treatment, but also adding the Tai Chi, and maybe one day even reimbursement for herbal medicine to get the whole package. That's really important.
Okay, thank you so much.
Bye-bye.
Thanks again. Hope see you very soon. Okay, so 下一位呢，我们原计划是 UCLA 的张卫军教授要特别对这个太极气功的运动处方发表演讲，但是刚刚给我来了一个紧急的信息，他的原话是说，我到时候可以把这个截图发给大家。他是说很抱歉，这个傅博士，我全家人中标了，所以现在被 COVID 的影响到了，就全身在发烧、咳嗽，很难受，确实没有办法参加。希望这个大会圆满成功，然后他下一次他会把相关资料发给我们，我们会发表在会后的会刊上，好吧？好，谢谢。所以因为这个原因，我们也祝这个Dr. Zhang 早日康复，全家都早日康复。这个疫情确实对我们有很大的影响，那么我们开这个会就是希望用我们自己的努力尽到帮助阻止疫情的传播和解决后遗症这方面的功效。好 ，Rose。
Okay, well, based on our original schedule, our next presenter is Dr. Zhang, and he's going to talk about the actually the latest approved authorized therapy of medical Qigong in California. Unfortunately, he just sent his regret to the organizer to us that he and also his entire family have been affected by COVID. So we wish him well, and also we wish all the practitioners you're working on the front line with patients, and do take care of yourself and protect yourselves. So let's move on to the next presenter, Dr. Jack Fu.
Okay, we will come back to the Dr. Li, the Master Li, the program. Master Li is De Yin Li, the daughter, and she is very famous all the world, and she has a school in the UK. So this is she sent to us because UK right now it's middle of the night.
Hello, good morning, distinguished guests, experts, professors of traditional Chinese medicine. First of all, I would like to say thank you and congratulations to the Pan-European Federation of Consultants in Traditional Chinese Medicine. Thank you for organizing and hosting such a wonderful online forum. My name is Fei Li Yip, Chinese name Li Hui. It is my honor and delight to share my presentation with everyone. The topic of my presentation is Tai Chi for health and well-being. 太极是优化生命的最佳良药。As we all know, on December the 18th, 2020, Tai Chi, a century-old Chinese martial art and an internationally popular form of exercise, has been added to the UNESCO's Cultural Heritage List. Why? In my view and my experience, I describe Tai Chi like this. If there is a medicine in the world that can give you long-lasting good health without any side effects and doesn't break your bank, would you like to know it? I would imagine most people's answer is yes, please. Well, Tai Chi and Qigong can be described just like that, a form of energy medicine. Here is why. The exercise of Tai Chi and Qigong can remove stagnations of Qi, 疏通经络. It also restores the balance between yin and yang energy, 调节阴阳. It revitalizes the vital energy in our body, 活血化瘀. It also replenishes the vibrant and vital energy in our body, 固本培元. A little later, I will take everyone through a few simple movements. But first of all, I would like to draw your attention to some of these key Tai Chi principles and character requirements that give and deliver the health benefits. Right from the beginning, when we practice Tai Chi, we want to keep these essential requirements. Enter a state of mind that is calm, tranquil, quiet, peaceful frame of mind that we describe mindfulness or meditation state of mind. With the physical requirement, we need to remember our crown will lift upwards and chin slightly tucked in, allowing the Bai Hui to be suspended from the ceiling. Tongue touch the roof of the mouth. And breathe smoothly. Knee soft and slight bent. Drop the tailbone down as if we are sitting on an imaginary stool. All of these is try to open the energy channels. And shoulder should be down, elbow should be dropped down. This will try to release any tensions and stiffness on the shoulders and neck. And the pattern when we do movement should be coordinated with inhale and exhale. Breathing should be nice and smooth with the rhythm of the movements. For example, rising is inhale, sinking movement is exhale. The second movement I will take you through is called repulse the monkey. Only on the arms, we just keep the feet still to experience the characteristics of Tai Chi. The requirement for all arms movement needs to be nice, relaxed, and soft, not to have any rigid, hard movements. This including the relaxation from the waist, from the lumbar, the torso, as well as the joints of the shoulders, elbows, wrists, fingers, and not to move in a rigid, locking any joints. However, this softness carries underneath the underlying strength, not soft as noodles, not soft as no strength, but the strength is underneath the softness. The balance between yin and yang. We will shortly experience that. The other side, this is the other side of balance, the left side of the brain and right side of the brain. As well as being soft and relaxed, also the movement of Tai Chi needs to follow the rules of natural unroundness, which means the circle we create, the arms movement, the waist movement, is all in a rotation. Arms rotation, lumbus rotation, and torso's rotation. So follow the pattern of the symbol of yin and yang. And the third movement I'm going to take everybody through is called Lou Xi Ao Bu, brush knee twist step, including the footwork. And here we can experience how the coordination in Tai Chi is unique, coordinating the upper and lower body. And we should always use the waist to lead the arm, and the strength, allowing feel the power comes from the feet and gathered, directed, and centered in the waist, and use the waist as the leading energy into the arms, the wrists and fingers, only reflected and show as an expression of the body energy in the arm. How these body movements and arms movements and foot movements should all be moving in the rotation of the energy. And this energy rotation acts as a massage to all the energy meridians. Here is the opposite practice of the same move, left side and right side. Again, it's training and practicing the coordination of left brain and the right brain, as well as upper and lower bodies movements. If we have time, I would be sharing and leading you with is called 野马分鬃, parting the wild horse's mane. This is a representative of the 24-step Tai Chi and many other Tai Chi routines. And here I would like to lead everybody experience the flow of Tai Chi, 连绵不断. The flow of Tai Chi without break can be described as the moving meditation. So it is like the passing cloud, the wandering cloud, and the flow, the peaceful flow of the river. 行云流水. The transfer of one movement to another. It's like the end of one, beginning of another. The new movement is born out of the previous movement. No apparent stop, no pause or jerky movement. And this is a very important movement. No stop and start. Just like the energy travels in the body, is constant, is regular, is continuous. So if we had time, we can experience the fourth movement too. Okay, this is finished the end of my short PPT presentation. Now I would like to take everyone through a few movements just to digest and feel these few principles. As always, we spend one moment to allow yourself to arrive on your spot, in your space, in your mind's eye. We are connecting ourselves with the Mother Earth and feeling The toes, the ball of the feet, and the heel of the feet are firmly connected and rooted on the ground. And the crown is floating up, gently extending tall, not with a rigid muscle force. It's a gentle feel that the crown by Hui Xue is suspended from the ceiling. So your body is nice, loosely hanging from this suspended feeling. Good. In your own time, let's begin. Soften the ankles and knees, taking half a step to your left. I'm doing the mirrored image. Centralize your body weight. Smooth your breathing. Tongue touch the roof of your mouth. Ready, opening stance. Raise your hands. Feel the raising of the hands is following the energy, the qi. Qi rise and will follow, hands follow the qi. And the qi sinks.
Prevention of
We
stroke.
follow the qi down. And we try to experience a couple more times.
Secure.
Rise, inhale, and sink. Qi come down. Our hands follow. Again, inhale, rise. Feel the energy grows on our body. And energy sinks. Exhale. Feel the qi travel through the body, all the way down to your feet. One more time. Inhale. Remind yourself, shoulders down, elbows down, wrists relaxed. Good. Ready to change. Turn to your left, keeping your knees forward. Only turn from the torso, from the waist. And arms rotate, open, palms up. Then curl back your left arm to the ears, above your shoulder. And gently turn the body back to front. Feel the power, the energy travels from the waist to the shoulder, elbow, and to the wrists. Try the other side. Open, remember lateral rotation from the waist, and curl arm back and push. Repose monkey without the footwork, just on the stilled. Again, open. This is to stimulate the meridian on the torso by lateral rotation. 2. Push forward again. Feel that extension. We're stimulating the meridians in the arms by rotating, opening the 3 yin and 3 yang meridians associated with our hands and arms. Again, last time. Still sit. Keep your knees soft, sitting down. Feel that energy to our feet is still strong and connected. Last time. Inhale. Exhale. Good. Feel the energy is going forward strong. And ready for change. Quietly shift your weight. Shift your weight. And gradually, slowly shift your weight. And draw the left foot in. Left foot in. And extend your arm to the corner. 2. Step. Draw the tailbone down. Feel that energy sink down, grow the root and transfer forward. And try to feel the pushing, the energy comes from the feet through your knees, hips, waist, travel to the back, to the shoulder, then elbows, wrists. So feel that process. Sit back, again sink, allowing the energy to draw down. 2, shift your weight back. Remember to keep your back nice and straight. 3, step out and curl the palm. 4, as you push forward, must feel that the whole body, upper body and lower body, the coordination, the solid, what we call the shi and shu emptiness. We'll do a few more repeat on this one. Shift your weight. Draw the foot in, step and curl the palm. Make sure your transfer weight light and smooth. No jerk, no stop and start. Smoothly shift your weight back and feel the movement. It's like the wonder of the cloud, passing of the cloud, or the flowing stream. We describe stepping in Tai Chi as if you're stepping like a cat, the step cat's walk. Not the fashion catwalk, but it's in the light, nimble, agile. Good. So we have been practicing left and right. 楼西奥步 See, you can make any movement of Tai Chi as a repetitive, standalone exercise to experience and tackle, working on one particular principle. Good. We're going to have one more movement.
好，对对。
野马分鬃 Sit back. Lengthen the tailbone again. Feel the transfer of the body weight. Smooth. Get into a balloon. Now the movement of Tai Chi is just round and circle.
Very good. This is a very good, very good. The Dr. Master Li, the presentation is great. We want to continue watch, but the time limit, and I will continue play about I will continue play about it, about the tonight. Everybody, if you want to watch, and don't forget every information I put in the YouTube channel. You can click on the link, go to the YouTube. You can see the live the channel.
Wonderful.
If you okay, right now we will go to the next. 我们会下一位有请到的讲员是一位非常重量级的德高望重的医生。他呢不讲英文，但是他讲英文，但是呢为了方便大家，由 Rose 来翻译一下。这个由我们这个苏花昌老师，苏花昌呢非常重要，是我们大会的顾问和终身共同主席，以及我们苏花昌本人是加州职业针灸中医师学会会长，美国中医针灸联盟副主席，加州中医针治联盟副主席，美国优因大学中医药学院教务长，加州针灸中医师工会前会长及联合工会名誉会长，中国民族医药协会特技联副主席。好，这位苏华昌会长今天要谈中风康复相关的认识。好，请 Rose 翻译一下。
No, 谢谢. Well, our apology to cut the Tai Chi video a little bit short. As you know, we're putting all the videos on YouTube, so you'll be able to access. And also, as you can see from Master Lee's demonstration, anyone, any age, you can practice Tai Chi and Qigong at any place. And to have the benefits of your whole body, your memory, as researched, documented by Dr. Ling. Next speaker, next presenter is another heavyweight, a very well-known, high-profile presenter. His name is Dr. Su Hua Cheng, and he's the acupuncture practitioner in California. He's also a lifetime member and supporter of the conference. So without further ado, I would like to introduce Dr. Su to be our next presenter. Dr. Su.
OK， 我今天给大家讲一些关于中风康复过程中的一些问题啊。这些问题呢都是多年实践中总结出来。在讲这个以前呢，先简单谈一下关于提到中风复健一定与椎体束有关系。那么简单提一下椎体束。椎体束呢是上运动神经元，起源于额叶的中央前回的椎体细胞，它行走在延髓的椎体那地方，交叉到对方，所以说左侧的支持右侧，右侧的支持左侧。
好，所以
那也因此而得名，它是椎体细胞发出的，又在椎体交叉的这个交叉，所以叫椎体束。实际上，它又分为皮质脊髓束，就是说从脑皮质一直到脊髓，在脊髓的不同阶段更换神经元，也就是第二级神经元到脊髓，从颈到腰。那另一个呢，就是另一支呢，就是皮质延髓束，就是皮质核束，细胞核就是细胞核的核束，细胞核束也叫做皮质脑干束，说的更具体一些。所谓脑干束，就是这个从皮质到脑干部位的所有运动的神经元还原在这里。它这个书比较短一些。Rose, please.
Oh, okay. Well, that's lots of information to translate, but I'm going to just quickly summarize. And Dr. Su's topic today is clinical studies and the research on stroke patients. And first, he started with the origination. Where did stroke come from? So he's going to share with us his clinical experience and research on this topic. 好，谢谢苏医生，请继续。
那个 Rose，我跟
第二个问题呢，就是脑中风病情的程度或后遗症的严重轻重程度与脑中风发生的部位相关联。不同功能由不同的大脑组织形成和支配和传导。中风部位所在决定了病情的轻重，是死亡，是产生后遗症，或者完全恢复正常，决定了后遗症的时间持续的长短、缩约，甚至终生。轻重程度多少，还有时候会出现千姿百态的后遗症的状态。
Each patient, each stroke patient has different experiences based on where's the location where the central nervous system was affected. So it can be severe, can be light. So it's crucial to determine where the stroke impact the neurological system.
一般来讲，脑神经元受损以后，这个中风部位在脑神经元那个部位，病情或后遗症都会较轻一些。比较来讲，因为神经元分布的范围较广、较分散，神经元细胞受伤以后，大部分有些死伤以后难以复生、难以再生，但是在邻近的细胞受伤的细胞，有可能它会再恢复过来。传导束受损以后，
谢谢。
病情较重，而且后遗症难以恢复，因为传导数比较集中，这是一个。再一个，传导数都是细胞神经元的主突，它一旦中断了以后，就失去了功能。传导数深入到髓质，下达到脑干和脊髓。第二个，脑叶前半部受损以后比较少见，但是症状较轻，而且肢体运动的后遗症很轻，或者说不存在。我有一个病人是个牧师，他中风以后昏迷了3个月，他完全恢复，各种行动一如正常。第三个，肢体障碍后遗症都与椎体束相关联，刚才讲椎体束。再一个，左侧中风通常比右侧严重，因为左脑是控制语言能力，这叫主脑半球，理解能力、思维能力、书写描绘能力和右侧肢体的活动。大家知道右侧都是最有力量的，它是由左脑来支配的，以及左眼的视力，左脑主控，右脑是主控左侧的。中风时候越年轻，恢复的状态就越好，也不见得啊。但是年轻的人有一个好的条件，抵抗力强，耐受力强，细胞再生能力也强。但是从临床实践中得来的结论是，康复率与年龄因素相关的，就是说年轻有利于恢复的只有1%的因素，微不足道。所以说把握好机会，越早越好，抓紧时机，积极康复，这是上策。
好，谢谢。Well, Dr. Su really dig into the location where the stroke impact your central nerve system. And if your left side is being affected, and normally the stroke patient suffers much more severe consequences. And because the left side controls our thinking, our emotions, versus if the stroke affected the right side, instead, our right side controls motion. So patients typically demonstrate less severe conditions. And also for young people, typically they recover faster. And however, in the case of stroke patients, age is really a minor factor. And the key is which part of your brain and your neurological system the stroke impact the most. 好，苏医生，请继续。
OK， 我在这里也提到一个就叫脑休克的概念。肌休克大家可能知道，听说的比较多一些。在手术当中，你那个器件碰到以后，就可能下来以后，病人就不会走路了，就肌休克。也有鞭策性损伤，往后仰了一下以后，整个肢体都不会运动的，也有出现，这叫肌休克，会有的。脑休克也叫做断联休克。中枢神经系统急性损伤引起功能上与各部位有联系的神经功能短暂的缺失。中枢性瘫是迟缓性的，因为脑休克的原因都是迟缓性瘫痪，痉挛性的很少见。我在这里这么多年只有一个，他清醒以后是全身痉挛的。休克期过后，受损的神经所分布区的不同，它会有些就可能很快的恢复。中间缺血或者出血致死的细胞不能恢复，周围 发生脑休克的那些脑细胞，慢慢逐渐的，它是受损的，它可以恢复的。临床上最常见的一个脑休克就是脑震荡。脑震荡就是脑子受伤以后有短暂时间的昏迷，然后苏醒过来以后有异性健忘，啥也不知道，你问他什么不知道不懂的，这叫脑休克。
In the cases of sudden stroke, and your brain may be affected differently, and surrounding tissues and your brain function, depending on the area and the severity, can recover some of them. However, if the lapse is too long, and the recovery of those nerve cells will be difficult as well. And of course, in several other cases, for instance, if it's a sudden injury to your brain system, and then effect to the patient may differ as well.
OK， 脑休克和中风和颅脑外伤常常是合并存在，而被忽略它的存在是常常见到的，就是临床的医生往往忽略了脑休克。大家看中风的病人的时候，我看不管西医不管哪都是这样的啊，他们都会忽略脑休克存在的一些状态。我专门讲一下脑休克这些问题，简单谈一下啊。脑梗塞也好，脑出血也好，脑梗塞就是要么血管狭窄，要么就是血液里面的栓子脱落掉在脑组织里面、脑血管里边去。比方说心房腺占，栓子形成以后，就会容易脱落在大脑里边，就形成脑中风。但是这个堵塞的血管通常都很小的，脑中风和脑出血的部位大概都是以毫米、厘米计算的，那要多半都是毫米计算的。要是很大，有5个毫米、几个毫米，那就一般这种病人都很难得救的。能抢救回来的病人，多部分都是很小的，但是造成周围组织的脑组织损伤，也就是受打击以后产生的脑休克，这才是很多病人慢慢苏醒的，这才是真正发生的原因。这些脑休克就是暂时的失掉了联系，暂时的出现了功能的丧失，可能是短暂的，可能时间久，甚至严重的就是植物人了，植物状态。植物状态久，抢救不及时，有可能就死亡的。这种概念就解释了刚才我说的额叶的中风，为啥这种病人昏迷了数月仍够完全康复，而大部分的部位都残留永久性的、部分的或者完全性的功能障碍。
From our clinical experience, and most doctors may not recognize or fully recognize the damage to the nerve system. And for most stroke patients, a stroke impact only the very thin, minor blood veins, blood vessels, and they're so small, they're measured in the millimeter. Those small veins and blood vessels, when they are damaged, it's easier for them to be recovered to repair. However, if it's too severe, if stroke patients are not being treated in a timely manner, and then you may experience death or permanent loss of the functions of those nerve systems. And potentially, of course, patients may lose all his or her ability to function as a normal person and becoming at the vegetation stage. 好，苏医生。
一般来讲，中风以后病人苏醒了，在这个状态下，你可以问病人，或者说他的临床医生判断病人。当然我们在中国我们都自己亲自看病人了，在美国呢，在海外呢，大部分都病人出院以后来找我们来看的，来康复的。一般来讲，中风以后上肢先于下肢有早期恢复征象者，比方说手指头先动，脚趾头后动，深感觉的判断以及疼闻觉的先出现的这种病人，在这种情况下，整体来说，这一类的病人恢复的比较好，比觉知先恢复的病人完全是两个样子，比那个病人要恢复的要好一些。
Okay. Well, based on our clinical experience, after patients is awake from stroke, and we ask patients, and how do they feel? And typically, if it's the upper limbs recover first, for instance, if hands and fingers start to experience some movements, and those type of patients typically can recover better and a little bit faster if they're experiencing upper body senses first. 好，
在临床实践中观察、统计、总结出这一结论。他肌力方面是如何认识的呢？为什么会这样呢？有这几个方面可以理解。肢体远端是恢复最晚的地方，最差的部位，手指、脚趾都不例外，都晚于肩和髋关节。第二个，手指、脚趾距离大脑最远，就是神经的传导，这个通路也最长。那椎体束或者椎体旁束下达下来以后也最长。第三个，手和脚相比较，组织更远、更长。除了外周就是体外表现是这样以外，在大脑里，在颅内也是一样的。在颅内，它那个大脑神经元呈扇形分布。那手指呢是在顶叶，就是耳朵这个相差的平面上。那脚趾呢是在顶部的头顶的这个部位。那距离传导束综合的部位，它相应的距离也远。再一个呢是，这个地方的血液供应也不一样，因为大脑前动脉、大脑中动脉越接近于上肢神经元分布的部位，距离下肢神经元分布的部位呢就比较远一些。也就是说，上肢神经元血液供应比较完善，下肢神经元呢血液供应相比比较遥远。一旦受伤以后，血管也会受伤，它恢复的机会就会漫长，所以这样就造成中风以后的结果是刚才讲的这个结论。
好，谢谢。Well, those are these cases we experience at a clinical level, but from the scientific standpoint, how do we explain this phenomenon? And he explained this phenomenon in two areas. One, the limbs, upper limbs versus your feet, and the distance from your central nerve systems are different, obviously. And the transmittal of nerve signals to your hands, limbs are faster than transmission to your feet. As a result, and your mobility recovers faster. And that's from the neurological signal transmission standpoint. And secondly, and it's from the blood circulation standpoint. And if we study your brain, the nerve system structure, they're in a fan shape. And we notice also the distance between your upper body versus your lower body, the distance, because of the distance, blood circulation is different as well. So those are the two reasons we believe can explain the clinical cases we just discussed. 好，谢谢苏医生。
然后下一个问题就是定位诊断。那定位诊断呢，现在有脑 CT、脑 MRI，大体上他们会决定一个部位，但是在临床上的定位诊断更有指导意义。你说这中风部位发生在皮质、内囊或者脑干，它出现千差万别的不同的症状，那对于预后的判断确实存在着非常重要的意义。我最近就有一个这样的病人，他来了以后，中风两个礼拜来的，医院都正常的，因为他是右侧中风。他来了以后，我一问一看，我觉得他是下肢先恢复的，我就告诉他讲，我说你这种情况恢复的可能较慢一些。结果治疗2个礼拜以后，下肢可以走路，现在都拿着拐杖就来了，但是上肢呢，连丝毫的恢复体征都没有，连指头连动都不能动的，就是处于这样的状态。那最后我给他定位定到哪里了呢？就是扇形的传导束支配上肢的那个传导肌还没有汇合以前，那个部位发生中风了，发生了梗塞，脑梗塞了，就是缺血性脑中风了，所以他就上肢特别严重，下肢来恢复的，将来恢复的可能完全好，能够完全恢复，而上肢的一定会留下后遗症。所以定位诊断就是这样的。所以你给我个病人的解释了，我就给病人说清楚，你中风的部位在哪，是这个意思。
Very good. Well, it's vital for clinicians to locate the location where the stroke impact your nerve system. And for instance, I have a patient, and was 2 weeks after he had a stroke. So he came to see me, and he recovered some mobility on his lower limb. He was able to walk. However, and his upper arms and fingers are not experiencing much recovery. So based on the fan nerve system structure, I was able to determine the location of his stroke, and also made a determination that due to the location and its impact, and he will experience a longer recovery time, and also will be difficult for him to fully gain his recovery for his upper limbs. So it's vital to analyze and locate the location of the stroke, even with the help of CT scanners and MRI, and clinical observation is still vital. 好，谢谢。
脑中风以后产生的后遗症，大部分都是痉挛性瘫痪，尽管他来看你的时候是迟缓的，那是脑休克引起的，而且都是脑中风嘛，都是上运动神经元伤害引起的瘫痪，所以会引起肢体的不同的变化，比方无力、使用、失去协调性、管控姿势失常、足下垂、内翻，那上肢屈内收，说起来胸大肌缩得紧紧的，越时间久越缩得紧，拉都拉不开。那踝关节呢不稳， 甚至僵硬。如果僵硬是处于神志状态的，这种病人往往路都不会走的。膝关节过深加上踝关节背虚，这都是很不良的走路的这个形成的姿势。也有的呢是中风以后，就是教别人走路的时候没有掌握好开出的走路的姿势，比方说别人要会站会坐，站立起来然后会走，然后他练习走路，练习的肌力的锻炼。因为不然的话，病人在走路的时候往往会引起膝关节过深，就是往后背一下打软，时间久了会引起膝关节松弛。下肢太举受限也是很常见的，举止下垂，行走困难，下肢整个都没有力量，就是股四头肌乱缩的时候会产生这样的一个情况。也表现为就是脚尖离地不良，产生棒状画圈步态，腿往外扯起来画一个圈在走路，也有的。还有呢，产生剪刀步。剪刀步呢，就是这个腿常常就往走在两个脚是在同一线上，那重心不稳，很容易摔倒，很危险的这种病人。就是因为患者过度的收缩，髋关节内收内旋，患者脚趾置于健侧脚尖，他走路的时候患者置于那个健侧的脚尖那地方，那抬不起来走不了的。行走困难，站立不稳，所以重心也不稳，这是很危险的，这是一种。还有一种呢，会产生跟随步态，那下肢不能够交替行走，完全失去了步态的周期性和协调性。患者总是在前，为了保持重心的稳定，那健侧呢跟随着患者走，这种情况都是很不好的，就是复健的初期可能发生有问题，可能会产生这一类型的行走步态，也有时候也真是很多的情况可以发生。
For most stroke patients, not everyone has different experiences, but from the clinical standpoint, my observation is, and for most stroke patients, side effects, they typically are paralyzed, and their upper nerve system are being affected, so they cannot maintain their balance. So they lose their balance and lose their coordination when they walk. And their chest muscles are very tight too, and that their knees are stiff, and that make it difficult for them to walk. And typically we can see patients walk in this scissors pattern. They totally lost the coordination left and right, and very hard for them to keep the central balance. So those are the typical symptoms during the early phase after the stroke. 好，苏医生继续。
最后一个问题，脑卒中病人最麻烦的问题、最复杂的问题、最难处理的问题就是痉挛性瘫痪。但是痉挛是必然出现的，每一个中风病人都会要出现这个。一般来讲，痉挛出现的越早越好，疼痛出现的越早越好，说明病情轻或者已经恢复，开始恢复。也就是说，这些病人从脑休克或者脑损伤的过程当中比较短，已经开始恢复。因为本身就是痉挛性瘫痪嘛，迟缓性瘫就是它会被迟缓性瘫痪所掩盖，来了以后软瘪瘪的零度，什么也不知道，但是这都是假象，真正的病人 大部分都是上运动神经元受伤的，是痉挛性的瘫痪。各种不良姿势与很多因素有关系，脑损伤的部位、脑损伤的程度，涉及到神经或支配的肌肉，每一块肌肉都不一样的，也可能是一组肌肉或者哪里轻哪里重都不同的，产生的结果都不同的。肢体原来存在内收肌大于外展肌的力量，我们正常人本来就存在着内收肌大于外展肌的力量，这是产生的这样一个效果的几个原因。
And lastly, I would like to say stroke patients, they can experience very complicated and very difficult symptoms, and we call them 痉挛性stroke. And this impact every muscle and every different group muscle. That's why it's very complicated. Each patient may demonstrate different symptoms, and that's why it's very hard to diagnose and treat those patients.
OK， 痉挛是肌肉紧张性前张反射过度活跃的表现。过度活跃的表现，刚才讲了，这是早期恢复的表现，这是好的一种表现，是脑卒中患者必然都会经历过的一种重要的过程。肌痉挛会引起一系列的病理改变或相应的功能姿态的异常。肌痉挛会导致肌肉炎症反应，就是过度使用嘛，炎症增生，肌肉变形，肌肉纤维化，以及伴随着肌肉肌纤维挛缩的发生，疼痛也会由轻转重，跨越的关节会发生挛缩，持久发展下去就必然会僵硬和畸形，关节活动度受限，周围引起严重的炎症病变，疼痛加重，肢体痉挛失控，肌肉挛缩变形，成为千姿百态的异常的姿势。对抗肌痉挛是康复治疗中的重中之重，难中之难，有很多相应的措施，可是有效而不能痊愈。达到100%的痊愈的可能性占的病人比例并不高，大部分都会残留一些轻微的一些并发症，就轻微的一些后遗症，有些可能过2年还在继续有改善的。
Well, from the clinical standpoint, those are the patients are very, very hard to treat and also to recover. And the symptoms they're experiencing very much like they overuse muscle, so they start to change different forms and shapes, and forming muscle. And clinical standpoint, percentage of recovery are very small, and after 2 years, they may see some improvement, but it's very unlikely will fully recover their former condition. So this is definitely a challenge for the clinician.
中风病人康复的治疗包括很多方面，根据我个人的意见，我认为 针刺治疗、针灸治疗是最重要的一种治疗方法，还有运动疗法也十分重要，也是一个很重要的方法。就运动疗法还包括了口腔运动，就是 speaking therapy， 就是这个语言治疗了。那还有呢，职能治疗，就 occupation therapy， 就是职能治疗了，这也是基本上都是运动疗法的类型，也很重要。针刺的部位，尤其是对于痉挛病人的针刺部位，要把针灸的部位选择在一个肢体的弱侧，比方说颈前肌难以对抗颈后肌，颈后肌要除了相应的肌肉肌块以外，还有比目鱼肌这么大一块肌肉，力量很强大的。那一旦痉挛起来，就会发生踝关节背伸的，所以这个针刺的部位呢，要放在阳经那个部位，也就是颈前肌群那个部位，刺激它是比较好的。那上肢也是一样，你看胸大肌和这个手臂的力量都是往内收的，所以针灸的部位也是放在背才较好。运动的关节不能过强，也不能过猛，因为超过了运动的范围，所以我们每个人都必须掌握每个关节的正常范围。我对这方面都很清楚的啊，每个关节的活动度我都非常清楚。不能超越正常的活动范围，因为超越正常的活动范围会造成意愿性的伤害，就是肢体会造成关节韧带的撕裂，严重的甚至关节腔出血都有可能会发生的。所以不宜过度，也不宜过多。每天这种病人的运动呢，大概就是做在2到3次，每个动作5到10次，每一次10秒左右就足以，也就是几分钟时间内来完成。过多的运动也可能会是刺激机体的这个痉挛的状态，不利于痉挛状态的协调功能的恢复。还有一个就是要适当的做好相应的关节和肌肉的伸展运动，要根据病人的不同的阶段、不同的状态去做一些主动和被动的动作。比方病人刚刚苏醒，还不会抬腿，你让他做什么抬腿的动作都是无意义的，不可能的。那么你可以把换菜腿放在健菜的腿上，用健菜腿带着换菜来做一些动作，就比较适宜，就比较合适。那你做起来以后呢，病人也比较满意，也舒服，也舒展，也得体，而且病人会感到你很专业，这样的话就比较好。你当然了，你要用手，你自己给他做一些被动运动也是可以的。教病人的时候一定是这样做的。这些东西、这些动作、这些做法都是抗痉挛疗法的重要的组成部分。当然也有一些机器来配合，就是说根据肌肉的收缩的运动的节律来配合，帮助来病人做运动、走路，做一些姿势也是可以采纳的。大概我今天讲的就到此为止，谢谢大家，也谢谢我们资深的以及很有水平的做翻译的Lucy， 谢谢你。
Thank you, Dr. Su. Well, now let's talk about rehab, post-stroke treatment. And in my clinical experience, several ways I'd like to recommend to you. And first will be and acupuncture has to be precise and target patient. Secondly, exercise forms, of course, and include speech therapy, occupational therapy, and all of those therapies can be combined to achieve maximum results for patients. And I would like to emphasize the location of the acupuncture is vital. And because based on my experience, location of the acupuncture need to be on the right side of the brain. So this is, you definitely need to consult with Dr. Su more specifically on this part. And then of course, exercise. Dr. Su emphasizes moderation is a key. And when you work with stroke patients, make sure the exercise is very moderate, not rigorous, and do not exceed your normal exercise. So typically, you can exercise 2 to 3 times a week, and each movement, you can repeat 5 to 10 times, and basically 10 seconds for each movement. And this is very important because when you over-exercise, and you're doing the opposite, you overstress stressing the joints and muscles, and that can backfire. So make sure you work with patients and moderate exercise moderately. And also stretching is very important too. And now with some of the PT, there's some machine assisted exercising and stretching, and they can be incorporated into part of the post-stroke rehab as well. So this is all Dr. Su is sharing with us. Very valuable clinical experience. Of course, if you have any questions, and you can definitely reach out to Dr. Su directly. And stroke is a very common condition in the US, as we all facing the aging population, both in the US and also in Europe, around the world. So hopefully you can learn something from Dr. Su. Dr. Su, again, on behalf of the conference, I would like to thank you for sharing your clinical experience very unselfishly to help both patients and also our clinicians. 谢谢苏。
非常感谢苏老师，非常感谢您做的这么好的演讲。那个 Rose 现在在屏幕上可以看得清楚我吗？
灯光太暗了，麻烦把灯光再增强一点，可以看得到。好，
声音呢？声音都可以哈。
哎，声音可以。
好的，好。那么，下一位我们会邀请一位物理治疗师，他呢一直帮助很多的老年人，帮助他们训练。因为今天谈到中风的问题，所以我们会特别的邀请这一位物理治疗师 Star。好 ，Rose。
Well, since stroke is one of the topics we're discussing today, and both for patients suffer from COVID and also, of course, aging population. And now we have another expert in this area and discussing the physical therapy and also rehab to treat stroke patients. So it's our pleasure and honor to welcome Dr. Star.
请开话筒 ，Star 要开话筒，你的左下角开话筒。Yes.
Okay.
现在光线好吗？那个Rose， 我的光线好了是吗？
哎，好点了，现在可以，谢谢。
Okay, the Star, please.
Okay. My name is Star. I am a licensed physical therapist assistant. I'm also co-founder of a private senior fitness specialist company called Regain Your Independence. And I started working with stroke patients in home health care. And one of the biggest things that I see and the technique that I use, the first thing I'll start off is with just patient education trying to get the patient to understand what we're doing, why we're doing it, the muscles that we're using, so that the better that they understand what we're doing, the more they'll be able to connect from the mind to the body, and just gaining awareness of their own body and how it moves. You don't really understand how everything moves because it's so automatic for us, but when someone with a stroke, they lose that ability, it's almost like it's learning a completely different language that's, you know, not from this earth. It's not something that we learn. But one of the big things that I like to do is a lot of single limb exercises, and I focus a lot on single limb, and everything is gearing towards being able to get the patient to ambulate better, because a lot of the time when you're ambulating after the initial contact, you are on a single limb for a specific amount of time until your other limb or leg touches the ground again. The other thing that I really focus on is core stabilizing, trunk stabilization. That's with laying down exercises, trying to get the core to strengthen so that the patient can just understand their body a lot better. A lot of it is also just the mental connection with the body, being able to find that movement with their mind and to make that muscle engage even more with them. So I really focus on helping and guiding the patient to understand what I want them to feel while we're doing that specific movement or exercise. And then with the standing balance, a lot of eyes open, eyes closed, just kind of challenging the patient as much as we can, even for population, but specifically for stroke too, because the tendency is to ignore the weaker side of the body. So it's very important to try to weight shift to the opposite side and work from the side that's not really functioning properly, so that we can improve proprioception in the joints. And another tool that I use is just the neuromuscular connection, and just, again, really emphasizing on teaching the patient exactly what they need to feel and trying to get them to describe to me how that muscle feels throughout the treatment. And so one of the things with stroke too and the body is, depending on, it's very complicated, but depending on the specific part of the brain that was affected, the specific movements are not being able to function, or the energy doesn't spark to the muscle from the brain. And so what I'm trying to help guide the patient is to try to find inside them how they can recreate that energy, or how they can recreate and channel that energy into creating that movement that I'm trying to get them to do. And Dr. Fu had presented the idea to me about working with the Eastern and Western medicine together, which that was something I had not really done. But with combining them together at the same time, we really saw a lot of improvement with mobility, functionality. I can really say that using acupuncture as another tool, but with physical therapy specifically, it really shows a lot of improvement. It's something very different, and I feel like a lot more stroke survivors can benefit from that if they have that available to them, that option. Another thing that I really like to do is have the patient use a pen or some kind of a writing tool, whether it's a marker, and to try to, even if you can't get a letter out, just try to write something or to draw something. The connection from the brain to specifically the intrinsic muscles of the fingers, that's very challenging, and it could be very exhausting. But by consistently practicing and repeating that I've seen a lot of improvement each time. So it's all about consistency, really. But a lot of this is, it almost felt like it was set up from what I'm used to, and then working in conjunction with the acupuncture that Dr. Fu is doing, I feel like things were speeding up a little bit quicker and the process was improving a lot better than if it was just me alone, even though there are other modalities too, but I feel like acupuncture really just kind of works in a very different way and about the energy and all of that connection. Another thing I will have the patient do is to tie up the moving arm. So let's say they are presenting with weakness or spasticity on the left side. I would have them tie up or tie the leg and tie the arm away and just focus on trying to do as much movement as they can with the affected side, whether that's trying to paint or again, write something. So, but overall, I believe that acupuncture and physical therapy in conjunction really help to make the results show up a lot quicker. So it's pretty exciting to be able to combine these two tools from other sides of the world.
Great. That's all?
Yeah, unless there are any questions or
Great. I want to show you the Star did the very great job. I will share you a little bit the movement she did. So let us see. This is she did. We even, you see his head and even have the needle in the head. Then we continue doing things.
the video does not show up on my side.
Yeah, no video.
Oh, okay. I will show you. I'm sorry. Technically, it's how about right now?
Yes. Okay, now I see it.
You see, this is she tri-stable. He's the posture, and we put the needles in the patient's head, and we did a lot of job. And let me find it one video to do it. Okay. You see, this exercise with needles, the patients have much more confidence. They can raise up the hands. Before, he even cannot move at all. So that's why he's very happy.
Wonderful. Well,
and also opening is more harder. And he beginning the opening with the fingers. So his whole family is very excited. You see, the beginning opening. That's regular. We need to try our best by themselves, the opening. But right now, it's opening, it's better.
Yeah, the spasticity had decreased a lot more from other patients that I've worked with, but also even just ambulating. This specific patient, we were able to get him to start ambulating without a cane in a pretty short amount of time. So even without the cane, but I would standby assist. I didn't recommend it for the family, but to really gain his confidence and to improve his balance a lot better. And all of this was done with the needles in the head. So that's why I really feel like I've seen a more rapid improvement compared to other patients that I've had who presented similar spasticity or weaknesses.
Well, Dr. Starr, thank you so much for sharing your clinical case here, and especially working at school. I think this is a great case study. And if you're acupuncturist, reach out to your your PTs and the family physicians, and try to work with them as a team, as you can see, by combining both Western medicine, traditional physical rehab, with traditional Chinese medicine, especially acupuncture in this case, and we can help patients recover much faster. So thank you for sharing that case, Dr. Starr. Okay, Dr. Fu, let's move on to the next presenter.
Thank you, the Star. I'm so happy working with you. And right now, I will very happy introduce my presentation today. Actually, I always have one thinking thing. We need the promotion, some of the special technique for American. So this is my turn, right? So everybody already know me, so we don't need to introduce.
Great.
So I already stay here about 3 days. We still have 3 days to go. So right now, I would like to report to everybody. That's my honor to share my experience with the stroke. And in my experience, for the stroke, it's this presentation. I feel exercise with acupuncture. That's the most, and Chinese medical treatment. It's very work with a stroke person. Basically, the West doctor after the emergency room, they almost can do anything, almost. So they only made patients doing the physical therapy or OT or something. They just basically just try get back the functions. But our tradition in the China or in the Asian place, everybody know the stroke. If you have a stroke, you have to have the acupuncture because they already have the thousands, millions of case already. This time we invited the Dr. Shi Xuemin. He has a 2 million case about the stroke, many years, of course. And they did a lot of research. They find it. They can rebuild up the circulation with the brain, with the acupuncture. That's really helps the people get back the function. And they did some special technique, standard. Then that will works better. That is basically like that. They did this type of job already. So that's why I always thinking, this is the same technique. This is our same global world. So we should push this, tell more people about Chinese medicine. Acupuncture really help with the stroke. So from my side, I will see the exercise with the treatment. That's the most effect. Okay, there's some different exercise that have a lot, but one exercise most important I feel everybody can do. It's a squeeze bottom. That's helps people, stroke person, anybody, you can sit down, lay down, or you even anywhere cannot move, only move your eyes, you can try doing this. This squeeze your bottom, that can increase your energy. Everybody knows the yin and yang balance, the body feeling the more comfortable. This is in front, it's a yin meridian, back the yang meridian in the middle. This is called small circle. Then and do small circle. So with this squeeze bottom, when you tie your butt, squeeze bottom and raise your bottom, you can feel a little energy raise up your body, because every day we stand moving, everything drop down, but you squeeze back, that will increase the energy, especially you with the mind control, like the in, out, in, out, in, out, like this doing the 20, 25 and 30. For anyone, it's very good. Even the stroke person, they still can do this. If cannot do this, he almost dying. Okay, so this is basically the exercise I want to introduce. Of course, anything, because stroke, most people have the high blood pressure or the liver out of balance or kidney out of balance. So we can do the exercise for the liver. Basically, like the 6 words for the different organs, it's work too. If he can talk, then even he cannot talk, he can make the qi throw like that talk. The xu is for the liver, like this. Get energy from the natural. You use your hands. You even can follow me. Then put in your right side, this your liver. Then read the words. Xu. Then grab bad sense, get out your body. Use the energy, balance your body. That's important. It's peaceful, the stroke person, because
Stroke person, they panic and they scared. They need something peace for them. Then they have the chance get back. So that's important. That is one of the, also this help you the high blood pressure drop a little bit more too. So that's very important. Also, another one is a spleen important. Remember this your rep in here. Around your rep, a lot of people have diabetes, have the hard to lose weight. A lot of people have the feeling lazy, feeling slow, feeling tired. This is the spleen for Chinese medicine. So most important, you can often massage, follow your rep like this, or you read the words who, that's help your stomach spleen, like the who. Especially for the diabetes person, use the 2 fingers from your this bone to the belly button, the middle, you tap, like wake up your pancreas. Deep inside it's a pancreas, like the wake up, wake up, wake up, wake up, wake up, mind, think about it. They can wake up your pancreas and doing massage and doing the stretch, 调理脾胃虚单举 inhale, exhale. Other side, breathe in, breathe out. That's all it's help you. But of course, stroke person depends on how bad he has. If this is a for health person, you can do it. Stroke person, you just try doing whatever you can. Especially have one sense, you can do it too. You can try, put your hands like this. Tiger palm, tiger mouse, tiger claw, with the fist. Then use a little power, hold the fist. Use more power, hold the fist. Use all the power, tie your whole body. Then release. You can feel blood flowing. If you're doing this, that's already increase your circulation, help your body. Of course, they may be one side doesn't work, but they can try it. If they slowly try it, that's always is good exercise. That's traditional Chinese and the most simple exercise for every patient if they can basically move. I think the most important is they can hold somewhere. They can hold somewhere, stand. That is a good exercise. This is just we did. This just yesterday I take picture in here, put in. I don't have time made my PPT because I'm working every day very hard. I'm sorry too quickly, but I try my best. Okay, this knowledge everybody knows. The stroke have 2 types. One type is a blood vessel popped, or another type is be blocked. So actually 2 types, all the principle is the same. Coming from the blood vessel, it's not flexible, lose it. And the inside have too much sense, maybe block, maybe the pop. That's the same problem. So that's why you need to pay attention, release your stress, and basically, especially when you're made of light, you wake up, you better quickly going down like this. That's will make you maybe the very easy to get the stroke because your high blood pressure person, the pressure made more pressure in the brain, the parts, the blood vessel may be popped. And also important, a lot of people get stroke from you go to restroom. Okay, you get stroke. So slowly, please hold a little bit, smooth to do it. If you have constipation, you have to eat more the fiber, eat more water, and eat more some the vegetable, important. That's why the food for the everybody health important. So you need to pay attention your food, okay? So because even stroke person, first priority, the job, they call the ready block you, don't get stroke again. That's the first the mission. That's most important. You better not get again. So how can do that? Watch your blood pressure. That's most important. Anything, even exercise, not over it. But you need a lot of time, go to the limit. How long you need the exercise? For our experience, 6 hours. Lot means all the time. 6 hours, repeat, something you used to it, they can bring back your memory. They can reconnect the brain. That's important. Okay, for my experience, it is a stroke. Most important, it's earlier to touch the patients. That's very difficult in American. That's why I want to let more doctor knows, because if we can earlier meet the patients, most important is the first 3 hours. First 3 hours, if you did right, you maybe don't get any symptoms left. How you know you have the stroke? You maybe have the stroke. The 3 principle, the simple test. First one, you hold your 2 hands like this, hold 1 piece of paper. If you try hold 1 piece of paper the even, you cannot. You think you even, but your hands like this, you face a mirror, or you cannot hold the paper. You may already have the stroke. That's the first one. Second, you face the mirror. You will see your face. If one side face different with the other side, you may already have stroke. The third, you will find it this person talk, it's strange, like the he have stroke a lot of time, or very close to a stroke. Remember, before this stroke happen, always have a lot of singular. You just never pay attention. If you pay attention, watch your body, you find it some strange, first think about it, why, ask a doctor, tell them, they can tell you. A lot of the small stroke, you even don't know it, they already happen. Example, when you're feeling very tired at the afternoon, you go to the sleep. When you just wake up, you find it, or you that day, you find it, you move a little strange, but you go to rest, okay, they come back like normal. Okay, you forget it. Maybe you already have small stroke in the inside. When you do the MRI, they can show him before you already have small stroke. You think about it, oh, maybe that day I feeling like that. Yes, that is true. So better you carefully watch your brain or watch yourself. That's why you need the often test your blood pressure and try not too stressful. Like me, this few days stressful, or phone this, that, or too much, and super tired because the whole day the job from the morning to, that's no good. I have to exercise right now. Then we can stretch a little bit, make blood flowing, it's better. Okay, so second, important, when you meet people stroke, don't panic. First, make his stable, not lay down totally. You need make the people lay down and keep a little high with the head, or go to the side. Don't want the chunk made worse. So face the side. Then this moment, grab anything, maybe the knife, maybe the needle, anything. First, poke, 10 fingers, made a little bleeding, and poke even temple, even the top with the ear. Don't worry about of course, take off the responsibility, your family, no problem. Don't worry, that will not kill him, that save his life. Because the people, even you take out like this big cup, the blood, you're still alive, very healthy, don't worry at all. But you poked 2 ways. One, it's made you nerve change, oh, painful. They translate the nerve, the tension. Second, they release the pressure very quickly with the brain. So they drop down. The body like the machine. If you don't let them broke, they go to the limited, you bring back, they still can running. But if you only keep doing that, keep doing whatever you can, one day they will broke on the road, that's for sure. So that's a way I really like tell everybody. So that's moment here. If you're scared with the bleeding, least you use the fingers in the middle, very hard press. Wait, he's crying, a little crying, wake up him, that's really help him. Don't worry, he will shoot you, okay? That will not shoot you, just use the fingers. That save his life. The time, most important, here have it. That's why I always tell patients, if you get a stroke, please come into me earliest you can. I know you may be in the hospital, have to stay a few days or even 10 days. Then you come out. First things, go to the acupuncturist. Or if you trust me, first things you call evidence, line 11, same time you call me. and I tell you how to do it, even I cannot arrive there. If I arrive there, I maybe save you back, don't have any symptoms. That's very important. Dr. Fu, the words, remember. That is really a lot of people showing like that. And after 10 days to 1 month, that's one important time. Inside 1 month, a lot of things, even you don't treat him, he will naturally get back a lot. The beginning with 20 days, the muscle beginning tie, a little cray, you better treat very right. After you get stroke, first things you don't want them crying like this, you better use some special tool, made his hands keep the opening. Otherwise, if they already very tight like this, then it's hard to change back. But if you keep opening and every day often moving, keep the soft, every joint moves laterally, that's important. Lot is a massage, something, it always help a little bit. Outside the 1 month, inside the 3 months, still very important. They have big chance can help you get back to the health most. So that is a 1 month to the 3 months. That's a lot of time. So call the acupuncturist. This almost the West doctor already cannot help you too much. They already made you safe. That's it. The job done. Then you need to add up whatever they tell you do. We never against the MD. We just want to add up some acupuncture in the side. You will see you improve for sure much better than other people. Otherwise, you maybe whole life never get back the lateral move or the heels like that. Then 3 months to 6 months important too. Because the research find it most recovering inside the 6 months. If you over 6 months to the 1 year, they still a little better. Over 1 year, almost never change. But still have special case with the 1 or 2 years, 3 years, they still change back a lot from acupuncture. Why? I think because they never did acupuncture before. If they already did acupuncture before, that's very hard happen. But if they never did, when you first time after 1 year, 2 years did acupuncture, because totally the signal sent to the brain and they reacted and they change the circulation from the side. Maybe they help you remember a lot of the memory and you get active. So that's how possible. A lot of cases like that. So whatever acupuncture always the best for the stroke. That's why I really want to talk about this. And a lot of the pay attention part, most easy happened. It's a foot will go inside. And a lot of time, the shoulder, you have to hold it. Why? Because the muscle, no power. So they drop down. This is very heavy. So they will make the shoulder drop down to half. So sleep, the posture, everything have the specialty. This part totally same like the PT. And a lot of people cannot talk. That's more important. You have to see the doctor with the acupuncturist. And also you need the sign release form. Made the doctor very brave can treat you because Americans still cannot do in the bleeding treatment, but bleeding treatment for the stroke, very good. If you sign it, you say, oh, I take off all the responsibility, let acupuncturist do it, then he can do for you. Doing what? Help you get back the talk. Like yesterday, a lot of people tell you, we have a lot of way, like yesterday, the Dr. Chen told about they put the needles here, side. Oh, that's a Dr. Guo talk about 1 needle from middle, go inside. 1 needle from this side from the tongue. They can help active your tongue. Basically, you need the strong, the singular go to the tongue. Maybe they come back. And another doctor told us from here under, take 1 needle, go to that side, 1 needle, go to that side, then put the electric on it and let patients open the mouth like this, Dr. Chen. Made the electric moving, they can help them come back. Also, don't forget, we have special technique with the scholar acupuncture, the head acupuncture. The Dr. Zhao Shunfa, he found it in my age. I'm 71. I'm from the born at the 1971. He found this in the 1971. In the body have a lot of the singular. You see, this is everybody Chinese doctor knows because we study in China with a book in the college. This have the special different active place. Example, like you're talking, have the space for the talking. You see here, it's a memory. Here it's a, they have the exactly the already researched very clear. If you put needles there, then they can help you some. Of course, have a lot of different style, but all is basically on this. So hard and soft the paraneus. A lot of people, like I said, most you see the stroke person like this. They very tight and the move is very difficult. That is a hard one. That is a when you, because the tension with the muscles, with the skins, they very tight, very difficult. Even you did acupuncture or massage, release that, but the second day they get back again. That's very hard. So best way, like I said, from first day, you try, make the patients don't like that. Of course, something you still cannot control, but at least do your best. Keep his style right, keep his everyday moving his every joint, and the patients cannot lazy. If you don't catch the first 6 months, you will whole life almost like that. So that is why this is a totally have to tell patients. Not is a doctor good or doctor bad, depends on the which time the doctor go in, take care of your case. Okay, like the talk have especially bleeding. You hold the tongue, then put some needles under this, they made you bleed. If the blood come out, they release it. A lot of time you talk immediately better. But need doing earlier and you can. And the doctor sees the acupuncture, it's more, it goes in meridian. Example, he doing the renzhong, like I said, and he doing the jiquan, he doing the lei guan here, and he doing the zhu sanli special. Zhu sanli you can do in different direction, and the san yin jiao, the 3 meridian cross there, you can do in different direction. So have a lot of special technique. That is one of them. It's very good. For my personal experience, I most like doing Shou Wu Li in here, because I feel that if you can doing that, this one, this point, Shou Wu Li, I want to show you a little bit with the video, then you can see what's how to do it that. Okay, so if you can see that, we will see here. This is a Shou Wu Li. Okay, I hope you can see it. I will share screen and share with the sound. Okay, everybody can see?
其中的一个主要是防止它的那个蜷缩的，你看是不是？
needles in,
对，
muscle moving.
是吧？很强啊。
Do you see it?
对吧？
When you can do it like this, the very strong singular can return back to the brain, so they can big chance can get back the brain with the muscle and the nerve reconnect. And the hands, you see, and also another one, it's like this. Like I said, a lot of one is here. 手三阳落. It's here. In the middle, this is not good picture, but I want to tell you the 4 fingers up in the rest. In the middle, if you go to different direction, they can transfer to your fingers, big finger, little finger, whatever you control it. We have a lot of picture and record. I don't have time to share you. If you want, you can go to our website. I will put this in there. Our website, we already showing a lot of times. So we will continue with the share screen with my PPT. We will continue finish this. You have the 10 minutes, so I will try my best earlier. So everybody can see the PPT, right? So because 5 o'clock we have form here, very quickly we will change. You see, this is a acupuncture with PT work very well. And the leg, where is? I already talked to here, I don't have time. And the 造海 is very important too, because they can change them the mind, make them because the Guo Lao see the depression, even the 造海 can help that. And the most important is scar needles, the head needle. It's very important. I already talked one time, because this already 50 years of technique and also help everybody. Okay, and also have a lot of different style after the 焦顺发. But everything depends based on his find. So it's good. They find it a different person, like Liu Wei have one person in this head like that. Like Zhu Minqing find 3 person in the head, but doesn't matter. I use everything. I use whatever work. Because you treat this type person almost every day. You need to change the singular sent to the body. That will help them slowly change. Because the people, the singular, cannot take every time repeat, the acupuncture point will be the tired. So we have to change. That's why we have 10 minutes. We will begin in the form. And the Dong acupuncture very good too. So Dong acupuncture is here. Dong acupuncture it's they have from the Zhen Tai Lin, and he have a lot of, and use Chinese medicine, Angong Liu Huang Wan is very good one. Chinese many years before they already found it. It's most important the herb. That's Angong Liu Huang Wan, but too expensive. I use the Liu Huang Qinxin Wan. A lot of times they work too. Okay. Save to say it for you and yeah. Then it's a marks. It's very important too. Okay, and the socks, the cup, it's important. Everything is help. You made the bleeding and use the cupping. That's always work too. So we have a lot of the Chinese way. Basically, I want to tell you, they have a lot of different way can help the stroke. But American people don't know it. That's why we need every doctor try your best. Tell them, hey, MD, you have to send the stroke person to me because you cannot doing too much anymore after you take care of the emergency. Okay, so everybody very loud tell them. Then maybe one day they will hear about it. And a smart person already beginning take our acupuncture. Honestly, I work for the high level patients many years. I find the principle is the most high level the people, they long time ago, they beginning like the lateral treatment. But the level not too high, the person, they still only understand go to the emergency room, take care of the antibiotic, get the surgery only. That is a very not fair. We need to tell them. Most smart people, because they even more than Chinese person don't like the West, the hospital, because they know that is not good for them, the body. So that is why this is I like today share you about the stroke. So I think everybody should tell them, if you help the stroke, if you get stroke or you almost get stroke, please find it acupuncturist, not me, just nearby you, the acupuncturist, because you did a lot of treatment, not only one time. This, if you don't do that, of course, you will keep like that whole life. Okay. So I hope not scare you. I'm sorry, but that is true. If I'm so happy and my honor to be invited here. Actually, I have the 7 minutes still, so we will opening the questions. If you guys have any question, I will like the answer too. But I think I already talked very clear. If you met the stroke, please find it the Chinese doctor. At least he understand this stroke will help you. They will help you那个 Jennifer 看一看那个郑建华老师在线上没有把他拉进来。Sorry, because I organized so that I have something to do. We are almost ready for the firm. Right now, I want to tell you, we have a lot of different way to treat it. I like one, it's a bleeding treatment. One, it's a technique, keep the posture. One, it's important, it's work with the PT together, OT together, with the leaders. That's regular, it's a much help than you don't use needles, okay? So it's my experience. And the earlier you can, try find it a doctor, acupuncturist, try take care of your stroke. That's really save your life because you want quality life. Don't waste it. That's most important. The first 6 months, you lay down the bed, you lay there by yourself. You have the whole life to sleep. Don't waste it this half year. That's your most important time. I really want to remind you like that. So right now, I want the opening the question for everybody. If you have any questions, then we will I will be very happy to take care of that.
Well, Dr. Fu, while we're waiting for questions, I have to say I want to thank you for sharing unselfishly your clinical experience. I think public education to our patients and to primary care physicians are vital for the health and recovery of our stroke patients. And you have mentioned few timelines, first 3 days and first 3 months. And did you know throughout Chinese history, traditional Chinese doctors, they do not share their expertise and their formulas to anyone outside their family. And even within their family, they only pass their knowledge to sons, not to daughters. But here we have Dr. Fu and almost 100 doctors from around the world and sharing their expertise unselfishly to our general public and to other clinicians. So I want to thank you, all of you, for sharing your expertise with us. So let's open for the questions. Any questions for stroke patients and any specific techniques? Okay, all right, Dr. Fu. I think we should move forward. I don't see any questions coming in.
Okay, great. We move forward. So we save a little time for our frame. The frame, 我们讲一下，我讲中文，你讲英文啊。剩下的我们全英文的就不用翻译了，但是开头这个题目翻译一下。Okay. So right now we will doing the 我们将要进行一个校长讲这个论坛叫什么
？That is the public
讲中文。
这是一个普及教育和求医导向。
How about voice? Voice okay or not? Ruth, we try again.
I think we can hear you, Dr. Wang. Okay.
Everybody can hear clear, right?
Yeah, not quite clear, but I think we can pick up some of most of the Dr. Wang's speech. And now, actually, we're going live right in California, and we have a special forum, and chaired by Dr. Wang, the president of the World Integrative Medicine. And now the forum is focusing on the public education.
你那边看到吧？主播就是
好 ，Dr. Wang， 请您继续。
主播出去，还有一台电脑在那儿，你可以到那边去控制。
王主席，请您继续。
Yeah, Luz. Okay. Okay.
你讲
OK. Jennifer， 没灯了。
没有灯就算了，没认识啊，那个灯可能没电。对。好，我们现在呢，来到了一个现场，这里是我们国际医药大学的会议室啊。首先呢，我给大家介绍一下我们国际医药大学的校长，也是我们 世界整合医学学会联合会的主席王英秋主席 Rose， 请翻译一下。
And now we're actually on location in California at the International College of Traditional Chinese Medicine. And in front of you, we have the president of the university, Dr. Wang Yingqiu. He's also the founder and also the chairman of the World Integrated Congress.
大家好。
另外呢，我也想首先介绍一下网上的我们这一位陆彪老师，陆彪教授也已经在网上了。好，我们就不再讲中文了，我们就全部用英文，这样节约时间，每一个人很短的时间。Okay, so from the Dr. Wang, you beginning. What do you want to talk about it?
Okay, okay, everybody. Hello, how are you? And I'm Yingqiu Wang. Today's forum is for public education and the patient the direction, because some people don't know how to learn acupuncture and Chinese medicine, and many people they have the problem of the health, but they don't know how to see doctor. What kind of doctor can help them? And many people don't know this. That's why today this forum is public education and for patient, they get the patient how to see doctor. That's all. That today is our meeting. I introduce first this one is Peter. He is the student, current student. This one is Dr. Liu. Is our school professor and
very famous doctor.
Yeah, very famous doctor. And this one is the Jack Fu, as you know. He is the professor and the doctor of school, dean of the continuing education institute. This one is the professor, famous professor, Dr. Yajin Wang, and he's chief specialist doctor. And this one is the Dr. Yang Liyin. He's our graduate student and he's alumni. She open clinic is very successful and a very good appearance. Last one is the George, Dr. Lo. He's the patient. He gets a lot of benefit from the acupuncture and Chinese medicine. He wants to share with us. Okay, that's all. Okay, Dr. Fu, do you want first talk?
No, I think the other people. If you want me to talk, it's okay too. Yeah, this year, because last year we did the number 5, the World Congress of the Integrative Medicine, and also we did the 13 hours from right now to tomorrow morning. We never stop, and everybody very tired. Talk one sense, deafness and ear ringing and tinnitus. Okay, so after that, we really help a lot of people, because all the world doctor we talk about this deafness and tinnitus, because everybody know tinnitus and deafness is very hard to fix it, but we are really very lucky. We find it the way to help everybody improve the health. So that's why I will very happy I am the very lucky one. It's after that I did the one patient just the one time, and he is totally get back. He's 10 years he cannot listening, but after my one-time treatment, she's so happy from my treatment. He get back the hearing. So she's even crying in front of everybody. I think everybody will do that. So that is I want to share my experience I just want to see, not is my techniques is good. If you really listening to the seminar, you really listening to the Congress, and you have chance, same, only one time help to the patients like that. So right now, I like to share the screen with you, that you see this case. I will very happy share the screen with you with this case. Okay, so I think this is the most simple way to show you. Wait. Sorry, I have too much things here. Okay. I maybe forget share the sound. That's a lot of job to do, but we will try our best. We are not professional, we are just the doctors. Okay. So that's it. Okay.
Stuff for 7 years. For 7 years. And when I talked to the neurosurgeon about what you did and how much pain you got me out of, she was very impressed.
Thank you so much. I tell you, use this problem because looks like in the lower the leg, but they control in the lower back. That's why we use special needle, special technique to release that. That's very few people do it in American.
Yeah.
In China, we're already doing 40 years. That's called flat needle. A little painful, but it is can accept, right?
Yeah. No, it was incredible.
When I came to you, Dr. Fu, I didn't have any energy and I didn't have any desire to live. And my stomach issue was so bad that I couldn't eat anything. Not literally, not even drinking water was giving me problem. And then I was feeling these little hardness all over my stomach. I was feeling suffocated, especially at night. I couldn't sleep, and severe anxiety because of it. And then a lot of pressure to the bottom. Oh my God, I cannot explain it. It was so bad. I literally thought I was dying. And then you offered me to come home, and I really appreciate it because I was so fatigued. I couldn't even lift my finger. So, and I was trying.
Coronavirus, this moment, I'm doing a lot of hospital
Yes.
because that's more safe for me
And for the
more
patient.
safe for you.
Actually, even if it wasn't coronavirus, because I was so fatigued, when I'm like, holy oh my God, excuse my language, but holy moly, life is beautiful. So much energy. I get up at 7 o'clock in the morning and I'm running around. So now
That's called depression.
Yes, I was, and I don't know how acupuncture can fix depression.
They balance you the meridian, that's why they help me. That's the acupuncture not only help the pain, of course they help me a lot, but they slowly change your inside, but need a little patience. That's why we did the 3 sessions, each one just 6 times, not too
Yes.
much actually, but it is will help everybody.
I really appreciate it because I'm happy, I'm energetic. Just after a month, it's unbelievable because for past 3 years, I kept going from one doctor to another doctor to another doctor, and I didn't know what to do. So I thought I had cancer.
So basically, it's my training. The principle is try build up her chi and the balance inside. Make her liver come back balance and kidney come back balance, spleen come back balance. Then she will feeling opening. Then the mind will change. The pressure will go away. But of course, maybe not very stable. You need to continue the trainer and also will eat healthy and do some sports, especially internal power. Tai Chi and Qigong is the best choice.
Kiana Farzad, and I injured my back and my neck when I was snowboarding, and also when I was in yoga doing a headstand. I fell the wrong way. So
How long did you play?
3 weeks.
Until today, you just beginning of this.
Yeah, it was more of like a spasm that you can't control. Now it's just sore. of what we did. But it's not so much where I can't breathe. My breathing is better.
I was born with my backbone fused, fifth and sixth things connected, so I couldn't turn my head very far. But after the 3 needles, I'm able somehow to have greater turning of my neck. It's amazing.
Came in and I was having tremendous pain in my left neck, and Master Fu released it in a way that I've never experienced before. He actually physically moved the bone where I could feel it, and immediately within 5 seconds I felt release and I was free of pain. It was incredible.
Okay, after the acupuncture treatment and provider treatment, most we compare what you
This
hear.
one is
So,
my patient,
cover
10
this
years.
here, okay?
I first time met her, and very lucky, second day with last year we Congress. And I just learning a lot of technique from the
That's why we do
and I
this.
tried
Yesterday we
something
talked
like the
13
earphone,
hours.
go in,
That's why I
hold
want to
the
see.
ear and go in slowly,
It's the new
and the
year last
剑耳穴
tomorrow,
and
so you
the
have hope already.
分离穴 3 needles.
Okay.
I did that
You happy?
I'm very happy.
one time.
Started
10 years she cannot hear. I'm lucky. That's we hope every day. It is for the pain. We every day made magic. Honestly, every doctor here, everybody made magic. Compare with the rest of the doctor, really, it's for the technique for the pain. Any type of pain, we have the 10 week can treat you immediately release. So coming to us. I think whatever language cannot showing really the people doing like that. So that's why I
did this small video before something did for me. I want to see not is my technique good just because acupuncture. Every doctor, if you learning our Congress, if you really spend time on it, study, like Dr. Liu, every day, make amazing. So thank you everybody. That's my presentation. So next one maybe the Dr. Wang. Dr. Wang. Wang Liezhen, yes, that is a very high level of doctor. Thank you so much. Yeah, Professor Wang, please. That's your turn to talk about it.
Okay.
Everybody can hear. That's very good. We'll try before.
I'm a professor of University of Israel Medicine.
They say like that.
In this medical school to teach a lot of students to learn TCM. Especially in our clinic, I teach our students to use acupuncture, massage, and herbal medicine to treat a lot of different diseases.
Yes. Yeah. Everybody knows him.
Yeah.
World famous.
In our clinic, usually more than 50% have neck, back, lower back, hip, leg, head. Yeah.
That's simple.
Yeah. Because this disease for our very easy to do treatment, such as 颈椎病、胸腰椎小关节紊乱、肩关节脱位、髋关节脱位，这个
Any types of spine problem. For us, it's a very small case, especially for one.
Yeah, hernia disc, very easy. Our patient usually treat for 3, 4, 5 treatment, and that's getting better. Otherwise, we treat a lot of very difficult disease, such as 老慢支、肺纤维化、肺心
That's
病
difficult case.
心衰、肝功能衰竭、肾衰。This year, I treat a 肾功能衰竭。The result is very, very good. Such as 冠心病、高心、 糖尿病心，各种 very difficult to treatment disease 为改进 very good result.
Very good. Thank you, Dr. Wang. Yeah. So maybe next one, let us give the chance the online Dr. Lu. The Dr. Lu is a very famous doctor too, and he's online already. So Dr. Lu, that's your turn. Please say something about acupuncture.
Thank you very much for Jack Fu giving me this great honor to communicate and talk to everyone, all the colleagues. So people here, it's all the world famous doctors. I learned a lot from last few days, 3 days. So I just want to share the one experience because now in China, it's opened up. People get a lot of, they get a lot of sickness. Particularly patient has a fever and a cough. Los Angeles too, we are last few weeks, we had so many patients had whether it's a COVID or Omicron or just regular flu, but the patient have a severe, sometimes fever in a few days, and then the cough severely. So what we can do for the acupuncture to treat, acupuncture works for the cough, it's great. I want to share, some experience. Just a few weeks ago, I shared this on the WeChat. One of the patient, it's around the 75, 77, 76, the woman, she lived in San Francisco. She came over here to visit her family. She has emphysema. She has a very hard time to breathing, and she used the steroid for a long time, and she has to use the oxygen. She's very difficult to breathe, and also coughing constantly, nonstop. So first time when I saw her, she has a hard time to walk into the clinic and walk into my office from waiting room to my office. And then I, try to ask her questions doing the history intake. She's nonstop coughing and keep on coughing. She has a hard time to breathe. Even just walk a few steps, she gets just out of the breath. So after I got a clear intake, I bring her to the room and to have her laying down. And even she get on the table, she become to cough and even worse. And I have to pop up with a pillow because she cannot lay flat. And so I only used 2 points. 1 point is long 5 on both sides. And another point is ear point for the 平喘, for the cough right here. So the 2 points, by the long 5, I have to searching for the point to get the muscle to jump on the both sides. And then I connect to the electrical device because without the muscle to react, twitching, connect to electrical device never work. If anything change, the patient get worse. But if we got this muscle jump, and it means right in the meridian, and connect to the electrical device, the electricity will go through the meridian and opens up the lung channel. So I can hear after I treated her, because only 2 points, it take me only 2-3 minutes, and I walk out of the room. In the hallway, I'm walking around, I still hear she's coughing nonstop. After a few minutes, 5-10 minutes, her cough stops. And I left her for good 45 minutes, 45-50 minutes. And I walked in, her color looks better. She's breathing very calm. She's doing better. I took the needle off because it's emphysema. It's not just the regular cough. She had this for years, for a long time. And then I prescribed some herbs for her, and she took it, and she came back again next day. Because I treated her a few days in a row. She only stayed for maybe 1 week, and she has to go back to the San Francisco. She feels so much better. I videoed, but I didn't put it in a computer in my cell phone. She was very happy. She saw the hope, and she brought a lot of herbs back there. And I called her since then. She was fine. That's the one case. Another case is the patient had a cough, severe cough for 1 month, and she described like her lung is going to cough up. She said her lung is going to burst or going to. She living in the urban. She take her, close to 2 hours. Non-traffic, it's 1 hour. Sometimes, LA always has traffic. Her husband drove her to the clinic. That was maybe 3 weeks, a month ago. And she had this for 1 month. She took everything, cough therapy, everything, because she's Chinese. She know a lot of herbs. She using some clear heat, clear phlegm decoction, everything. But non-stop coughing. And again, when I talk to her, she's keep on coughing. And then I treat her, bring her to the room, and I treat her for still the same point, lung 5, and both sides, one side I got a very good jump. The other side, I could not get the jump. So I decided use the lung 10. Lung 10 is a little bit painful, hand is more sensitive. But if lung 5, I can't get the jump, the good jump chi, I have to do the lung 10. And then I connect to the electrical device. And she, for about, I left her because she come so far. I left her for 1 hour. She was so much better. Again, just a few minutes later, cough stops. And she was so happy. And, she took herbs. She was fine. And next week, she came back. I totally treated her twice. And the second time I treated her, she's fine. She's no more cough, everything. She's so happy. She wants to study Chinese medicine. I mean, she's young. She's 43 years old woman. She's IT, in IT industry. But she wants to study Chinese medicine. I said, oh, welcome. Of course, anyone wants. And so she's so happy. She write the article on her, on her WeChat 朋友圈. I copied. I share with.
Thank you.
I shared already in the WeChat. She was so happy. She said, all the drugs, everything, it's nothing. But she wasn't COVID. She wasn't COVID. She's, she had just regular flu. But they say that this year the flu, CDC said that this year the flu in the United States, it's the worst ever been more than 10 years. Regular flu, don't mention the COVID. So what I want to say, it's for the cough, acupuncture works terrific. In the past, sometimes I have to do the cupping, bleeding, gua sha. That works. But now I think I find that if I gotta go to jumping to connect with the electrical device, that works so much better. Instantly, the patient laying there, before we finish, the patient cough already stopped. That's what the patient said, needles in and the cough stopped. She was so happy. And another thing I really want to share for the colleague, for all my, the friend and the colleague, it's regularly as a standard treatment for the cough, we do, it's a clear phlegm. We use 燥湿化痰, 化痰止咳. That's a totally wrong approach. The cough, we cannot use the 燥湿化痰, this 陈皮半夏二陈 those, because cough, what are we looking for? When we treat a cough, what are we looking for? We're looking for the patient produce phlegm. Phlegm is thinner. A lot of the time, phlegm is very thick or dry. The patient also, the cough can be very violent. Because the purpose of the cough is a detox. It's to release the phlegm. So to detox, like a diarrhea, we have food poison, you gotta have a diarrhea. You stop the diarrhea.
Very good, Dr. Lu, very good. Thank you so much, Dr. Lu. Dr. Lu in the Los Angeles.
Yeah.
Okay, so right now, maybe we invite another person, another doctor.
Dr.
Yeah, Dr. Dahe Liu. So please, Dr. Liu, talk about it. Thank you.
Okay, very good. Thank you. Yeah.
Thank you, Dr. Lu. Nice to meet you. Dear friends and dear colleagues, nice to meet you in this conference. I'm Professor Dave Liu, and I involved and participate in TCM education for more than 40 years. And I'm teaching in TCM subjects and objects in several colleges and universities in United States. And even I visited a professor in Shanghai University of the TCM. So it's my honor to got the invitation from the Professor Wang, Dr. Wang Yingqiu, to share some experience with you for the education, this subject. So today I want to share my past experience for the public education. So even I involve a lot of the professional education and the continuing education, but I think the public education for our world is very important. I have, the thousand students. I always tell these students, you not only treat the patient, you also need education your patients. You also can open some public seminar. That's the good things for promote and TCM. So you not promote yourself. You not promote your team or your school. You should be promote the whole TCM. That's the more high level. It's good for everybody and for all of the TCM, the field. So when I practice in my clinic, I always spend a lot of time with communication with the patient. So not only treat it, I need to tell the patient why it works. That the patient understanding, they can refer more patient to you. Even I have many patients the first time, they never have acupuncture before, or some the young adults or the child athlete. I have many, child athlete, they got the sports injury. So they never have a TCM treatment before. They little bit strange or the scare. But after my demonstration and also communication with you and also with the education with them, usually they feel very comfortable and they accept the acupuncture. They also got the good results. Then also later they can also introduce the other friend to your clinic. So that's I think that the Dr. Wang
郑主
emphasized
席准备。
today is more for the public education, how to important. And for this conference, I think, I just share this experience. And also I suggest in China, if government can add the acupuncture theory or the TCM theory, the textbook for high school and for university textbook, that's the better, because I know if they got this kind of idea or the TCM theory in the young age level, and that will be help the understanding or accept the acupuncture and promote acupuncture TCM for us too. Thank you very much, and thank you, Dr. Fu, and my best friend, and thank you, Professor Wang, your invitation. Thank you, everybody.
Thank you, Dr. Liu. And
Thank you, Dr. Liu.
I think the next time, we hope you can share more experience. You treat the patient, because I saw you made a lot of amazing case, especially Dr. Wang. A lot of people think he will die. Then coming to us, they change. And especially Dr. Wang Yingqiu, he not only the president of the school, he's treat a lot of patients. Everybody every day see the patients. And right now, my honor to invite it from the Australia #1, the president with the Chinese Medicine, the association. So please, Dr. Chen, introduce yourself and please speak something about Australia.
Hi, everybody. How are you? So my name's Dr. Jack Zheng from Australia. Thank you very much for inviting me to have a short speech on this event. So thank you, Professor Wang and Professor Fu. It's my honor to have this chance to introduce TCM in Australia. Myself graduate from TCM University, Guizhou, since 1983. And then I work in Shenzhen Hospital with TCM. Also, I study herbal medicine in Sydney University from 2003 to 2005. And later on, I graduated from Guangzhou University for in integrative medicine for PhD degree. So actually, I practice TCM and acupuncture around 40 years. So people knows in Australia from 2000 in Victoria privacy, registered TCM and acupuncture with government. After 12 years, whole Australia country make a standard and registered as registered Chinese medicine practitioner and acupuncturist, and also herbal dispenser. So since that's the first Western country to register TCM and acupuncture. In Australia, so we strongly promote TCM to the major communities as we treat the patients. Lots of Western people, they haven't got any treatment with acupuncture and TCM. So for example, one patient, she's suffering from breast cancer, and she believes TCM will help. So she against the operation, against the chemotherapy and radiotherapy. She only used Chinese herbal medicine and acupuncture treatment.
叶老师最后一个。
And after 5 years, she have very good results only with herbal medicine. She's young woman, so she don't want to have operation, and she believes herbal medicine to give her a new life. At that time, 5 years ago, she was diagnosed with breast cancer, stage 4. It's a very serious case. And the doctors tell her about half year time left for her. So she can't believe. So she said, I will challenge myself and also challenge the medical system. And she come to my clinic to have some herbal medicine treatment. So since that, she continually used herbal medicine and acupuncture treatment. Also, she practiced Qigong and Tai Chi. And also we guide her to change her lifestyle. After that, until today, she's still very happy and very healthy living. So that's one typical case to showing TCM and acupuncture is a best medical service for the patients. So that's only one case, but we have many cases. We treat difficulty treated disease, even diabetes, cancer. Other cancer like breast cancer, lung cancer, bowel cancer, and prostate cancer as well. So, but today we don't have enough time. Only I share one single case to showing what we're doing, and the TCM will be service and benefit the people around the world. That's my speech. So thank you very much, Dr. Fu and Dr. Wang, to give me this chance to share my experience. Thank you.
Thank you, Dr. Jin. And I think here have the Bill Douglas, and he is the Tai Chi Day, the founder. The Bill Douglas, maybe you can see the 1 minute about the Tai Chi and Qigong. It's a promotion and research for the benefit for the body. Thank you.
Yes, thank you. Yes, through our 20 years of organizing World Tai Chi and Qigong Day, we've collected the science that has been coming out on mind-body practices, and at the same time that we teach at the University of Kansas Hospital. And so we see what you find when you look at the metadata is that somewhere between 70 and 85% of the health issues sending people to doctors are caused by stress, unmanaged stress. And so Neigong, sitting Qigong, Qigong, moving Qigong, Tai Chi, all these mind-body practices are some of the most effective stress management practices known to the planet. That's what the science is showing. And so every year on the last Saturday of April, we help local groups organize mass Tai Chi and Qigong events in hundreds of cities in over 80 countries all over the planet. And many of them get support from governments and universities. And what we do is we use these mass Tai Chi and Qigong events as an opportunity to get media attention, because the media likes to cover, especially Tai Chi. Tai Chi is very visual, very, very photographic. And then we have a medical research library at our website, which is worldtaichiday.org. But if you just Google World Tai Chi Day, it'll come right up, worldtaichiday.org, and you can get involved and organize events, and then also use the medical research that we provide on Tai Chi and Qigong so that you can share it with media, because we also help groups connect with media, local media, national media, and international media, to get exposure for the benefits of Tai Chi and Qigong, and then to use that media opportunity to educate the public about the science on Tai Chi and Qigong. And so there's never been a more important time in the history of the planet to expand the use of these Chinese health systems as there is today, right now. And one of the things that's come out of all of our gathering of the science is to create what's called the Global Transformation Project. And that's globaltransformationproject.org. And what it is it's a global effort to get mind-body practices like Tai Chi, Qigong, yoga, meditation, and mindfulness that all have a lot of science behind them to become part of public education worldwide. And so we're pushing for a United Nations resolution to advocate mind-body practices become a core part of public education worldwide. We're suggesting 1 hour a day from kindergarten through 12th grade. And in 12 years, you would dramatically reduce the health costs around the planet. And it would also reduce social costs as well. And so that's globaltransformationproject.org. And then also worldtaichiday.org to get involved in the global event to help educate the planet. And all Tai Chi and Qigong are all part of this. There's no divisions between different schools or different teachers or different countries or anything. It's just the global Tai Chi and Qigong family coming together on the last Saturday of April each year. And so we really look forward to working with the International Congress on Integrative Medicine because we want to promote the science that this organization really helps bring out to the public. And so we hope everybody will support the World Congress on Integrative Medicine's future programs and try to share their information with others so that they can grow the work that they're doing. It's very important.
Thank you so much. Bill, the next one we will ask our students, right?
The alumni.
Okay, so please.
Yeah.
Oh, okay.
Hi, everybody. My name is Li Yang. I'm the owner and the acupuncturist in Zen Acupuncture. I graduated in the University of East West. In here, I have to thank to Dr. Wang. So all the students in this school, we found our goal. I have to thanks to my ABC reader. It's my grandpa introduced me to study acupuncture. I have to really thanks to my mentor, Professor Wang Weizhen. Yeah, I have many cases. It's amazing when a person cannot get pregnant for many years, and then in our clinics, my mentor helped me, so he got pregnant in 2 months. So many cases, it's really impressed us. So thanks to our school, I found my goal. Hopefully, you're gonna find your goal in our school. If you right now you want to study, just come to our school. Come to University of East West. Thank you.
Thank you so much. So next one, please introduce yourself and.
Okay. Hello, everyone. My name is Jorge Doctolero or George Doctolero. I'm a patient of Dr. Jin-Q Wang, and I tell you, I cannot say enough about the way I was treated by Dr. Wang. See, what happened was, in my Western experience of being cured, one of the things that they seem to have forgotten is how to make me healthy. So when I was diagnosed with prostate cancer, they gave me a lot of options to take: hormone therapy, radiation therapy, chemotherapy, and all of them have side effects. While they were curing me, they punctured different parts of my body. As a result, a few years later, I suffered a severe back pain. And I looked so thin, I could hardly move. When I was looking for the best doctor in town, traditional Chinese medicine doctor, I saw Dr. Wang's job description.
Please, everybody, turn on the video.
And
we will take group picture. I'm sorry.
Okay. He was described as somebody who takes care of the most difficult cases, and said, so I said, so this is it. And so the first time I came to him, words are very, very important. And this is the one thing that he told me that I've never heard from other people before. I will take care of you. And there was no rush. He gave me acupuncture, a little bit of chiropractic movement, and some qigong practices, and some herbal treatments. And slowly, my PSA level went down from 578 to less than 20 and to almost 10. And it remained that way, and I've been able to move around, dance, jog, hike, that I've never been able to do before. And we also believe in a common science called quantum leap, wherein if you think positively, it will happen. And so when I looked at myself in the mirror, I looked so gaunt, I looked so sick. So I asked Dr. Wang, can you make me look healthy? And in certain treatment,
1 minute.
Certain treatment, he made me look good. He made me look healthy. And people think I look handsome.
You are. Everybody feel you are handsome.
Dr. Wang, I didn't have a facelift, I had you.
Thank you. Acupuncture definitely helps the facelift. Dr. Wang here.
Oh, Dr. Wang.
Wang, it's a
Dr.
Wang
Wang,
show.
the
He's the president and also the
president.
founder. Yeah. Everybody use the English already speak a lot. We have the special guest use Chinese speech 1 to 2 minutes from the Malaysia. It's a very famous, world famous. We call her the 神仙姐姐李叶老师。好，请您说2句，李叶老师。2 minutes just. 李叶老师，请开始，请讲。
网速比较慢，他可能要
他要迟一点。
对。
哎，请大家打开视频啊！等一下我们集体照相，请你一定要打开视频，我们才能集体照相。李叶老师，请你讲了，请你讲2分钟。
我没有什么可讲的。
讲一点你神奇的案例就好了。
我们在马来西亚哈，就是看这个像新冠的，还有呢就是新冠的，我们一般呢是西医不让介入。不过我们看中风的是蛮多的，可是如果我们看新冠的话哈，都是远程的，有很多国家真的是非常非常出名的医生过来求救的，尤其是前年、去年。我记得有一个非常重要的一个政要哈，他的保健医告诉我说没有办法了，他的那个血压降不下来，还有呢就是高烧。我一看舌象，这个舌象是经过他们很多层去给他这个什么哈，就是审批，最后只拍了半个舌象。我说他的这已经到肺纤维化了，而且他们是2夫妇得了，60多岁。这样子都很危急的，肺里我说还有心肾功能不好。后来我就让他，我说你拍一下这个舌象哈，我说能不能拍穴位？他说拍不了。我就给他几个穴位，他呢针上去，这个呢高烧就降下来，而且没有再升，不断的降下来就好了。还有一个呢也是美国的挺出名的医生，也是这样告诉我以后，他就可以拍穴位，我让他拍出穴位来，拍出就是比如说这个手，这个合谷内关的地方，我让他拍了，我给他画出来，画出一个区域，像我们的穴位是开穴的，不是一个照着图这么一个图示哪个点不是固定的，而是他得病的时候，他有开穴两边，我看在哪边。在这个开穴这个区域画出来以后，我点在中间。我记得在刘大和校长那边的，就是那个第一次我去这个三藩市的时候讲，给大家都画过这个是非常准确的。我给他画出这个点，画出点以后呢，他就是给针刺了，马上呢就下降了。他们家也是全家得了，是去年，今年的都比较轻。好像是去年还是前年，前年那波和去年有一波，就是德尔塔那非常严重，所以呢，针灸的效果是非常神奇的。如果我们治疗中风也是很多呢，我们就是我在马来西亚可能比较特殊，就是经常有人就是很出名的哈，就是政要或者是商界的圈子，他们比较高层的会同意。让我去到医院，一般是医院不让针灸的，但是呢，他们因为有地位，就可以呢让我们进到这个急救室，就是 ICU。我们给针灸以后，基本上哈，只要我们在那里做的，一个是转危为安，一个是呢他康复特别快，甚至呢很多都没有后遗症，只要他后期跟着来做复健治疗的效果都非常好。我那天讲座时候，大家也看到了。有很多人就是肌力零级的，最后能够恢复到正常。好了，我讲完了。这个针灸是中国的传奇，不是我个人的传奇。谢谢。
Rose, please translate a little bit for the Dr. Lee's case.
Well, Dr. Lee actually is very humble. And Dr. Lee, you're in Singapore? Thailand. Yeah. Oh, Malaysia. You're from Malaysia, and you're acupuncture doctor in Malaysia, right? And you have successfully treated some of the COVID patients. And my apology, I didn't write down all the little details. If you can speak English, you can briefly summarize.
翻译是你最为的痛。那个谁，副院长给我翻译吧。我的英文也很差。
Actually, just made the very difficult case change to very easy. That's why in that country they very respect her, let her go in the hospital because regular the Chinese doctor cannot go to the Western hospital to treat the patients. But she have the special power, special pass. So she's amazing doctor and also won the world.
Let me transfer the Dr. Lee because I think 5 years ago, the Dr. Lee invitation us to visit the school, University of the school to have a seminar. Yeah, we have very successful case, just like she shared a high fever. And usually high fever for her, just one needle, and the fever is gone. And then also she shared the one needle location on the her area, but important that she emphasized how to know the open this points. So she can watch it and how to open and teach you how to open. That's very important.
Mary Jo, 1 minute. Mary Jo.
Many successful cases we saw.
Mary Jo, you speak 1 minute.
So just translate for everybody.
Okay, right now let us give the chance to the president of the Alabama University, the Mary Jo, speech 1 minute, please.
Well, we are offering a range of degrees to support all the things that we've been hearing for these last 3 days. And that includes 2 degrees in acupuncture and also complementary integrative health. In addition, we have certificate programs that can help prepare people. And the things that I was describing as I've worked with indigenous healers in multiple countries alongside doing energy therapies and my traditional work as a clinical specialist in psychiatric mental health nursing, that it's offered that there are many things that can be done that complement our current healthcare system. And that's what I'm actively working on. And the university is fully dedicated to accomplish that goal. And we're starting through the Global Healing Alliance that I mentioned that Dr. Effie Chow, Rose Hong and I helped start together. The goal was really to unite healers throughout the world with different orientations, different focus, different expertise, both including practice, research, and education. And that's what we're dedicated to and continuing to carry forward.
Thank you, Mary Jo, so much. So right now we will invite the Canada, the president and the chair with the acupuncture with 1 minute presentation because with time's limit. 黄主席，请您发言。
Okay, thank you guys. Thanks for having me. To have a little bit, that talk about the Chinese medicine and acupuncture in Canada. I'm in Winnipeg, Manitoba, that center part of the Canada. I have been practicing that acupuncture and Chinese medicine almost 20 years here. Basically, right now I use acupuncture and Chinese medicine to treat all kinds of, disease. That whatever sufferings, I say that I can help them. Typically, the last almost 10 years, I'm starting using we call mini Zen acupuncture, which is tiny blade needle to working on the scar, the healing tissues, and the trigger points to treat the pain. I think I achieved the very big success because most of pain patients come to my clinic. I can say maybe 99% chance, to getting better. And also that it is very effective, usually that with the 3 to 5 minutes treatment, and the patients, we're getting better right away. So that, in the last, few years, I get all patients from referred from the family doctors, chiropractors, massage therapists, physiotherapists, because they know in my city, I'm the person, I can fix those kind of complex, the pain disease. So also that in the last few years, I'm promoting.
Sorry about my technician, the problem. So right now, let us give the chance to the Dr. Wang. The Dr. Wang's here, so we use this computer, no problem. So Dr. Wang, you need to face this, you talk, no problem. Somebody can see you. So please, Dr. Wang, talk something.
Okay, thank you. I think today's forum is wonderful and appreciate and thank you. I just wanted to do the simple summary for the forum. I have 3 words share with you. First one is the acupuncture and the Chinese medicine have good and wonderful results. The second word would be like share with you. Everybody should be learn the acupuncture, the Chinese medicine, and the Oriental medicine. That means we have right now have the public, the education. Also, we have the degree education, for master program and the doctor program. Yes. And I think everybody should be learn. And also a third word I should be say, the suggestion, if you have any health problem, you should be first to try the acupuncture and the Chinese medicine. This may strongly recommend to you. Okay, I think it's just everybody, every doctor and the professor talk about the acupuncture Chinese medicine, the good results. For myself, I want to introduce, share with you. MD in China and 53 years experience. And I think about 100,000 patients in my clinic every day. Over 50 years every day with the patient in my clinic from China and America. Okay, I think a lot of patients get good results. For example, just George, my patient, he gets the good results. Also, I would like to share with you another patient. The one patient is sciatic, is severe sciatic. They want to do some surgery to the Western medicine doctor, but he's already 5 years, cannot walk. And during come my office, he is I use acupuncture and the hand work. And after one treatment, he before cannot walk and use helper can walk, the difficult, but after one treatment, he can strongly walk, go to my office. And also before he is the urine and uncontrolled. And right now after one treatment, he can control. And also he cannot go to sleep and in the night. But after treatment, he can sleep. Before he's angry very easy. But after one treatment, he is more calm and peaceful. Okay, this is my patient. I think a lot kind of patient. That's why he first treatment and I think time go to my office. He said one word: acupuncture Chinese medicine, amazing, amazing. Yeah, that's true. Okay. I have a second words is share with you. Many people, because acupuncture Chinese medicine is from the China, from Eastern. Many Western people do know acupuncture Chinese medicine. That's why our World Federation of Integrative Medicine Health, they have this conference. That means tell more people, if you want to learn, should be go to university to learn more knowledge. What is acupuncture? What is herbs medicine? What is handwork? What is Tai Chi, Qigong, carping, and so on. Okay, I would like suggestion everybody should be to learn. First one, you can public education. Also, you can go into degree, master, and doctor program. Okay, this is the second word. The third word is I would like suggesting how global people. If you have any kind of health problem, disease, and or some ways not effective, or you want to get a good result, prevent any kind of disease, or you're going to health level, get a good high intelligence and a whole quality of the life. Okay, I suggest you go to see acupuncture and Chinese medicine clinic. Maybe you can feel why it's wonderful. You can save a lot of money, and you can save a lot of time, and you can save a lot. You can avoiding any kind of hurt and pain. Okay, that's my third suggestion. Okay, by the way, I want to say acupuncture and Chinese medicine is good, wonderful results. Second one is I would like you learn, and we need a strong team, doctor of Oriental medicine and Chinese medicine. And last words, if you have any health problem, please go to acupuncture clinic or school and to help you. I believe we can help you. Thank you.
Oh, wonderful, Dr. Wang. Very good presentation. And that's let us some American person, you can see your face there.
Oh, excellent.
And then you can talk about it.
All right. Hey, everyone. My name is Peter Makagon, and I'm a student here at University of East West Medicine. So just wanted to share with you a little bit how I got here. I had some health challenges, and I tried Western medicine and didn't get much success. So I started to explore TCM and got interested in it. And eventually during 2020 pandemic, I decided to enroll to University of East West Medicine to master's program. And it's been a really amazing experience for me. Yeah, I started to apply the knowledge I was getting there to my own health. And I started to feel stronger with more energy and a lot happier. And then I also started to apply this knowledge to my family and helping people I love. So just maybe a little bit about the school. So I really appreciate studying here, appreciate all the faculty and all the professors, all the teachers who are here. And the school is located in the center of Bay Area, very easily accessible, and has a great schedule. So very possible for me to combine my other daily activities with studying. And I also enjoy working in a school's clinic. We have a wonderful clinic here. It's very spacious, allows to treat many patients at the same time. And we see patients for a variety of health issues like pain, back pain, shoulder pain, hip pain, headaches, some internal issues like stomach discomfort, headache, also mental health issues like depression, anxiety. And it's very impressive that many patients who come to our clinic, they get benefit from the treatments. We see a lot of improvements, and many patients continue to come back and improve their healing. So all in all, it's really a rewarding experience to study and to begin to practice Chinese medicine in a school clinic. And then just one other thought, I'm noticing that TCM is having a really global adoption. Like a few years ago, WHO approved new ICD codes and that have TCM, and it just acknowledgement of Chinese medicine by a global medical community, which is, I think, is amazing. And like, I'm really looking forward to graduating and beginning to practice Chinese medicine. Thanks, everyone.
Thank you very much. So everybody already speeched. So right now we will change to another place. Have a lot of people have the very happy event and waiting for us. So let us beginning move to another room. Thank you. Thank you. Thank you. When this moment I share screen, you guys go to another room. Thank you. A lot of people waiting there. Okay, we will see very quickly. Let us share screen. Then we will.
Dr. Fu, there's no sound.
No sound? Okay. Still no sound?
I don't hear sound. Oh wait.
They have sound.
When I talk to the neurosurgeon.
Okay. Oh, starting to hear sound now. Yeah, it doesn't seem to be working.
Dr. Fu, we have no audio. 没有声音，傅博。而且这个 video 已经放过了。
Well, while we're waiting, I just thought I'd mention there was the discussion of COVID-19. There was a study that came out that showed that the frontline healthcare workers during the COVID crisis that had higher T cell counts were much less likely to contract COVID, and also much less likely to have a severe case of it if they got it. And there was a UCLA study that showed that Tai Chi boosted T cell counts in the Tai Chi group by 50%. And so that was a really huge finding. And so that makes a conference like this so important to get this science out. And so I thought I'd just mention that while we're waiting to work out the sound issue here.
Yeah, thank you for sharing that data, Bill.
Yeah, it's very exciting. Yeah.
Yeah. Well, indeed, especially most of our healthcare professionals working frontline, dealing with patients every day.
Mm-hmm.
And as you know, in China, also Chinese doctors, their morning routine is to take the herbal medicine and to help to prevent the infection as well.
Mm-hmm. Mm-hmm.
Dr. Fu, we still don't have audio. 傅医生，我们还是没有声音啊。
Yeah, I noticed. Yeah, at the beginning of the COVID crisis, I saw an article on that some Russian hospitals were using Tai Chi and Qigong in their COVID units.
Wonderful. Bill, also, I know last year during Tai Chi Day, along with Dr. Chow, we have measured the energy on that special day. Would you like to mention that? I thought that was.
Yeah,
me too. Yes, it was incredibly fascinating.
Yeah, Rose, depends on you right now. You try organize a little bit, and we will try find it a larger size.
Okay. All right. So our Dr. Fu is trying to resolve technical issues. Bill, will be fast if you can share the measurement last Tai Chi Day.
Yes, I would love to do that. Yeah, I don't have the chart, but we do have the data charts that you can see. If you go to globaltransformationproject.org, you'll see that. But what happened was Princeton University discovered that people's consciousness, people's minds could affect their computers. And so what they ended up, their study expanded, and they eventually had computers all over the planet. And what they found was that when masses of people around the planet went into coherent consciousness during times of crisis, it would affect what they came to call the global consciousness. There's like a global consciousness field, and they could see the measurable changes in the global consciousness when a tragic event would happen globally. And so then what they did eventually was they started studying organized events that were.
Bill, hold on 1 second. 傅博，麻烦你把你的那个麦关掉。
Yeah. So eventually they started studying organized events. And so they studied World Tai Chi Day, World Yoga Day, World Peace Day, different events like this where people came together in connection for health and healing. And what they found was that on World Tai Chi Day, for that 24-hour period, we created a greater coherence in global consciousness during that 24-hour period that was measurably statistically significant. And they found this repeated with these various mind-body events like World Tai Chi Day and World Yoga Day. And there's other studies on meditation that have found when you get a very small percentage of a city's population practicing high-level meditation, it actually reduces the violent crime rates for the whole city. And there's been huge studies, like a 48-city study, and they found that effect in all those cities, and it lasted for 5 years after the study. They still had lower crime rates than the other cities, the control cities that didn't have the meditation programs. And so the fact that World Tai Chi Day actually created greater coherence in global consciousness, this really bodes well for the world, because what the researchers at Princeton found was that events that were organized that were around healing and compassion affected the global consciousness field more powerfully than tragedy and horrific events did. And so that's a really hopeful thing for the planet. And it shows you that when we practice these mind-body practices like Tai Chi and Qigong and meditation, we're not only benefiting our own health, but we're actually having an effect on the global consciousness. And so that's a very exciting thing. And it validates the whole concept of Taoism, the Taoist concepts of Tai Chi and Qigong, of, the universe being connected, which it is. Science is proving so many of these ancient concepts that were pioneered in India and China. And so it's a really extraordinary time to be doing these things, because the science is validating these ancient truths that, when I first started doing Tai Chi and Qigong, really, I have to confess, I thought some of these things were like fantasy, like pretend, these concepts of, universal energy and connection to everything. But the science is proving that these Taoist concepts and these Taoist principles are scientifically accurate. And again, it's very hopeful for the planet.
Well, that's truly remarkable. As the Chinese medicine has been around for almost 4,000 years. Yes. And at a clinical setting, we know Qi and energy. And of course, we have seen demonstrations. Your mind can, when you focus using Qi, you can move objects without touching. That's clear demonstration of energy. However, until now, the modern science, especially Western scientists and researchers, start to using a modern technology to, as you said, validate this.
Jennifer, 现在有两个角度了，两个角度看到了吧？
Hi, Jack. Oh,
okay.
Sorry.
Anyhow, so I think those research and truly validate and prove that those ancient practices and teachings are working, and we just didn't have the modern science to validate it, to document it. And so it's truly remarkable for the
and for us, what's so exciting is that now that we have the science, and the science is overwhelming, it shows that we should be teaching these things to school children in from kindergarten all the way up through 12th grade in age appropriate ways. Because it would save the world trillions of dollars in future health costs, and the science shows this. But it also shows that it would create a better education system around the planet, because the research shows that mind-body practices increase student IQs, they improve test scores, they improve GRE reading scores, they improve math proficiency skills. And so, when we're educating students, the brain, the consciousness is the foundation of where whatever education processes we're going to do are going to be effective or not effective. And so we have the science. We know that school children could benefit greatly from this, and it would just untangle so many knots in society. It'd be like watering the root of humanity to give students around the world tools to create a more coherent state of consciousness that would unfold in their lives. But it would also change, in Taoism, it says, the individual consciousness makes up the communal consciousness. The communal consciousness makes up national consciousness. Yeah.
Well, kudos to you for your effort and also your proposal to teach our youngsters at the school level. And in Asian countries, some of the teachings are being taught at the elementary grade schools. But however, in the Western schools in America, for instance, and traditional Chinese medicine principles are not being taught. But when we're facing the challenges, global health challenge, COVID, and the budget at every country, and it's very exhausting to deal with COVID-related preventions and treatments. And I think this is a good time to continue the push and promote and public education from the grade school from children.
To be able to boost global immunity by training public school students all over the planet on mind body would take a tremendous strain off of future health crises that we have to deal with, because all those kids would have much stronger immune systems, and then they would process viruses for the greater good of society, because they would be less affected by them, and viruses become less virulent as they spread through society. And,
well, the assessment from the medical professionals we're not safe until everyone around the world is safe. And we'll reach everyone around the world. and medication is immunization is one way. However, teaching everyone to practice Tai Chi Qigong at home is really the way to go, because it doesn't require much money, much space.
Mm-hmm.
You can practice literally in your own living room.
Yeah.
So this is the best way to strengthen each person's immunity so we can control COVID or any other future viruses.
Yeah, absolutely. Yeah, well said. And so the thing that people can do to support this United Nations resolution for mind-body practices to become a core part of public education around the world is they can go to the website globaltransformationproject.org, and then there's a petition that you can sign. And then when we approach the United Nations missions, we'll provide them with the petition signers so that they see that people all over the planet support this idea.
Wonderful. Thank you, Bill, for sharing your work.
Thank you.
Your wisdom. Now, we'll bring you on site. This is in California. School of International Traditional Chinese Medicine. As you can see,
我们的晚会马上就将开始，请王丽珍教授、所有的嘉宾、所有的领导、所有的国际医药大学的师生，请尽快入座，保持安静和会场的安静状态。谢谢大家的配合。
Okay, as you can see, we gathered both faculties, students, and parents.
领导、来宾。尊敬的所有的在场的朋友们，大家晚上好。由我们旧金山硅谷国际医药大学世界整合医学联合会在硅谷的当地，我们的现在的总会场所举办的大健康之夜、全民之夜、圣诞晚会、新年晚会，现在就将开始。我们知道，为了筹划这次的世界整合医学大会，为期6天的时间，来自5大洲10几个国家，所有的中医学会的会长已经紧张的筹备了3个月的时间。所以，我想在座的所有的朋友和嘉宾，让我们为我们线上所有在殚精竭虑、在竭尽全力、在热烈讨论主题论坛的所有的线上几千位朋友，致以最热烈的掌声送给他们，好不好？谢谢大家。我们今天呢已经是会议的第2天了，今天是英文的论坛。我们呢今天在深圳的分会场也将有上千人的论坛，在深圳的保利酒店，所以我们是线上线下同时进行。所以呢，我们今天的晚会将分为6个重大的环节。我希望每一位朋友都不要错过每一个珍贵的、非常好的这个重头戏。那么，首先第1项环节就是我们今天首先要进行一个颁奖仪式。我们将为所有的组织者、策划者和我们所有为世界抗击新冠疫情做出杰出贡献的人们颁发奖状。那么另外呢，我们也将进行第2个剪彩的环节。在剪彩的环节呢，我们将宣布我们国际医药大学和世界整合医学联合会所要颁发的、所要落地为幕的10项组织落成典礼。为我们明年的3月3、6月6、9月9，我们的荷语徽菜日，我们的荷语大礼军做准备。好，那我们的第3项呢，就是文艺节目。今天虽然有很多的艺术家和歌唱家没有来到现场，但是他们都从远方给我们发来了最美丽的问候，也有来自 CCTV 线上的主持人的问候。我们稍后在第3个环节都将为大家从大屏幕播放，也有来自当地的艺术家党伟光，还有原《西游记》86版的信仙的扮演者王林华为我们发来贺词贺电。那总之好戏都在后面。好了，我们第4项环节呢，就是我们有个抽奖的活动。我们有这个温艺玲女士为我们准备了9个水晶，我们现场会有个抽奖的环节，所以大家千万不要轻易的离开。那同时我们第5项呢，会有一个太极的表演，在文艺节目穿插的同时，会有我们所有这个老骥伏枥志在当秋的医者为上的上医人士为我们进行精彩的太极的表演。 我们的第6项呢，就是我们最后的大合营和会餐。所以我刚才说了，不但有精神思想的盛宴，还有我们今天晚上的养生的盛宴。好了，那么下面我们就将开始我们今天大会的第1个环节，就是我们的颁奖。现在我念到名字的嘉宾和我们的领导请上台。首先让我们用隆重的掌声来邀请我们萨尔托嘎的副市长赵烨女士，大家掌声有请。让我们以热烈的掌声有请福瑞梦的市议员邵阳先生，大家掌声欢迎。让我们用隆重热烈的掌声欢迎我们来自北京同乡会的我们侨联的非常尊敬的我们的何大姐，也是我们侨联的委员，大家掌声欢迎。好，下面让我们以热烈的掌声来欢迎我们美国中医工会的副会长张丽丽博士，也是我们的社团名人，有请。下面有请我们国际医药大学的创始人，也是我们此次世界整合医学大会联合会的主席王英秋博士，有请，掌声。我们也用隆重的掌声来邀请来自南加州的我们的美国武林医院的院长，也是我们世界8段的傅学礼博士，也是我们这次世界整合医学大会的执行主席，傅先生有请。好，那还有我没有念到名字的吗？请问？好，请将我们的对，好，那大家给他们这各位专家和领导嘉宾致以掌声，谢谢。好，那么现在我们就将颁奖。我们今天呢有组织奖和个人奖。我们的组织奖呢，我们将颁发世界抗击新冠疫情的杰出贡献奖。同时呢，我们因为举办这次大会啊，我们有来自欧洲、澳洲、英国、加拿大、世界5大洲的10几个国家的专家和院士们都在线上。所以呢，没有飞到现场的，我们将会念出名字。那么到现场的呢，请大家上台领奖。好，那首先让我来宣布名字。没有飞来现场的有法国太极生意成功的朱冕生主席，他也是世中联的副主席，全欧洲中医药的专家联合会主席。让我们把掌声送给远方在线上的他。我们要颁的第2个奖呢是澳洲中医药学会的终身会长郑建华先生，让我们把掌声送给线上的他。我们要颁的第3个是全美中医药学会的 ATCMA 的会长田海和先生，让我们把掌声送给线上的他。我们要颁的第4个奖是来自欧洲科学院院士黄正明、朱正高和方方江，让我们把掌声送给远方在线上的他们。我们还要颁发牛津大学的博士、亚太科学院秘书长张彩芳女士，把掌声送给线上的她。还要颁发我们这次大会的学术委员会的主席江丹主席，以及大会专家委员会的主席陆彪主席，在前2天的线上和新闻发布会上他们都出现，我们把掌声送给他们。对，都在大屏幕上。好，那么我们今天呢还有个人，你知道大疫3年，我们无论是中国、美国还是世界各地、全球，
抱歉漏掉了一位啊，这个4中联的我们的这个投资专委会的
sorry， 他们没有。
焦顺华老先生，
来，焦老师，请您上台，谢谢。我们把掌声送给焦老师。
这是传奇人物啊，54年发明的投针和我年龄一模一样。
谢谢。
对，焦老师，
谢谢。
年龄最大，名誉主席，我们的名誉主
谢
席。
谢。
对，这是传奇人物。
好的，因为我们今天现场还会有现场采访的小环节，所以我们的传奇人物会讲述他们的传奇故事。好，我们的摄影师，我们的所有镜头准备好，送给所有的组委会的朋友们和嘉宾朋友们。好，那我们下面将颁发的就是获奖的个人，我念名字的，请你们上台。有傅学礼，还有詹玉甫、胡白雪、翁启修院长，也是我们这边国际医药大学的这个太极院的院长，还有詹玉甫林，也是我们国际医药大学的太极院的继续教育学院的院长，这都是我们的元老。还有池浩和，还有刘贝副校长。 朱耀刚，还有邓丽峰、党伟光不能来现场，还有杨丽颖、尹明杰、万国志、王烈珍教授，请您先上台，谢谢。还有 Peter Margot。刘大和、朱迪、彭晓玲、焦顺发。请我们的摄影师、我们的摄像机所有的镜头对准我们的主要嘉宾和获奖单位及获奖个人，请大家站好，对。
往前一点点，差不多是花的。对，这样。
中间往前还是边上往前？
边上没问题，中间没有。
中间往前。
哇，现在好，
听清楚了。
好，大家精气神出来啊！我们都是练武的，还有那个专家。
中国针灸棒不棒？棒，我们大家举个右手好不好？1、2、3，中国针灸棒。中国针灸棒。我来，中国针灸棒不棒？棒。再来一次，中国针灸棒不棒？棒。都没劲儿了，来点气嘛！中国针灸棒不棒？棒。好，谢谢。
好，非常感谢大家啊！让我们把掌声送给他们各位专家，谢谢，非常感谢。那我们今天的获奖者不能飞到现场的，就刚才我说的有美洲、亚洲、欧洲、澳洲、非洲的各界代表。那我们将在12月21号闭幕式的时候给他们颁发奖状。刚才我为大家宣布的我们世界整合抗疫杰出贡献奖的单位组织有美国中医工会，中医工会的张丽丽博士已经到现场，刚才上台了哈。还有我们美国国际医药大学的刘贝副校长您带领了，还有美国高校太极联盟的翁启修主席，以及市中医头针专业委员会的焦顺发会长啊。还有我们获奖组织者有美洲、亚洲、欧洲、澳洲、非洲的学术组织，我们会在21号为他们闭幕式上颁奖。好，那我们第一个环节的颁奖环节现在暂时告一个段落。第二个到了我们今天的剪彩的环节，也是我宣布名单的所有的嘉宾和领导，请你们上台。那再次用掌声来有请我们的何红华大姐。何红华大姐这些年真是在我们社团是非常有威望，是非常值得我们大家敬重，也是作为我们侨联在海外队员。谢谢何大姐。谢谢。好，那么有请王英秋校长，这都是我们的老字辈，老骥伏枥，志在当秋。好，有请张丽丽副会长啊，张丽丽博士也是，真是在社团每年进组大典啊，每年真是社团都是默默付出了太多。还有来傅学礼博士从南加州亲自开车赶过来。好，
这样好。
好，有请我们的邵阳议员，邵阳市议员前几天刚刚宣布落成，也是真的是弗雷曼是我们人均居住我们这边华人最喜欢的城市之一，治安也是最好的城市之一。之前也是我们弗雷曼的副市长。好，下面也是非常有请我们非常有威望的，在我们社团当中非常响当当的赵燕女士，赵燕议员、赵燕副市长，萨尔托嘎，有请。好。那我们现在呢，就将进行剪彩，请我们的工作人员将我们的红丝绸彩带拿上台，谢谢。请问刘大和在吗 ？Peter、焦顺发也请你们一起上台参加这个剪彩仪式，谢谢。还有王烈珍教授，剪刀，请工作人员将我们的3个剪刀，因为我们有三花。
没问题。
只有3个，只有1把。
他想要把一个
校长就好。
不显然
比一
好
下就好。
可以吗？
好，所有的摄像机、摄影机，所有的焦点对准了
可
cos，
以的话给我
让我们
打一个
大家来一起 1 2 3，开始剪彩落成，大家掌声，非常感谢，谢谢，非常好。那么我们的剪彩项目落成呢，我们将为大家宣布10项我们上医联盟所要在这次大会当中，经过大家的不断的研讨。
赵美新议员的奖状什么时候发？
赵美新议员的奖状待会儿发。
好。
好，那我们剪彩项目呢落成，我们会有王英区校长来宣布，我们有10项的落成。我们知道，在疫情的3年当中，所有的人经历了非常多的重创，很多的家人在意外的灾难当中失去了亲人，他们是怎么走过这种悲痛的心情？我想在座所有的朋友都是可以体会的。现在终于刚刚的开放，所以在这个时刻，在这个时机举办这个世界整合医学大会，真的是应景，也真的是兼济天下，兼济苍生。所以呢，我们国际医药大学和这次的世界整合医学联合会特此要在明年落成这10项的重要基地。那下面有请王英区校长来为我们宣布，有请。
大家好，刚才我们剪彩项目呢，包括了临床医学院、世界整合大医馆、国际医大健康管理学院、健康520电视栏目、整合医学专家团、国际医大联合诊所、西医学研究中心、世界疑难病会诊中心、整合居家医院、高维生命康乐园。刚才这个选了10个单位，大家都知道，我们世界整合医学会联合会是整合整个的医学体系，包括中医、西医、音乐医学等。同时，我们还把3维医学整下6维医学，到达9维医学。这是我们这次第6届世界整合大会和新冠并发后遗症论坛的一个主题。那么我们刚才宣布的10个单位，就象征着把我们的梦想和我们的目标落地。有这10个单位，就可以将来真正达到我们的医学高维度。那么未来的医学就从我们这次大会开始，从我们这个地方起步。谢谢大家。
谢谢王校长。看到王校长每次这样挺拔的身姿和英姿飒爽的身影，你们能知道他年龄多大了吗？我告诉你们，自己上谷歌去测试。真的是他练气功和太极，其实我也是他的一名病人，在疫情当中经历了严重的亚健康，真是在中医大学受益匪浅，所以从一个病人转化为今天的义工。谢谢大家哈，小插曲。那刚才呢，我们的这个助理呢，白雪告诉我们落掉了一个小小的环节，就是我们除了颁奖之外，还要给大家颁发证书。所以王校长，请你现在给大家颁发一下证书。刚才我们验过名单的人，麻烦请你们再次上场一下好吗？给你们颁发证书，谢谢大家。那就我们所有前排的主席台的嘉宾，请你们继续再次上场，三生万物，谢谢。
代表一下这个从中国来的4中联真刀专委会的这个卢远硕先生啊，
欢迎你卢先生，请上台。
叫了大家都上台。
来，那我们所有前台第一排的主席台的嘉宾，还有我们的议员，还有我们的这个专家，我们的侨领都请你们再次上台，谢谢大家。
我是专家吗？
对啊，你是啊。
您还在您原来的位置。
来有请龚院长上台，林院长上台，谢谢。好，那我们念到名单的呢，会由我们的助理交给王校长，还有我们的赵副市长，以及我们的邵阳议员和何大姐，还有那个张丽丽会长给他们来颁发，好吗？好，那我们现在就来挨个的念名字。好，那我们念到名字的傅学礼、詹妮弗胡、白雪、龚启修、张海生、介辅林、石浩和、刘备、朱月刚、邓丽峰、王伟光、杨丽颖、尹明杰、万国志、王丽珍、Peter Migray、刘大和、朱迪、彭晓玲、焦顺发。我们念到名字的，能够在现场的，请你们站到台前。有我刚才说的我们的邵议员，还有我们的赵市长，以及王校长、何大姐和这个张丽丽博士给他们颁发。
然后请后台的大师们、嘉宾们给我们发，我们可以连。
好，我们现在就是进行一个仪式啊，先都发到大家手上，如果名字有搞错的，下台以后再整理就可以。
对，全部拿上，然后呢，请议员发奖的站中间，我们这样就大家都拍了。
关老师的，
没关系，随便先拿着。他们就是没关系，来，议员们站中间，给我们发奖的站前面。
我们还是侧一个肩膀。
对，
侧个肩膀，哎。
稍微侧一下，然后给我们的摄影师、我们的现场的摄像，我们因为今天还有现场的转播，给他们留以空间可以拍照和拍摄。我们先拿上，下台以后再慢慢整理啊！谢谢大家，抓紧时间。好，大家往一起凑一下，谢谢。
年纪轻的交给你，这个在下面。
年纪轻的我在前面。
你看我看，机器你看。啊？不是这个太快。站两排，就这样照，
没事，赶快照了就行了。
好，我们现在来1、2、3啊 ，1、2、3，镜头，还有我们的现场的录制啊，还有我们现场的转播，来。王校长上来，怎么来？请王校长上台。
发奖的人，你站中间，站正中间。对，你就站正中间，对，这样有个这个活动要没有王校长那么大力推动。
好，请我们所有的摄影师、我们的摄像师、我们所有的镜头对准我们所有的中场的 C 位的焦点。
1、2、3 1、2、3，笑。好，谢谢。
谢谢大家，请大家落座。
那个白雪，你试一下一个一个的发，你看对了的就可以。
好，请大家到下台以后，那么再慢慢的一一核对，谢谢。
不太一样，它那个颜色这个设计的。
好，那我们刚才的2个重磅环节就已经刚才已经结束。那现在进行我们今天晚会的第3项，也是我们大家非常喜爱的、非常 relax、easy、轻松的时候，就是我们今天的节目环节。对， 那在节目环节之前呢，也有请我们傅博士上台来宣读一下我们的加州众议员赵美心女士发来的颁奖证书啊，这次贺词贺电。那稍后也会请我们的赵燕市长也上台为我们宣读一下为我们所写的议状，还有这个 Fremont 的这个市议员邵阳老师也请上来，谢谢。我们把话筒交给赵市长。
在这里呢，我代表赵美心来特别发这个贺状给我们王英秋校长、王英秋博士。那他在这里说 ，In recognition of your excellence and outstanding achievements, your unwavering commitment to education and innovation in medicine has made a positive impact on the health and the strength of our communities. Congratulations and the best wishes in your future endeavors. 王教授，
谢谢。
中文讲一遍，我们议员中文讲。
我们所有的那个摄像师、摄影师对准我们 C 位的镜头，谢谢。好，把话筒交给我。
好，我是福利蒙市市议员邵阳，在这里代表赵美心国会议员颁发给傅学礼博士 Jeff Fu 一个嘉奖令。那刚才赵燕副市长已经读了英文的贺词，那贺词是一样的。那中文这边的贺词是仅此来表彰您杰出的贡献和卓越的成就，您对于教育创新毫不动摇的委身，以及在我们的社区里面做出了正面积极的贡献，仅此祝贺您，并祝您未来大有成就。第6届世界整合医学大会2022年12月16号。好，我们先请傅博士上台。
校长你也上来，请市长也一起。
对，来，也请校长一起上台。
好，来。
你们往这边。
那我们2个站中间了。对。
往这边来一点，往前。我们所有的摄影师、摄像师，因为我们现在线上线下正在同时进行，所以现在所有的镜头对着我们的 C 位。
好，另外我还宣布一下，这个奖状除了我们在现场的，还有在网上的陆彪老师也是，陆彪这里还有黄国健博士，还有他们都在网上。陆彪、黄国健、卢志鹏，卢志鹏是是香港、澳门和这个台湾促进会的那个医药促进会的会长，以及 UCLA 的许家杰教授，以及这个卢胜春，他的代表在这儿是我们4周年的这个征召专委会的会长，然后 Dr. Chu 就是许家杰，然后还有黄国健，加拿大中医针灸学会的联盟的主席，还有方邦江是危机重症专委会的主任，是抗疫英雄，还有陆彪。好，主要是这些都是赵美心议员发的。
那我们再次把掌声送给诸位的领导和嘉宾以及我们的专家，谢谢大家。好，下面由赵市长来宣读他为我们带来的议状和贺词。
各位老师、各位同学、各位嘉宾，大家晚上好。首先感谢王校长邀请我来参加今天这个大健康之夜以及这个圣诞晚会。我想这个我们很多人都很激动来参加你这个活动那我也想说，在这几年疫情非常严重的时候，这个疫情也改变了我们的生活。各位医生、各位我们中医界的各位人士，帮助我们所有这个湾区的人来治疗各种各样的疾病，用我们中医特有的方式。所以呢，我要特别感谢我们国际医药大学，不仅 积极参与我们湾区的各种活动，并提供义诊，也为我们湾区提供了培养了很多种各样各的中医人才。所以呢，在这里呢，我代表我们萨尔托嘎市特别感谢我们国际医药大学王延秋校长博士为我们湾区做出的贡献。在此呢，发这个贺状给我们王校长，请王校长上台。我简单读一下哈。Congratulations and thank you, Dr. In-Chu Wang and the University of East and West Medicine for hosting the 6th World Conference on Integrative Medicine on December 18, 2022. I commend you for your wonderful community work and the devoted efforts for promoting Chinese medicine and awareness in physical and mental health. I wish you continued success in the future. 谢谢。
谢谢，我们把掌声送给赵
宣布一下，还有一套奖状是来自于我们加州众议员的这个 Mike 朱的一套奖状，但是寄来晚了一点，没有带来。
好，那傅博士你来宣读，你需要宣读一下。
我就不宣读了。
好，谢谢，
到时候在网上发布就好了。
谢谢大家。我们因为今天稍微开始的有一些晚，所以稍微有一点点拖堂，但是我们的精彩重头戏还有30分钟可以欣赏。那刚才说完了我们的颁奖和我们的剪彩的2个重要的环节，现在第3个环节就是让我们非常放松的时候，享受精神思想盛宴的时候。那由来自我们今天我们本来是要现场的跟 CCTV 3星智力快车和健康到家的主持人黄杰进行一个视频的连线，但因为北京你知道最近的疫情非常严重，所以呢又加上我们现在的网络学术会在同时进行，所以我们原本计划播放他给我们寄来的小的宣传片花和小的视频，暂时不能播放。那这样让我现场连线他，听一下他的声音。王杰呢是我们中央电视台的百家主持人，大家可以上谷歌去 search 一下，也是主持了非常多的优秀的栏目，也是曾经跟春晚的主持人小倪李佳琦是最好的王牌搭档。好，让我们听一下他的声音，能不能从远方为我们发来。Hello， 王杰，你好。Hello， 能听见？哎，你好，黄杰。黄杰你好，我现在是在你能听到我说话吗 ？Hello， 可以呢。我们现在是在美国旧金山硅谷的世界整合医学大会联合总部的现场。旧金山硅谷国际医药大学的合议厅举办的现场晚会，我们现场有很多的议员、嘉宾，还有我们所有的国际医药大学的师生和美国的海外的侨联的朋友们，你给大家做一个问候好吗？谢谢。
世界整合医学大会呢，在旧金山硅谷隆重举办，海内外的专家盛聚线上，可谓是可喜可贺。在新冠疫情持续肆虐之际呢，举办这样的医学盛会，真可谓是给百姓、给我们的民生谋一份福祉，将我们中华传统的医学发扬了光大。在这里我们要预祝本次大会圆满成功。在这里最后祝大家新年快乐。
谢谢，非常感谢黄杰从北京，本来是要在中央台现场发来的贺词，特别让我们把掌声送给你，听到了吗？谢谢你的贺词。大家
谢谢。
好的，我们期待在电视屏幕上，谢谢你，谢谢你，我们也期待在屏幕上看到更多你的声音和你的形象，为大家 健康到家，传递到位。谢谢。那我们今天连线先到这儿，挂断。谢谢，再见。好，我们听到了非常真实的声音，谢谢。我们听到了非常真实的、亲切的声音啊，是从大洋彼岸我们的故国和母国传过来的。如果因为不是我们线上的论坛在同时进行，我们应该播放现场的视频，还有他所有主持的照片，但没有关系，我们假一赔十，大家可以在谷歌网上去search。好，谢谢大家。那么我们第二个环节呢，就请播放我们来自当地的我们要先播放来自北京电视台 TV520的贺词和视频，请问可以播放吗？
视频可能放不出来，可以放声音。
那可以，来，请在我们的话筒跟前放声音。这是我们刚才宣布的10大组织基地，明年即将落成的，来自北京电视台 TV520的贺词视频。稍等片刻，本来520的主持人也是不亚于 CCTV 央视，虽然我也知道我们海外的侨胞对央视是有些小意见，但是大家都是一份工作，尽心尽力皆好。好，那现在我们要播放520。我们如果细心的朋友进到我们的这个整个 University 的 building， 我们一进来会看到在左边大屏幕上有一个我们的制作好的一个520的一个 logo， 不知道大家注意到没有？待会儿下去可以在那补拍合影。那明年呢，我们会跟520这个健康栏目会进行遥控和互动，同时明年我们在3月3、6月6、9月9都将有系列的活动，何以璀璨日、何以大义军、何以大联盟。非常非常遗憾，因为他发来的视频也是因为网络的缘故，现场不能播放。但是我们把这份情谊和心意收在心底。好了，那么第3个呢，就是来自我们清华，我们大姐就是从清华，老清华人，把掌声送给大姐，因为在硅谷我们清华校友会真的是龙头喝彩。好，现在我们可以听到声音是来自清华水木年华组合卢根须带领他的小伙伴在杭州的现场。前天为我们录制的完美世界，没有图像是吗？那就把声音播完吧，大家听听声音。大家知道李健是从清华水木组合单飞出去的呀。我们明年3月3争取请到李健，好不好？好，好了就给些掌声鼓励。好，你看卢根须清华水木年华组合唱的是完美世界，而我们如今生活在一个不完美的世界，尤其这个世界重大的疫情灾难的突发到来，改变了我们所有人的生活。就像刚才赵燕市长跟我们分享的，真的让我们每个人可能会突然感觉到无所适从。所以在现在的当下，我们应该怎样调整我们生命的意义？我们应该珍惜把握什么？我想这是在座每一位我们都需要思考的问题。那非常感谢来自于清华水木年华组合卢根须带领他的小伙伴为我们录制的完美世界。非常遗憾就是视频看不到，没有关系，假一包10，网上 Google search。谢谢大家。第4个呢，就是我们要播放我们本地的艺术家，因为最近感冒跟我们冠状病毒交织感染在一起，交错复杂，所以呢，我们今天本来有些艺术家就很遗憾不能来到现场。他们也有些就是师生的汇报演出。那么首先第一个为我们发来贺词贺电的，也是我们国际医药大学培养出来的当地很有声名和威望的一个歌唱家，大家知道是谁吗？猜一猜。男高音 ，yes， 非常正确，对，党伟光。能播放一下党伟光老师的视频吗？远方的不能播出，看我们当地发来的是不是网络给力一些能够播出。稍稍等一下啊。那党伟光之后呢，就是当地这个原上海歌剧舞剧院的青年舞蹈家王英华，也是我们86版《西游记》的信仙的扮演者，也是因为他路途非常遥远，家人有感冒，所以不能到现场，也发来了贺词和视频。 哦，谢谢赵燕市长，再次感谢这个福瑞梦的市议员邵阳先生，遗憾不能参加我们的合影，他们还有事儿。我知道他们今天早晨就在其他的大会现场，两个人在一起呀，谢谢他们。声音太小，也是看不到屏幕，只能听声音。那我们就听一下他的声音哈。
我要继续去直播了，那边是重点。
谢谢大家，大家应该听到了他的熟悉的声音，没有问题。来日方长，给我们留一些想念。所以在明年的3月3，我相信在春暖花开、万物复苏之际，我们所有的艺术家，无论是国内。
白雪他们自己也没有跟大特王
不管了，
对，
只要我们这边可以就行。
没有。
好，各位老师，我们现在回来了，我们继续我们的学术讲座。麻烦，然后把那个帮我插一下，那个话筒插过来。好，那边他们继续进行，算是一个娱乐节目吧。谢谢大家捧场。然后我们这边呢就继续进行学术交流。好，我们接着走我们的流程。哎，陈老师，陈叶梦陈老师，您在线上了吗？杨长青杨老师，您在线上吗？陈老师，我要拉您进来，可能是。
对，我在线上，但是我进不来。
是，您是说一下啊，陈叶梦老师，您点一下。哎，对了，太好了，我们完全按照正常的 schedule 在走。因为刚才有个娱乐节目在现场搞了一个，他们有搞了一个活动。陆老啊，你这个在那边，我们有2个奖状件要发给您。
谢谢。陈老师好，陈老师好，
谢谢陈老师啊，谢谢陈老师。我们大名鼎鼎，我们的中流砥柱啊，中医界的陈老师来了。
我们陆老在作证，
谢谢陈老师，那您可以 share screen。我来介绍一下，今天是英文的啊，陈老师。
对，yes。
Okay, so right now we will continue our presentation, and right now it's my honor to introduce coming from the New York and our all American acupuncturist the leader. It's Dr. Chen, Yemao Chen. That is everybody know his name if you're doing acupuncture. So he will give us a very good presentation, and every time he very support us. Review the past Pacific acupuncture long COVID, perfect acupuncture long COVID. Okay, so please, Dr. Chen, beginning your time, half hour.
Yes. Thank you, Dr. Fu. Thank you, Dr. Lu. And it's my honor to join this 6th International Integrative Medicine Symposium, Congress, sorry, Congress. It's very successful. Today I want to share my study about the review and the prospect acupuncture for long COVID. Yeah, that is a hot topic, and I will provide some kind of evidence. So the COVID already entered to its 3rd year. The pandemic is still not over yet. And there's a worldwide, the statistics, and you can see since January 23, 2020, total cases in the world exceed 645 million. But this number, I don't believe this number is true, is accurate. And the other number is far more than this. In the US, and you can see on the data, since March 2nd, 2020, and a total infected 98.7 million. Also, this number is not true. And a lot of people now just test positive by themselves, didn't enter in the data in the system. So it's far more than this. So since 2021, at the beginning of 2021, February 25, the World Health Organization already raised the issue about the long COVID. So this is the policy in the week of pandemic, preparing for long COVID. And this official document released by World Health Organization on February 25th, 2021. So in this document, it listed COVID-19 can cause persistent ill health around a quarter of people who have had the virus that continue for at least a month, but the 1 in 10 are still unwell after 12 weeks. This has been described by patient groups as long COVID. And they have a lot of other name, persistent symptom, long haulers, or lots of different things, but the WHO used the term long COVID. It is associated with a range of overlapping symptoms, including generalized chest and muscle pain, fatigue, shortness of breath, and cognitive dysfunction. And the mechanism involved affect the multiple systems and include persisting inflammation, thrombosis, and autoimmunity,